Good morning, everyone. Morning, all, and welcome to our Regional Council meeting of Thursday, November 26. We're going to start with a call to order and our roll call. Madam Clerk, over to you for the roll call and the protocols, please.
Thank you, Mr. Chair, and good morning, everyone. I'm going to provide a very shortened review of the protocols for electronic participation in this council meeting. Voting will be conducted verbally. For procedural votes that do not require a recorded vote, the chair or I will call for any objections. If you have an objection, please indicate your name and objection. If no objections are stated, the motion will be deemed to be adopted. For recorded votes, I will call upon each member in alphabetical order based on last name. I will confirm the vote for each member. If you do not respond when called upon to vote, I will call your name a second time. If you do not respond to the second call, you will be recorded as abstaining from the vote, and your vote will count in the negative as a nay vote. If you're participating electronically and are leaving the meeting, please send an email to council@peelregion.ca to indicate that you are leaving the meeting. If you leave the meeting for any votes thereafter, you will be marked absent. We shall now commence the meeting with roll call. Mayor Brown? Mayor Brown? Councillor Carlson?
I'm here, thanks.
Thank you. Mayor Crombie?
I am here, thank you.
Thank you. Councillor Demurla?
Here, thank you.
Thank you. Councillor Dasco?
Here.
Thank you. Councillor Dillon?
I'm here.
Thank you. And Councillor Downey is not here, but Councillor Early?
Present.
Thank you. Councillor Fonseca?
Good morning, thank you.
Thank you. Councillor Fortini?
Good morning, everyone. I'm here.
Thank you. Councillor Groves?
Good morning, I'm here.
Thank you. Councillor Innes?
Present.
Thank you. Councillor Kovac?
Good morning, I'm here.
Thank you. Councillor Mahoney? Councillor Mahoney?
Good morning, present.
Thank you. Councillor McFadden?
Good morning. Happy Thursday, everyone.
Thank you. Councillor Medeiros?
Here, thank you.
Thank you. Councillor Paleshi?
Good morning, President.
Thank you. Councillor Parrish?
Yes.
Thank you. Councillor Raz?
Present.
Thank you. Councillor Sato?
Here.
Thank you. Councillor Santos?
Good morning.
Thank you. Good morning. Councillor Sinclair?
Yes, present. I lost sound for quite a bit there. Thank you.
Thank you. Councillor Starr?
Present.
Thank you. Mayor Thompson?
Present.
Thank you. Councillor Vicente?
Here.
Thank you. And I believe I see Mayor Brown. Mark, he was present. Thank you very much. Over to you, Mr. Chair.
Thank you very much. Now, let me start with our Indigenous land acknowledgement. We would like to begin by acknowledging that the land on which we gather and which the Region of Peel operates is part of the treaty lands and territories of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land. In particular, we acknowledge the territory of the Anishinaabeg, Wendat, Haudenosaunee, and Ojibwe Chippewa peoples, the land that is also home to the Métis, and most recently, the territory of the Mississaugas of the First Credit Nation, who are direct descendants of the Mississaugas of the Credit. We are grateful to have this opportunity to work on this land and by doing so give our respect to its first inhabitants. The next thing I'd like to do at this moment, on behalf of myself and Raj Chopra, she's our chair, as many of you know, of the Accessibility Advisory Committee, it was brought to our attention that we lost a dear friend of the committee, Bill Gorski. Bill, many of you would know, and I had the privilege of serving with him as well. Bill was a dogged champion for people's rights and needs. A longtime resident of Brampton, Bill chaired the Region of Peel's Accessibility Advisory Committee, volunteered for many years with the Peel Region United Way, and most recently co-chairing 2 committees at the William Osler Health System. He accomplished real change for those with disabilities and was looking forward to the day when Ontario would be completely barrier-free. Bill, a great life lived, and we thank you for all of your service on behalf of all of Regional Council. Okay, the next item that I need, Madam Clerk, thank you, is to deal with the minutes. So I have a motion from Councillor Fonseca, seconded by Councillor Vicente, that the minutes of the November 12, 2020 Regional Council meeting be approved. All those in favor? Seeing none opposed, that is carried. I now want to go to the approval of the agenda, and there is one housekeeping matter that we want to deal with. I know a lot of us are on a schedule, and in particular, Dr. Lowe, who's been summoned by the federal government for some exciting news later this morning. So I would hope that with the consent of my colleagues, item 8.1, the COVID update from Dr. Lowe, and perhaps at the same time we can deal with Mayor Crombie's motion related to COVID as well. I would ask if we could treat that as our first delegation, then I will go to 7.1 and 7.2 and carry on from there. So that is what I would like to do. If I can get an approval for that agenda as amended, unless there are any other inquiries with regards to the agenda. And I have 2 on my list, Councillor Medeiros, then Councillor Parrish. Councillor Medeiros, in speaking to the agenda.
Thank you very much, Chair. I believe the regional clerk can confirm. We moved a motion yesterday at the City of Brampton regarding regional representation. And I know that the clerk sent the correspondence over to our regional clerk, and I'm just ensuring that that's an additional agenda item for today for discussion.
Thank you. And what I'm going to do is I'm going to have the Commissioner explain that. Councillor Parrish, I know you're on the list. Perhaps we'll hear the process, and then I'm going to go right to Councillor Parrish next. Madam Commissioner, go ahead.
Thank you, and good morning through you, Mr. Chair. Yes, we did receive that correspondence, but I'm proposing that it be added to the agenda for December 3rd. We did add that extra meeting next week, and we can add that agenda item to the December 3rd meeting. The reason for that is we received it late yesterday afternoon, and the rules that we've imposed and are enforcing a bit more strictly during the virtual world is about accepting late items for the agenda. While I do realize that there was a motion that was provided sufficient notice on the in-camera portion, that actually is a different issue. The issue that the letter relates to is the actual allocation of seats from a composition of council perspective. As council will recall, that issue was referred to the Council Policies and Procedures Committee, and that committee, it was on the agenda for the January meeting and then again the October meeting, and it has been deferred to the February 2021 Council Policies and Procedures Committee meeting. However, given that we received the correspondence directly to the clerk to go to council, I propose putting it on the December 3rd agenda. It also is a public item as opposed to an in-camera item. The item that is listed in camera was the issue in relation to how Brampton selects the 7th councillor to come to the regional table, as opposed to the number of seats at the regional table. So with permission from the chair, we will add the the letter received from Brampton to the December 3rd agenda and proceed thereafter.
And Councillor Medeiros, in fairness to the clerk, that was after a conversation she and I had in terms of what we thought the best way to proceed forward. Anything further, and Councillor Medeiros?
Yes, and thank you, Chair. And I was fully aware. I really appreciate the explanation. But if you can correct me if I'm wrong, we have up to, I believe, December 31st to provide sort of direction or correspondence to the provincial government. So with the requirement of having I think there has to be a 30-day sort of public terminology sort of escapes me now, but there has to be a 30-day public period in which people can provide input. So if we move it to December 3rd, can you just confirm that we'll be in time to provide communication to the government?
Fair point through to the Commissioner, yes.
Through you, Mr. Chair. Yes, there is a process that is required, including the triple majority, in order to make any changes to the council composition, and that does include a public meeting, which has to be held, as well as sending any resolution from the regional table to the local municipalities for the triple majority votes. The deadline that you're referring to is the December 31st, 2020. That is the time frame with which council has the opportunity to change composition of council before the minister has the opportunity to also change composition of council through regulation. It does not take away the council's ability to change composition. The deadline for that for effective for the next municipal election in 2022 is actually December 31st, 2021. So there is the additional year in which council can make a change to the composition of council. The deadline of December 31st, 2020 is the deadline before the minister could make some regulation to change the composition of council, regardless of the any composition change that the council had made. So while there is a deadline, it is not a deadline that's prohibitive of proceeding into 2021 to change the composition of council.
Okay, no, that's great, and thank you very much for the explanation. I guess, so my understanding is that if he receives no communication by the 31st of December, he arbitrarily can make changes he deems fit, which I would probably assume, regardless of we meet timelines or not, he would have the power to do so anyways. So is that correct, Catherine?
As of January 1st, they have the minister has the ability to make a regulation. Correct.
Okay. Okay. I'm fine with that. I'll listen to if some of my colleagues want to. I guess I'm fine with that December 3rd, as long as that we still have the opportunity, and I'm good with the December 3rd meeting. Thank you.
Thank you. And over to Councillor Parrish with thanks for your patience. Councillor Parrish.
Well, I had the same question, and I understood that Martin sent in a placeholder motion a week ago on this. We're also discussing Mayor Crombie's motion today, which is a walk-on. And I don't like leaving it till December the 3rd because I don't like leaving things in the hands of the province right now. I think we should be discussing this in public today. And I think it should be on the agenda today so that we're following all the rules and we've adequate time to have a virtual input from community members before the end of December. So Martin's being a little more generous than I am. I think we should proceed with it today.
Thank you. With that, then, I believe what I have from Councillor Parrish and Medeiros is a motion that it be dealt with today. Councillor Medeiros, you're happy to move that. Councillor Parrish, are you happy to second that? And I'm happy to deal with it as a motion. Madam Clerk.
Yes, I would say that the placeholder that was put on the agenda, my understanding was that it was not in connection with actual composition of council, but rather it was in relation to the process for the 7th member from Brampton, the existing process for the 7th member in Brampton, and that is why it was in camera, as it was for legal advice. The actual composition of council is something that should have been in public. So even the placeholder was not a public notice placeholder because there was whether it was a misunderstanding or whatever, that was in relation to the other matter that was raised by Councillor Medeiros at the last council meeting for legal advice at this meeting, and not council, the allocation, actual council composition. That was my understanding.
And I absolutely, I think that point of clarity is important. Nevertheless, I think the fundamental point that the two councillors are making is deadlines are deadlines. If we have a chance to adhere to them today, I think it is wise from the comments made that I at least put that to a vote to my colleagues to see if that is the case. So with that explanation and understanding, I do have the motion from Councillor Medeiros and Councillor Parrish that we waive the rules to deal with this matter on today's agenda. Madam Clerk, over to you.
So that does not require recorded vote, so we'll start by asking if there's any objections.
Does anybody object, or do I have my 2/3? That passes. Thank you. So with that, Madam Clerk, I hope I'm in order accordingly. I have two motions now. The first, that the agenda for the November 26, 2020 Regional Council meeting included communication regarding council composition to be dealt with under the items related to enterprise programs and services, item 20.2, and that was moved by Maderos and Parrish, and I believe we've dealt with that. Is that correct? We're okay with that? Very good. And with that, I have a motion from Councillors Raz and Santos that the agenda for the November 26, 2020 Regional Council meeting be approved as amended. All those in favor? Do I have any opposed? That is carried. Thank you. That takes me back to, are there any declarations of conflict of interest? Hearing none, Madam Clerk, I already have dealt with the minutes. We've dealt with the approval of the agenda and those amendments accordingly. So that takes me to our consent agenda. Moving all the way to item 9, our communication items. First up, item 9.1. Do I have consent? 9.2. 9.3. All on consent, thank you. Then we have staff-related items to Public Works. The first one, 11.1. On consent, 11.2.
Hold.
11.2 to be held.
I apologize. I wanted to hold 11.1. That's
Oh,
the
sorry.
Vision Zero report. Is that
Very good. Absolutely, Councillor Santos, thank you. So we want 11.1 and 11.2 held. Very good.
And 11.3, please.
And 11.3. So all of our Public Works items to be held, 11, 1, 2, and 3. Thank you. Moving on to items related to Human Services, 15.1. To be held, 15.1 to be held as well. Thank you. 15.2.
Sorry, Mr. Chair. Mr. Chair, it's Councillor Sato. My computer cut out and I didn't hear Councillor Santos or you. Are we holding 11.1? I wanted that held.
And the answer is yes, Councillor Sater. We are holding 11, 1, 2, and 3. Thank you.
Okay.
And we are also holding 15.1. I am asking at this time if 15.2 should be held on consent.
Yes, hold, please, because that deals with the motion 22.1.
So we will hold that as well. Moving on, items 17, items related to planning and growth. 17.1, proposed work plan for the Region of Peel Advisory Committee. On consent, item 19, I'm sorry? Oh, I apologize. The clerk reminds me that on 17.1, there is an amendment, so it must be held. Thank you. I guess that goes for item 19.1, the election of the section chair, so we have to conduct that vote, so certainly 19.1 will be held as well. 19.2, encroachment agreement. Do I have consent? 19.3, another encroachment. On consent. 19.4. On consent. 19.5. On consent, communication item 20.1. On consent, we have a notice of motion 22.1 we will deal with then the bylaws. Just the in-cameras while I've got them to see if we can send some staff back to work. 24.1 on consent. 24.2 is an oral update that I think is required. 24.3 is also to be held and dealt with. 24.4, an expropriation. Item 24.4, do I have consent? Thank you. And item 24.5, another update that I think we will have to hold as well. Yep. 24.5 is asked to be held. Thank you. And 24.6.
Hold, please.
To be held as well. Okay, very good. With that, Madam Clerk, can you conduct the vote on our consent agenda?
Thank you, Mr. Chair. I've got a motion moved by Councillor Parrish, seconded by Mayor Thompson, that the following matters listed on the November 26th, 2020 Regional Council agenda be approved under the consent agenda items. And this does require recorded vote. Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie.
Yes.
Mayor Crombie in favor. Councillor Demurla.
I'm gonna warm mine later. I've really got a queasy stomach right now. I'm gonna eat it, but
Some of you have your microphones on, please. Please be mindful that we want you on mute. Thank you. Madam Clerk, back to you.
Thank you. Councillor Demurla. Councillor Dasco.
Yes.
Councillor Dasco in favor. Councillor Dillon.
Yes.
Councillor Dillon in favor. Councillor Early.
Everybody
Voting,
has,
voting on behalf of Councillor Downey. Yes.
it's out of
Thank
here.
you. Councillor Early in favor. Thank you. Councillor Fonseca.
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini.
Yes, in favor.
Councillor Fortini in favor. Councillor Groves.
Yes, in favor.
Councillor Groves in favor. Councillor Innes.
In favor.
Councillor Innes in favor. Councillor Kovac.
Yes, in favor.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden.
Yes.
Councillor McFadden in favor. Councillor Medeiros.
Yes.
Councillor Medeiros in favor. Councillor Paleshi.
Yes.
Councillor Paleshi in favor. Councillor Parrish.
Yes,
Councillor Parrish in favor. Councillor Raz.
Yes.
Councillor Raz in favor. Councillor Sato. Councillor Sato.
Yes, sorry, I'm having trouble with my audio. Yes.
Thank you. Councillor Sato in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair.
In favor?
Councillor Sinclair in favor. Councillor Starr.
In favor.
Councillor Starr in favor. Mayor Thompson.
In favor.
Mayor Thompson in favor. Councillor Vicente.
Yes.
Councillor Vicente in favor, and that carries. Thank you.
Thank you very much. So with that and our approved consent agenda with the appropriate amendment, the first item I have up is 8.1, update on the Region of Peel's response to COVID-19, an oral presentation from Dr. Lawrence Lowe. And Madam Mayor Crombie, I advise you that we'll also be dealing with your motion under the COVID file immediately thereafter. With that, Dr. Lowe.
Sorry, just a moment.
Thank you, Mr. Chair. Sorry for the brief delay. I wanted to make sure I had my headset on.
Okay, I'm going to proceed. Thank you so much. Thank you, Mr. Chair. Good morning, members of council. I want to first of all start by thanking all of you for your leadership and wisdom during this continuing crisis in our community. The recent provincial decision to move our community to gray lockdown in their response framework was difficult to hear, but it was absolutely necessary. We continue to see an increase in our 7-day average of cases. All of our age groups under 60 years of age have a percent positivity of more than 10%. Our incidence rate and percent positivity continues to remain at high rates in Peel. 3% of our cases are hospitalized. And we do know that the 4 worst hit postal code areas in Ontario are in Peel, and 3 of them have a positivity rate of more than 18%. Certainly, we've all been aware and attuned to the struggles that are occurring in Northeast Brampton, but the next 2 worst hit postal code areas are actually in Mississauga, in Ward 5 and also in part of Ward 3. So this is current to the recent data released as of November 14th. We also know that our 2 hospital systems are 2 of the 3 most impacted hospital systems in Ontario right now. These hospitals, our Trillium Health Partners and William Osler Health System, have both enacted surge capacity plans, which has included canceling surgeries and also care in non-traditional spaces. And we've already calculated that without those plans, we would have exhausted the available hospital beds in Peel as of today's date. So I do recognize that gray lockdown is very hard. I certainly feel for many of the businesses that have been impacted and that are sacrificing yet again. And it's my fervent hope that they will receive any and all assistance that might be made available to them as they do the right thing to help stop spread. In the spring, we closed the community to bring community transmission under control. It also bought us time to learn about the virus, build up capacity, and educate the public about the importance of preventive measures such as distancing, masking, staying home while sick, and hand washing. Over the summer and into the early fall, Peel Public Health prepared for the second wave, we worked with the province to launch the new electronic provincial case and contact management system. We collaborated with our school board partners to support school reopening because schools, as we know, are better open than closed for the well-being of our children. We've worked closely with other partners, including long-term care, workplaces, hospitals, and other health units, and our provincial partners at the Ministry of Public Health Ontario, as well as our provincial partners at Ontario Health that are responsible for testing, to increase capacity and to provide support to all of those settings. We've hired over 91 public health nurses, 64 of which were funded by the ministry, and we've also hired 153 public health staff to support case and contact management and continue to hire for case and contact managers today. We strengthened our communication efforts to support the community, and we also pursued an isolation center, which was recently approved for funding and which will officially be unveiled at a federal news conference at noon today. As community transmission has risen, we've seen cases, first in workplaces, then in other high-risk settings like places of worship and certain sports activities, and then widespread into our long-term care homes of late. We have also seen no end of outbreaks associated with social gatherings, large and small, weddings in particular, which is why this lockdown is needed again to help bring things under control. As we bring things under control, though, I want to urge that we should also take this time to address the additional root causes that continue to drive our pandemic picture in Peel. Public health has long known that new Canadians, racialized individuals, individuals experiencing poverty or homelessness, individuals with lower educational attainment, and those who are precariously employed always experience poorest health outcomes in our community. We have seen this reflected in our rates of chronic disease like heart disease or cancer, in stories of mental health, mental illness and addiction, and in the parallel opioid crisis. It should not be surprising that these populations, of which Peel has many, have borne a disproportionate risk of exposure and severity during this pandemic. For our essential workers, for our precariously employed, for our most vulnerable, this closure is actually about life or death. It has taken a disease that spreads so assiduously from person to person to show us that we are truly all connected and that really our community and no one is truly safe from COVID until all of us are safe from COVID. Recently, I've had the privilege of meeting with leaders of every creed and cultural community, hearing from them around their tremendous efforts to get the message out to their family and friends. Our continuing dialogue will allow public health to align our efforts with theirs and help us to reach all residents better. We're also talking with our provincial partners to increase access to testing and better target testing at schools and workplaces in outbreaks and in hard-hit neighborhoods within our community. New rapid tests announced on Tuesday will also help us identify infection faster in long-term care homes and in hospital settings and outbreaks. As I mentioned earlier, the Public Health Agency of Canada is also announcing new funding to support the expansion of a voluntary isolation program in Peel. All of these efforts, however, do little to stop transmission if people are unable to act on messages received. Our goal should be to protect residents so that they don't even need voluntary isolation in the first instance. Things like income support and eviction protection will help relieve the financial burden for workers so that if they fall sick or are exposed, they aren't choosing to work while ill to keep a roof over their heads. Workplace blitzes and inspections must continue. Essential workplaces not touched by these closures must be incentivized to do the right thing, to comply with our Section 22 order on workplace investigations, and to put precautions in place to protect their workers. Health equity is part of the Council-approved Peel Public Health 10-year strategic plan. While this plan was put on hold as a result of COVID-19, we have learned that the health equity component of the plan remains essential. I intend to bring forward a comprehensive plan to address the health disparities around COVID-19 to you in the coming meetings. But to be very clear, going forward, there are three things that need to happen for this closure to succeed. We need all residents to stop their non-essential in-person interactions as much as they can over the next 2 to 4 weeks. We need to financially support the businesses that are closed because they are sacrificing and doing the right thing to limit in-person contacts in our community. And finally, we need to protect those who can't reduce their in-person interactions by virtue of their circumstances. They need our support, and we need to protect them. And in essence, we can only truly succeed as if we move forward together. Ultimately, this disease spreads from person to person. It cannot spread if all of us are able to do our part to keep safe. Thank you, Mr. Chair, and I'm happy to take questions.
Yes, questions at this time for Dr. Loh. My list is Parrish, Crombie, DeMerla. Councillor Parrish.
Yes, Dr. Loh, thank you very much. And I understand what you're going through. It must be very difficult. But you also have to understand what we're going through. First of all, you hit the nail on the head when you said that multi-generational families, immigrants, new immigrants, and such are the ones that have suffered the most with the poorest health care. We have had a program in the region of Peel, which has finally just died out of lack of oxygen, which was called Fair Share for Peel. We've been underfunded by the province for 25 years. We've grown and our numbers have not grown in our grants that are presented to us. Brampton is a perfect example of where a second hospital should have been built right when the first one was being built. So Brampton is underfunded. Peel generally is underfunded, and we're not fighting back hard enough. We've tried on several occasions. Just before our provincial elections, we put on a full court press a couple of years ago and actually got the transfer of $60 million a year to Toronto out of the region of Peel phased out. So you are absolutely correct. We're underfunded. We're under a hell of a lot of pressure. 2 of those postal codes that are on that site that shows all the hotspots are in Malton. And Malton has finally opened a testing clinic with the approval of the province. But apparently, according to the BIA, it's not listed on the regional site. And it's got very limited hours. Nothing else is within 10 kilometers of Malton. And Malton is absolutely full of very poor people, new immigrants, and they have totally inadequate service there, not because Wellford Health Center isn't there, Four Corners it's called, and ready to go. They've been ready for 4 months. Now they're being restricted in the number of hours that they can be open, and they're not even listed on the provincial site. So the neglect is what's hurting. That's my first point. My second point is the announcement about 40 additional units for COVID patients to isolate in. That's a joke. I'm sorry. 40 people, that's a couple of hours worth of testing. I don't know what we're going to do with all the people that can't self-isolate. And 40 positions for $6.5 million is absolutely ludicrous. I don't know who's making these budgets. I also, and I've spoken of this at our council, don't understand why Caledon, which has no hotspots, and Mississauga, which has, yes, 6, 2 of them in my ward, Brampton has 11. Why are we lumped into one group? And I'm told it's because it's one health unit. Why are the LHINs able to divide out and concentrate the funding and the efforts into the most needy areas? My LHINs in Malton is North Etobicoke and West Woodbridge. So if we can split those up, we can deal with Brampton, concentrate our efforts into Brampton, and I'm going to say Malton, which is right on the border of Brampton. The families go back and forth through that bus terminal all the time. I'm actually getting more frustrated in that if I went to you as a medical doctor and I had problems with my stomach, which I had this morning for taking vitamins on an empty stomach, and you said to me, I want you to get these tests for cancer, I would do it. I would listen to you. The regular population out there that's healthy, that's not sick, doesn't know a single neighbor who's sick, doesn't know a single relative who's sick, are starting to question this massive lockdown that keeps happening to us. And it's not being explained in a way that most human beings can relate to, which tells me your teams have to include scientists, strategists, doctors, and people who understand human nature. You're missing that fourth part of your team. And I know you're working hard. I know the mayors are working hard. Everybody's working hard. But there are people suffering out there. And there are also people who are going to start breaking loose. They're going to say, I don't agree with what you're doing. And they're just going to go on about their business. The number of people pouring into Oakville, they're having a boom year there. Restaurants, you can't get a reservation, I'm told, there unless you want to go at 10:30 in the morning or 3 in the afternoon. They're full of Mississauga people. The stores there are making a boom year for Christmas. So that's my frustration. I love following rules. I'm a lovely rule follower, but it's starting to get to me a little bit. And my constituents are freaking, especially the people in Malton.
Dr. Loh.
Through you, Mr. Chair, thank you, Councillor Parrish, for the comments and questions, or for the comments. I think there's a few things I wanted to address sort of in response. And first of all, very sorry to hear of your frustration. I think we all agree that this is incredibly frustrating, the current situation. And in respect of trying to explain why this is happening, I think I've been very clear in my message. This is a disease that is spread from person to person. It can't spread if people are not meeting. I don't know how much more simply I can say that. And I think the way I would actually characterize it in a very important way is the issue with human nature and human behavior is not unique to the region of Peel. I think we're not seeing this this issue up front, and it ultimately still speaks to the disparity that I've identified. The people that you're hearing from, that I'm also hearing from, they're the ones that are seeing the impacts of the closures and the shutdowns, but they're not the ones that are in hospital. They're not the ones that are, worrying about their family members that are, in the ICU, that are, with a tube down their throat. I mean, they can't speak. Some of these people, they're ultimately our patients, the most vulnerable, who are bearing these pieces, and they're not the ones calling us because they know that this is real. First of all, they're in support of things. And second of all, they don't have opportunity or occasion to call us. Many of the times, these are our essential workers, folks. So there is a disparity where a lot of the people who are impacted by the closures, because we ultimately want to try to stop this from spreading and bursting out of those neighborhoods, because we know that people are not limited. There's no walls, there's no boundaries, unfortunately, between the hard-hit neighborhoods and other parts in there. And while there are quote-unquote hotspots, we also see transmission in all sorts of settings. We've had transmissions at places of worship in, well-to-do neighborhoods. We've had transmission in, around sports games, around people kibitzing before and after hockey or basketball, not just in Peel, but elsewhere. The reality is that we're seeing community transmission because people go everywhere. And so I agree with you. And I think what I've been trying to say in the course of my remarks is that the closures right now are about trying to get things under control in the short term. And we do know that people are feeling the strain from that. We also know that if the virus runs loose, as has been seen in many other jurisdictions in the United States, that businesses close anyway, and people are sick and people are fearful. That's certainly the experience that my colleagues that I converse with regularly in the United States have mentioned. They don't do contact tracing. They just accept that it's in the community, and people just close because they don't want to get sick and they don't want to be hurt. So I think there's this. So on that front, there are certainly closures, but I agree that more must be done to address the disparity, because ultimately the people we're not hearing from are the people that are impacted by this virus and that are all connected. And I think to the extent that my team is engaging with the community, bringing online all the things that I mentioned around targeted testing, around working things there. I mean, I think maybe the simplest thing I can say, absolutely, Councillor Parrish, through the chair, you can almost certainly appreciate that this is not something that I wanted to do either. Like, I mean, this is me providing medical advice, right? But ultimately, as a person, as a human being, I know this is hard. I know this is difficult. But the facts are clear. The reality is we're seeing spread everywhere in our community. We're seeing it certainly in harder hit areas. But right now, the issue is we're trying to stop a runaway train. And so that's why we've essentially thrown a bigger brake on to make sure that this thing doesn't run away, so that we can get back to a point where it's further up the hill, so that we can start tinkering with the actual long-term brakes to make sure that it goes on smoothly. So I think maybe the way I would respond is I certainly hear the frustration. I think we need to just reassure people that this is for the bigger and better cause. And I would say that the human nature and the human behavior, it's certainly not unique to Peel. I think we've all read about the issues with this everywhere in the world, really. But it's about looking out for our fellow people, and especially for the most vulnerable who we're not hearing from necessarily.
So if I might interrupt, that's very soothing, but you haven't addressed my concerns. Why can't we more finely tune the way we're isolating community, number one? Number two, can we get Malton Test Site open 5 days a week and listed on the provincial listing? Number three, 40 beds isn't going to do it. And number four, we have to advocate strongly for another hospital for Brampton. I'm very concerned about what's going on. And you know, I have two questions. Do you know if there's a restriction of kids on buses going to school? Are they spaced out? Or are the buses I see going by full of kids, unregulated by the Department of Health?
Okay, so absolutely, I can answer all those questions, and thank you for thank you, Councillor Parrish, for clarifying. Through you, Mr. Chair, in respect of isolating communities, we are one health unit because we're ultimately one healthcare system, and so I do recognize your point around the LHINs, where you had spoken to why can't they, you know, if they can divide up and all those other pieces. This is different because this is controlling a communicable disease that spreads from person to person. It doesn't know any specific neighborhood boundaries. Our hospital systems are all connected. Our communities are all connected. If we were to split communities up or neighborhoods up, the reality is that people, I mean, we're seeing it already. You certainly mentioned it in respect of Halton. If people would just leave Malton or would leave Northeast Brampton and go elsewhere within the region of Peel, if we were to do the same thing. So we're already having difficulty with it at the regional municipal level. I think to go further down into even the neighborhood level would present significant challenges. And again, I think the root cause of the issue in those neighborhoods, as I've said, is actually making sure that they get those supports and they get those additional pieces, which speaks to your second point. I will speak to our Ontario Health partners to make sure that they're aware of your concerns around the testing site in Malton, to try to see if there's additional resources that can be provided there. In respect of testing, I have continued to speak with our Ontario health partners, and they are looking at all sorts of new modalities, as I mentioned, the rapid testing and the targeted testing that are intended to be brought on board. And I'm hoping that those will be running in the, we're talking days to weeks to make sure that we're out there in the hotspots in our neighborhood. In respect to the isolation center, which is the announcement that I do have to leave for later, just briefly today, I recognize that 40 beds doesn't seem like a lot. It is the initial allotment of beds, but we are continuing to examine the program, and we'll bring more beds online and certainly apply for more funding if it's needed to make sure that it's there. From what I understand, many of our cases do have the opportunity to self-isolate, and the purpose of the isolation center is for people who cannot safely self-isolate at home. And so hopefully at least the 40 beds will start out, and then there will be enough interest demonstrated in the program that will allow us to continue to ramp it up, and also to continue additional voluntary isolation sites within the region. Certainly we have one site that was identified that will be brought immediately online, but there are additional isolation sites that we would hope to bring online, just in consultation with the community and in respecting the data that we have there. And then in respect of school buses, we have worked with the school board in respect of schools and school buses, and we do know that the school buses, while they're not distanced, these children are part of the same cohort. It goes back to the same principle of cohorting, and by that we've actually been able to limit transmission in those settings and in schools as well, in the way that we've been able to continue limiting transmission within our school system. In respect of advocating for an additional hospital in Brampton, I think, from my perspective as a public health physician, absolutely more hospital care in this instance would have been helpful, and certainly having additional beds and additional supports and resourcing would have been helpful in dealing with this surge. Obviously, there's not much we can do about it at this point in time, but I do support it, at least going forward in the long term, but also support a broader conversation around what I just talked about in my remarks this morning around health equity and addressing disparities for health. Because one of the things that I try to push as a public health physician is the idea that if we create the conditions for people to live good, long, healthy lives, it actually also reduces demand on the healthcare system in the long run.
Thank you very much, Dr. Lowe.
Thank you. My list is Crombie, Demerla, Raz, Brown, Groves, and Fonseca. Mayor Crombie.
I need to drop down one level. I'm on the phone with the Premier and the CEO of Walmart. Excuse me, just
Ver-
drop me down one.
Yes,
Thank
I
you.
will, Bonnie. Thank you. So that takes me on to Councillor Demerla.
Thank you, Chair, and Dr. Lowe, again, thank you for very admirably navigating us through this very difficult time. And I had two questions for you. The first one is just a technical one. When you do these on the dashboard by area, when you do the COVID numbers as well as the test positivity, do you include, is it just the community numbers or would it include a nursing home? I'm just asking because Cooksville has a nursing home and I'm not sure if the nursing home numbers are combined into that postal code. So that's my first question. And then the second question is, there's a lot of conversation, and yesterday at council as well, there was a lot of discussion around the unfairness of allowing big box stores to sell non-essential items along with essential items, while smaller stores that might be selling only non-essential items are completely shut down. And so my question to you is, as you may be aware, there's a motion coming that would ask to restrict the ability of big box stores to sell non-essential items. And from a health perspective, from just a COVID transmission perspective, would that be helpful? Because it's not going to really help the small businesses other than, spreading the pain more evenly, I guess, by reducing the sales for big box stores. But I see the idea behind it, but I'm trying to understand, does it solve any of the problems that we have? And from a health perspective, how do you feel about that? Would that be something you would support?
Through you, Mr. Chair, thank you for the question, Councillor Demerla. I think I'll start with the first question because it's probably easier. In respect of institutional versus community cases, I believe it includes both within the census tract, but I will confirm with my team and certainly speak back to you and Council. Basically, there's actually layers within the map, if I recall correctly, and so there's two data layers on the map, and so on the top layer, it's basically total. And then if you actually go to the bottom layer, I think it excludes the institutional ones, if I recall correctly. So there's, I would be happy to, or actually maybe I can share it here. No, I can't share content. That's okay. But anyway, through you, Mr. Chair, again to Councillor Demerla, there are two layers on the map. So there's a way for you to filter it with the second layer to just see the community cases and not the institutional cases that were reported in that census tract.
So can I just clarify on that? But when on the big map, when it's showing those numbers, it includes the institutional, right? I'm just asking you because to me, it was an anomaly to see the Queensway area popping up higher than, say, the Cooksville area. And then I twigged on that maybe it's the long-term care could be skewing those numbers. So I can talk more offline if I need to. I'll go back to it. Thank you.
Yeah, no problem. So through you, Mr. Chair, to Councillor Demerla, yeah, absolutely. If you click on the top right-hand side, it says layers, and you can see total cases, which are all the cases, and then community cases, which exclude the institution and the long-term care ones. And so you may see differences just reflected in the number of institutional cases you might have. In respect to the questions around cordoning off non-essential items in big box stores, I think we would need further data. We'd need to take a look at this. And certainly, I don't necessarily think we would get the data that we would need. It would essentially be data from the retailers to identify how many people show up there and are essentially buying just non-essential goods and how many are showing up and buying essential goods, et cetera. And then I think a very, a bit of a reaching sort of case could be made for saying, well, if you cordoned it off, then maybe this number of less people would show up there. But I think the other challenge is that at the provincial level, we do know that these big box retailers are already subject to capacity limits, are already subjected to distancing, masking, et cetera, which from the perspective of reducing communicable disease risk, is essentially the standard of practice at this point in time. So there would be, I think we would, in the course of our analysis, need to figure out, if you reduce the non-essential thing, would it reduce the number of people there? But even if you reduce the number of people there, there are already measures in place to limit the communicable disease risk, beyond which I don't necessarily think we would be building on, and beyond which I don't necessarily think, short of reducing the number of people there, would happen to reduce the communicable disease risk. And we do know that there are already capacity limits for these retailers that are actually in play as well. So the short answer to your question is, I think it's a pretty remote possibility that there's that there may be additional health protection associated with with a requirement for big box stores to reduce or curtail their sale of non-essential items at this point in time.
Thank you, Dr. Lowe.
Thank you. Councillor Raz.
Thank you very much, Mr. Chair, and thank you, Dr. Lowe, for coming again today and providing an update. I know we'll be discussing Mayor Crombie's motion in a little bit, so I'll deal with my comments then. I do have some questions with respect to testing and false positives. In the last 2 weeks, I know of several people who have gone to get their test. They made the appointment. They went to go get their test. They, in some cases, were waiting over an hour and couldn't, so left. They ended up not getting testing or getting tested. Subsequently, the health unit contacted them and said that they were positive. In another instance, somebody went to go get a test, had a positive test, self-isolated. They were mildly sick, and then Peel Public Health Unit contacted them in November after their September test, saying that your November test was positive, and then they said we never went for a November test. So, you know, you hear some one-off conversations, but I think I just want to know, in terms of quality assurance, what are we doing? Because I'm starting to hear not, rumors on the internet, people who are actually within my social circles having these experiences. And I'm just wondering if I'm a little concerned about what kind of message that's leaving, but also I think the people who are getting these types of results are really questioning the system. And as we go through this COVID fatigue, we're getting a lot of pushback in so many areas right now. How can we restore that kind of faith in the testing system?
So through you, Mr. Chair, to Councillor Raz, if I could ask a clarifying question. So these are individuals who were never tested and were subsequently told that they were positive?
Some of them were never tested and told they were positive. In one case, somebody was tested. They were told they were positive. The Peel Health came back, said that they were inconclusive. And then they mentioned a test they had in November that never happened.
Okay, so through you, Mr. Chair, first of all, Councillor Raz, thank you for bringing these to my attention. And I don't know if you're able to share particulars with me. I can certainly bring it back to my team to identify, at least from the case management and contact tracing side of things, where there may be areas for improvement. Certainly, that's very concerning for me to hear. The other thing I would add is it's a possibility that there may have been, and again, it's something that we would need to look into, and a misinterpretation of at least the individuals who were never tested, if their purpose of going to get tested was because they may have been in close contact with someone who had tested positive, they may have been called by Peel Health to advise to be self-isolated and to be advised that they had been exposed. So rather than being called and told that they're positive. So I think from a case and contact management perspective, I'd like to look into these further if the people would consent to their information being shared so that we can look into what happened. I know, as I mentioned, we've brought hundreds of staff, literally hundreds of staff on board. And so certainly training and ongoing quality assurance is a focus. It's continuous quality improvement all the time. But I have heard of minor incidents here and there, which we have acted quickly to always address and to always maintain the public confidence. I think the broader question I have is around the testing system as well. So a lot of this may be in the course of our investigation, if these people consent to us looking into it. what happens is we only act on essentially what the testing system gives us, which is run by the province, as you know. And so if there's something more underlying in the way that results are being reported to us, where if we're getting records for tests that never happened and then we're following up on them, that's why, I mean, I think to get to the bottom of this, I'd probably need a bit more information so that we can try to figure out, is it something on our end in respect of training or a continuous quality improvement? Certainly, we have staff that have been working significant hours for a long period of time, and especially throughout the second wave, which is perhaps leading to things happening. But more concerningly, I wonder if there's something on the testing side with the province that we might need to also signal and relay to them as well. So I mean, I'm concerned to hear about that. I think in respect of just the test overall, we do know that the Public Health Ontario Laboratory and the National Microbiology Laboratory are always conducting ongoing quality assurance to ensure that the appropriate that there are limited false positives to ensure that the test is as accurate as possible. But yeah, I think I would need further information just to figure out where in the process this might have where things might have broken down. Yeah.
Thank you. I'm happy to provide that, and I did speak with one of them last night who will be consenting to provide that information. I do appreciate it. I just, I worry that there might be something in the system. If there's a computer glitch, then we need to address this quickly. So thank you very much, Dr. Lowe.
Thank you. Mayor Crombie.
Mr. Chair, I'm a little disadvantaged because I missed the highlights of the conversation. I think that Councillor Rass was making the point about the data not always being accurate. Is that correct?
That is correct, yes.
Because that is an issue, Dr. Lowe. I mean, we want to base our decisions on science and evidence, but we do lose confidence. And so does the public when, there are glitches in the system. And I recognize it's at the provincial level, but nonetheless, it does not instill confidence when we're, and the numbers are reported are very low one day and exorbitantly high the next. So we need accurate data, accurate information. Okay. Is this the appropriate time to put the motion forward? Because it's worthwhile to have the discussion. Let me say that I'm gaining confidence because in Mississauga, the numbers have started to come down. This week's epidemiology report showed that we are now 100 cases per 100,000 versus 117, and that our positivity rates are also down from 7.8 to 6.9. So there is progress in the right direction. Now, I have sympathized greatly with the case that Councillor Parrish had put forward, because we are certainly hearing from our community that boy, oh boy, if Mississauga were on our own and had our own public health unit, we could be carved out. That may or may not be true right now, but certainly I understand the virus moves, we move it, it's in control, we're not controlling it, and all that, and the borders are seamless, but nonetheless, we want some assurances that if we get our numbers to where they should be, that we could take that surgical approach when the time is right. I do understand fully well that Trillium Health Partners is now also redirecting or just about to redirect patients in ambulance and are at overcapacity and have more than 100 rooms dedicated to only COVID or suspected COVID patients, including the ICU. So we are at a difficult time. We also recognize there are outbreaks in 16 LTCs, 7 retirement homes, 5 group homes, and the situation at Tyndall is very dire, with 97 patients and 80 staff members testing positive. So in the community, certainly in the congregate settings, it doesn't look good in the hospitals and long-term care facilities. However, we also know, we hear from our businesses that have shuttered and have followed the rules, that they are also suffering. And I know that the council had the discussion yesterday. We want to do everything we can to support our small businesses, and often our residents feel more comfortable shopping in small businesses where the capacity can be controlled. What we have seen in the big box stores is overcapacity, lineups that aren't monitored, people without face coverings. We've all seen the photographs. And so we know they shut to reduce the risk of transmission. reduce it, help us get in control of the virus. I'm just going to ask if everybody could mute because I can hear a lot of shuffling in the background. And I guess everyone else can too, and I'm losing my train of thought. So we were, in an effort to deal with this, what I think is a health issue and a safety issue, that the big box stores are over capacity. They are not monitoring their capacity, not giving proper 4 meters per customer, not controlling their numbers in the stores. The lineups outside are huge. Meanwhile,
Mayor Crombie, if I could interject, I think you're sort of bleeding into the main motion that you want to bring afterwards, and appropriately so. But if I may, I'd like to conclude the questioners of Dr. Low, and then Mayor Crombie, you're next up. I have your motion before me. It will be formally put, and we will discuss it at length. And I will come to you first. Do you have any other questions of Dr. Low now?
Yes, just one question.
Go ahead.
One question. It's the holiday season, Dr. Low. When could we safely reopen our small businesses so they are able to compete with the big box realtors who are selling the same items because we feel that they can do so safely?
So through the chair to Mayor Crombie, first of all, to speak to the data piece, because I think Councillor Raz's question was slightly different. It was in respect of the testing system. That data glitch, yes, that was at the provincial level. That was not our data. I'm actually very particular about our data and proud of it. And so certainly we have reached out to our provincial partners to understand what happened with that 1 day of reporting and to make sure that that doesn't happen again. In respect of the holiday season and when can we reopen, my understanding from our provincial partners is that this is in place for 28 days, but it's being reassessed every week. And so certainly if our numbers start to improve we're starting to see a change in the transition patterns in our community, I'm certainly happy to consider what sort of discussions I can have with the Chief Medical Officer of Health. But I do want to be very clear and not raise expectations. We have all 3 of our municipalities well above the 40 per 100,000 threshold for the red control category. And unfortunately, we also know that 40 per 100,000 in the red control category is still 2.5 times higher than what the World Health Organization and Harvard actually recommend, 25 per 100,000. I think this is definitely this definitely is a huge. It's very discouraging, I understand, for our small businesses and certainly for all of our community that I know had taken all sorts of measures and had really tried to do their part to keep things under control. The reality is that we are seeing widespread community transmission in all 3 of our municipalities at this point in time, and that's why this is in place, to really just over an immediate short term limit any potential and really send the message that we should all be limiting in-person interactions outside of our home at this point in time to the most essential.
Okay, I'm going to leave it there because I am going to circle back and ask you a few more things when we present the motion. I know Mayor Brown is interested in seconding it, as is, I think, Councillor Burns too. Anyways, I'll cede the floor to the next questioner. Thank you.
Mayor Crombie, thank you. And just to be clear to everybody, I'm carrying on with questions only at this time of Dr. Low and his presentation. My list of questioners is Brown, Groves, Fonseca, Sinclair, Kovac, Paleshi, Raz, after which, Madam Mayor, I'm coming back to you. I will properly put your motion on the floor, and I will come to you first to speak, and we will carry on from there. Continuing on with questions of Dr. Low and his presentation, Mayor Brown.
So I will want to speak to Mayor Crombie's motion, but I'll save that until it's put on the floor. But I wanted to say, I know we have, Dr. Low, the federal announcement that's happening today for the beds in Mississauga that we merged in with the homeless shelter. And I'm a big believer that isolation centers can make a difference. I know they're just one tool in the toolkit, but for people in crowded living conditions, and we have significant clusters of that in Brampton, this is something that was viewed as very important. And so I'm disappointed that it's not going to be in East Brampton, where we have some of the highest positivity rates, not just in our region, but in the GTA. And I just want to underline, someone taking public transit 45 minutes to an isolation city in a different city is just not practical. And so if the federal government wants to take a victory lap over this announcement today, I hope we can say collectively that it falls short. And I'm tired of Peel Region always being an afterthought. You know, Toronto right now has it operational in Etobicoke and Toronto. You know, the announcement in Toronto happened the day the federal government announced the program. And yet, if you look at today's numbers, it shows, and this is not a new thing, but if you look at today's numbers, you know, Peel Region is almost a third more than the city of Toronto. And so why is it that we continue to be an afterthought? And Dr. Loh, I guess what I'm asking you is, can you advocate for us to get that facility in the northeast of Brampton? There are 2 hotels that could be readily adapted. You know, I have a motion from Brampton Council that was passed 11-0 pushing for this. It's something that we've had local physicians speak about in terms of being important. I just listened, you know, your colleague, I know you're know Dr. Isaac Bogash well, and he was speaking about this on TV about how this would be very helpful in an area like Northeast Brampton, where there is an abundance of essential workers, factory workers, those living with precarious employment. And I know there's other aspects we need. We need to get families not to interact. We need to have sick benefits. There's many tools we need. But given the fact that you're leaving this meeting to go to that press conference, I would ask, you know, can you convey that this is not their announcement is not the be all, and that it has some distance to go before we're satisfied.
So thank you, Mayor Brown, through you, Mr. Chair. First of all, to clarify, the current site that is being expanded is not a homeless shelter. It is a voluntary isolation center that was previously purposed for the shelter recovery program. And my understanding is that it will now be focusing more on voluntary isolation at this point in time. And we've moved forward with that site as a matter of expediency, just to ensure that we are fulfilling the immediate need. You know, I certainly appreciate the challenges that are being identified in Northeast Brampton, but we have to remember as well that it's a matter of working with these communities. We want to make sure that we're pursuing things, you know, working with the community to ensure that it's brought in a culturally relevant way. So we're pursuing absolutely additional opportunities to expand additional voluntary isolation sites in the region of Peel, and to ensure that our residents will have the most access. But the reason why it's moving forward at this point in time is that we're expanding an existing site just for the immediate need, and you know, we will absolutely bring additional sites online, you know, as we have an opportunity to review the data and engage with the communities that it will be located in.
Dr. Loh, but the existing site was a shelter, is that correct?
So, through you, Mr. Chair, the existing site is a hotel, and so it's a hotel facility, and it was previously used for individuals within the shelter system, where if they could not self-isolate and tested COVID positive within the shelter system, that they would be at that site. It will no longer be used for that purpose. Okay. It will be used for voluntary isolation at this point in time.
Okay, and now where are they going to provide that service for those homeless in our community in Peel Region?
So through you, Mr. Chair, we are continuing to examine all possible opportunities to figure out how we're putting this. I can't speak to all of the details of this right now, given that the announcement is coming. But you know, I'm happy to bring an update to council next week. But I want to be very.
If the service that is being offered to homelessness in our community, which is an important service as well, because they're among the most vulnerable in our city, if that's being suspended, I think that's something regional council needs to know about. So I think the more details you get from the feds that you could share with us, that would be helpful. And I would just say, you know, if you could convey the remarks to the federal health minister that it is a difficult ask to ask someone to take public transit 45 minutes from Brampton East, where we have the greatest challenges, to an isolation facility in a different municipality. There's an abundance of complications there, and I just hope that that can be conveyed.
So through the chair, I will convey that certainly to the federal minister. As you know, the federal government is funding the program. The actual location of the sites is conducted by us, Peel Public Health, together with our region of Peel Human Services colleagues, and in consultation with the community. But we will ensure that we pursue further opportunities to ensure that residents of Peel who need it have the most access. The reason the current site is being used is a matter of expediency to ensure that the funding begins to flow and that we get this isolation center going. So I certainly recognize the concerns and the challenges that you've identified. This is all a matter of ongoing rapid work that is continuing.
Well, I know, Dr. Lowe, maybe you can mention to the federal health minister that if it's a matter of expediency, there are 2 hotels in that area that I'm told are ready to go as well. And I know the provincial regional minister today at his press conference at 10 o'clock also criticized the notion this funding would be coming without a greater attention to the geographical need. And I would just note in Toronto, they knew they had an issue in Etobicoke and they adapted. And so the first facility being in the downtown, but they adapted to one in Etobicoke where there is growing COVID rates. And I would just hope that the federal government, in their wisdom, would see that there is a challenge in the east end of Brampton that needs some of their love and care as well. Thank you, Dr. Lowe, for all your hard work.
Thank you, Councillor Groves.
Thank you, Mr. Chair, and thank you, Dr. Lowe. I do have some comments also, but I will wait for Mayor Crombie's motion to be tabled. But a couple of questions, Dr. Lowe, for you. With regards to the testing, with regards to the PCR test and the RDT test, like how accurate is the PCR testing? And can you explain to me the difference in very layman's term, the difference between the PCR testing and the RDT?
So through you, Mr. Chair, to Councillor Groves, so a PCR test is essentially a test where you're looking for the viral material. You're essentially you're basically amplifying what the sample that you've taken from the swabs, and you're trying to identify whether the specific viral sequence and material associated with COVID-19, along with 2 specific what are called antigen targets, are identified after you've had an opportunity to identify it. And so this test is validated, as I mentioned, by Public Health Ontario Laboratory, as well as in close collaboration with the National Microbiology Laboratory. It is the gold standard. As I understand it, it has a significant sensitivity up to 90% for detecting SARS-CoV-2. Further assays that were done at the Public Health Ontario level gave it an accuracy in detecting COVID-19 of over 99%, in fact. So that's essentially what it is. And then in respect of the RDT test, I'm not quite sure what that acronym is, and I think it may be something. It may be just a matter of the terminology that you're using, Councillor Groves. But in essence, what we are using is a validated PCR assay with the Public Health Ontario. And if the RDT thing, if it's in reference to the either the rapid tests that are being deployed or the rapid antigen tests that are being undertaken, those are pieces that I'm happy to look back into with my team, but certainly the test that is being done with swabs is PCR, and it is 99% effective at detecting SARS-CoV-2.
Okay, thank you. So the RDT that I was referring to is the rapid diagnostic test.
Oh, yes. Okay.
And it detects the presence, I guess, of proteins and viral proteins and antigens. So I guess I just wanted to kind of understand the difference between the 2. But you said the PCR is 99% accurate. Did I hear that correctly?
That's correct. At least in the assays that the Public Health Ontario Laboratory and the National Microbiology Laboratory have done to validate the test. That's correct. And yes, so with respect to the rapid diagnostic tests, I guess I should have just spelled it out in my head. It's a similar assay, but it's meant to identify it in a rapid manner. I can basically I can basically bring further information back to you on that in terms of both. I mean, we're still just receiving them right now and also getting some clarity on how they're being used. And so I'll be able to bring further information back to you, and I'll communicate that to you via email as well.
Okay, great. Thank you very much. And another question is with regards to Caledon, and I know we've seen the numbers going up in Caledon, and for the population that we have, it's a little bit concerning for me anyway, and for my constituents. So how do we even get a test site in Caledon, or why don't we have a test site in Caledon?
Thank you, Councillor Gross, for question. Through you, Mr. Chair. We continue to converse with our Ontario Health colleagues around reducing barriers to testing and identifying additional sites. And we will, I'll bring that back to them to identify where things are at. As I mentioned, certainly there's a lot of focus on areas within the community with high transmission. But certainly we will, I'll mention that as well in terms of testing within Caledon to support our ongoing response.
Great, thank you very much. And I know that Councillor Parrish had mentioned earlier in her comments with regards to Caledon and Mississauga. We know where the hotspots are, and they mostly in Brampton, very few in Mississauga, and I don't think we have any here in Caledon, if that's what I heard correctly or understand correctly. So, and I heard the conversation about why we are lumped in together because we're at the one health unit, but I really think that there needs to be some kind of advocacy with the province or whoever we need to go to or speak to separate that, to separate Caledon and Mississauga from that when it comes to it, because I hear from my residents and my businesses all the time. Why do we have to, and they continue to say it, why do we have to close down when we don't have those hotspots, when our numbers are not that great? Why is it that we're shutting down? So I'm just going to ask that if you can advocate for us, or the chair or whoever, I think that that's something that we really need to look at seriously.
Thank you. And again, something that Dr. Loh addressed in his previous comments. Moving on, Councillor Fonseca.
Thank you, Mr. Chair. Thank you very much, Dr. Loh. I will keep my my questions specific to long-term care. First off, I do want to say thank you to you and all at Peel Public Health for all that you are doing and trying to respond or react to get ahead of this situation that we're faced with in Peel. Specific to long-term care, so you mentioned in your remarks that we can't stop the spread if we're not meeting. In the case of long-term care, it's virtually impossible for the residents in long-term care to not be connecting with staff in long-term care facilities. I missed Councillor Demurla. She asked a question about the postal codes. If long-term care and nursing home, retirement homes are in with the data for postal codes, or if they are separated. I missed your response. Are they separated?
So through the chair,
are long-term care numbers separated?
So through the chair to Councillor Fonseca, there are 2 layers to the map, and so if you click on the top right-hand side of the top right-hand corner, it'll show which layers are available. And there's a total cases, which includes institutional cases, including long-term care, and then there's community cases, which excludes long-term care cases.
Okay. Okay. Thank you for clarifying that. So, with regards to long-term care, the situation is, I would say, extremely dire. There have been, and looking at the stats, 2,200 deaths in long-term care facilities. Of the 626 long-term care facilities in Ontario, 400 have been impacted. Back in March, the Premier had announced that we have to do more. This is a wake-up call. The military was called in. There is, I believe, I understand that there is still a study or a commission or a report being written on the status or the state of long-term care homes. Could you tell me, with regards to from what we learned from March through to now, cases somewhat peaked, or there seemed to be a handle on cases in long-term care homes in April, and then move forward to now, and we're seeing a resurgence. And as the mayor alluded to, one happens to be in Ward 3, Tyndall, just devastating. 18 of the residents have passed, unfortunately. 97 residents impacted, 80 staff. Are we in Peel receiving a fair share of funding to train the staff in our long-term care? Have we received since the March-April timeframe when there was an announcement of rollout of rapid testing? Have we received that rapid testing to our long-term care? Is it a situation of we need more funding for long-term care, more training for the staff? In the case of Tyndall, the announcement was made of the outbreak publicly on November 5th. The province did not respond in terms of an order until November 25th. This is a 20-day delay. In my mind, I think this is a much too long period of time, in particular if the commitments that were made in terms of providing rapid testing, training for staff, monitoring and looking into long-term care facilities was a priority back in March and April, and there was this time frame through the summer to better be prepared for a second wave. Could you just perhaps speak to that, and in particular this delay between a November 5th and a November 25th response from the province?
So through you, Mr. Chair, to Councillor Fonseca, thank you very much for the question, and I'm happy to provide additional context to clarify. First of all, the Region of Peel Public Health, together with Ontario Health, as well as our hospital partners and various long-term care administrators, and also our paramedics, are actually part of an integrated response table. This has actually been a model for the entire province. In the course of the surveillance testing in the spring, through working with that integrated response table, we surveillance tested all 28 long-term care homes well before the provincial deadline of that was set for mid-May when we started at the end of April. And in addition, this integrated response team has continued to work with our homes and to actually keep cases out of homes. So a lot of the outbreaks that are identified are usually one or two staff cases and possibly one or two residents that worked closely with those staff, but we're not typically seeing in Peel homes the significant spread that was seen in the first wave and certainly elsewhere. And all that information is available on our dashboard at thepeelregion.ca/coronavirus, the case status dashboard. There's all sorts of information there around the homes, but you'll see that the vast majority of homes, we're seeing one or two cases, it's staff cases, and they're all being picked up through surveillance testing. And this is really reflective of the higher rates of transmission we're having in our community, because if we have higher rates of transmission in our community, the likelihood that a staff member might subsequently be picked up as part of this defense of testing staff and trying to make sure this stays out of home will increase, because you're going to start seeing more cases picked up through that mechanism. And so we've actually had, save and except for Tyndall, we've had significant success in keeping this out of our homes thus far. And that's why we really need to, moving into the gray lockdown period is designed to help us bring down our rates of community transmission so that we won't pick up as many cases, or there won't be as many cases at risk of being brought into these homes. In the case of Tyndall, my understanding is that there was a lapse in respect of the infection prevention measures that were there, that we have worked diligently together as an integrated response table with our provincial partners to address, and that subsequently, it's certainly terrible and unfortunate what is happening as a result of that. It really speaks to and brings back recollections of what occurred in the first wave. But again, this is isolated and completely unrelated to the ongoing work that the integrated response table has done, to date. In fact, I should highlight. I had calls from the Deputy Chief Medical Officer of Health, Dr. Barbara Yaffe, as well as the Minister of Long-Term Care, asking what we were doing in Peel as to why they were seeing cases pop up, but they weren't seeing spread in our homes. And I credit a lot of that to the integrated response table. Which brings me to Tyndall. And so Tyndall is certainly an unfortunate situation. The order that I understand is around staffing and assistance with staffing, as well as infection prevention and control, and for a hospital to essentially go in. Part of this actually speaks then to the issues and capacity challenges. Typically, the hospital system that would be assisting Tyndall is Trillium Hospital, Trillium Health Partners. But the challenge is because Trillium is so busy, they are dealing with their own outbreaks. They have a number of outbreaks on the wards. They're dealing with the overcapacity issues, all these other issues. They were trying to identify another partner to go in there and assist with staffing and infection prevention and control. There were a number of other organizations that were reached out to, which fell through. And then subsequently, they were only able to identify, I believe it was Joseph Brant Hospital in Burlington, to go into that home and to assist. So this was a delay born, if anything, by the fact that we have hospitals that are over capacity and unable to respond and assist with a long-term care outbreak within our backyard, which really speaks to the importance of why we're also in the current phase of the pandemic that we're in. We need to bring down transmission rates to ensure that we're not seeing cases imported into long-term care settings. And it also means that our hospitals will be able to address the outbreaks that do occur, because they won't be over capacity and dealing with their own outbreaks as well.
Councillor Fonseca, you still have the floor, but such a big issue, the Tyndale one, that I think it's appropriate that our Commissioner of Health Services also speak to it. Nancy Polsinelli. Nancy, some updates on that file as well, please.
Thank you, Chair. Through the Chair, thank you, Councillor Fonseca, for your question. Just some things to add to what Dr. Lowe has already said, and more, broadly than Tyndall. We have had the province come to all of the homes across the region of Peel, including the 5 that are run by the region, to create a preparedness plan. So that had to be submitted a few weeks ago. There has been funding that has just come our way, and that was just yesterday we received the letter, so that will be on the agenda as communication for December 3rd. And that funding did go out to long-term care homes for IPAC, for PPE supports. The third thing, which is quite fundamental, is mandatory testing. So effective November 30th, every home must have their staff as well as caregivers tested as mandatory, and that testing is being done weekly. Now, the logistics to get that done is not very simple, and I think we hear that in how how the testing is underway across the community. So I know that the homes are working feverishly with Ontario Health, with Peel Public Health, to see how we can do that most effectively. But with that weekly testing, we are hoping that there will be less transmission from the community into the homes as well. And then you also spoke to the hiring piece. The province is working to support long-term care, as they are with public health, with hiring staff. They are working in collaboration with the hospital sector. The biggest issue right now that we are all trying to work through is competition. There's only so many people we can hire in the community, and there's that competition between long-term care. Our hospitals are needing the support, as well as public health. So we're working through that as well. And finally, thank you for mentioning the Long-Term Care Commission. That is huge. Our team has developed a response to the commission to speak about long-term care, and that will come to council for your review and approval on December 10th. So more information and conversation at that point. Thank you.
Thank you. Councillor Fonseca, anything further?
Thank you, Mr. Chair. Thank you, Dr. Lowe. Thank you, Nancy. Thank you for answering the questions. I look forward. I was going to ask about that commission report. I will just emphasize that back in April, just to your point about the rapid testing, the province had committed to testing all in long-term care, as well as providing PPE, as providing other parameters around dealing with disinfecting. So it just seems to me that hopefully in this commission and this report that comes forward for long-term care, there will be, in terms of protecting those most vulnerable within long-term care, both the residents and the staff, that there will be, I don't want to say much higher standards, but all of these points of long-term care will be looked at. Thank you very much for that update, and I will take anything further with regards to Tyndall offline. Thanks.
Thank you, Councillor Sinclair.
No, sorry, not on the list.
Thank you, Councillor Kovac.
Thank you. And through you, Mr. Chair, I'm going to try with video and hopefully I'm not getting much lag. Can everybody hear me okay?
It's working. Go ahead. Yep.
That's great. Thank you. Dr. Lowe, sorry to be pummeling you with so many questions this morning, but you're used to it, I think. You know, you got a lot of pressure on you, a lot of weight, and we are all very mindful of that. And so I hope you don't feel like you're being ganged up in any way. If anything, it's very much we're coming to you because we respect you so much and we know that we need you. My question was sort of covered when Mayor Brown was asking it on the isolation spaces. I wasn't sure if it would be within a specific space. And then I was wondering in my head, you know, if you're in Southwest Mississauga and let's just say, you know, this is located in Northeast Brampton, would that cause difficulty? Is there a flexible plan? Are the spaces flexible where we could move them? It doesn't look like that's the case. And then I was also wondering if we were going to open up something like a hangar, like a former military base, you know, something with, you know, very extensive floor area, like a large building. But you said it, that it was a former hotel converted into a homeless shelter, converted now into an isolation center. So I guess one question then that I would have that wasn't covered, who's going to be caring potentially for these sick or symptomatic persons? You know, are we going to be getting, as part of the bundle, medical officers or nurses or something like that?
So yeah, thank you. So through you, Mr. Chair, to Councillor Kovac, thank you so much for the question. I believe that it does cover medical teams. I believe there are medical teams that are currently on site. I don't believe that the federal government grant will. I'm not sure if that will be covered. I have to go back and check with my team. But there are medical teams on site that provide care, and so that would be essentially those would be the people that would essentially be providing care.
That's a good answer. So I guess I'll wait on that. And then just very quickly, I know everybody's wanting this to move along. I guess it's somewhat in relation to Mayor Crombie's proposed motion, but if anybody has seen, there's a Toronto Star article talking about King Street Food Group owing $45.8 million, $23.4 million in assets. They own a chocolate shop, 8 restaurants, including Buca and Jamie Oliver's Jamie Italian Restaurants. And this sort of conversation about the economy, and somebody at council the other day referred to it as a business pandemic, I thought was interesting. And I know that's not something that you're interested in covering because rightfully so, you've said in the past you're not an economist, you're a medical expert, and we need to appreciate that and everything else that you bring to the table. But just 2 quick excerpts smaller businesses or individuals are also being owed by the company. They range from $700 owed to a Toronto knife sharpener to hundreds of thousands of dollars owed to several wine agents. People focus on the restaurant going down, but there's a whole supply chain that's affected. There's the meat supplier, the cheese supplier, the produce guy, the mushroom guy, the electrician. And I think this is often when we talk kind of like the negative economic effects, we think, the small businesses, we think restaurants, but we don't realize this whole chain, that it's like a domino effect, that everybody gets affected. And when we talk the essentials, I don't even know what they are. That's such an ambiguous word, but I guess food, water, shelter, those are the three life necessities. Grocery stores have to remain open. And then it seems to me that kind of blurs the line. If you keep grocery stores open, and those are rather large, so that's now blurring the line, because if we're going to say, well, we're going to keep them open, but we're going to shut down box stores, or we're going to shut down all other businesses, it tells people that that's a contradiction. And I know that it's hard for us to kind of tackle it in any other way, but I think that's what's creating so much confusion and uneasiness. It's these unanswerables. It's that we're doing the best that we can. And I guess we're not sure what the best way around it is, but it's appreciated, your advice, I guess the proposed motion, and I'm unsure about it. I'll end it right there.
Thank you. Councillor Palleschi.
Thank you very much, Mr. Chair. Thank you, Dr. Lowe, for starting off by thanking us. It was very, very much appreciated. We, to building off of what Councillor Kovac was saying, we very much appreciate having you in this position. We know we have the best person for the job, and I know you're taking a lot of questions from politicians that are getting questions from the residents. So it's the flow factor that's leading up to the one person, that's you, Dr. Lowe. Dr. Lowe, we're officially in wave 2, and I still don't believe that we are being strategic in defending against the spread of this virus. Now, I know I'm not the expert, but we continue to provide greater support to areas that are less infected than other areas. And in talking about the new site in Mississauga, talking about the testing centers the multiple testing centers that Mississauga has had, even when Brampton surpassed Mississauga in the numbers. And this is no disrespect to my Mississauga colleagues, absolutely none whatsoever. I have to speak on behalf of, and I think my role would be reversed if I was sitting in your shoes, saying that these are the areas that are most infected. Those are obviously the areas that need the most support, but I still don't feel that we, and I mean we as in all of government, is providing those residents with that support. I'm not sure we have zones that are identified, and we have zones that are identified mainly in the northeast area of Brampton. I have one red and I have one pink area. I question that pink area because I think the majority of that population is cattle in the northwest end of Brampton. I'm not sure how that case by per 100,000 comes to increase that color, but what can you tell me about how we're actually being strategic getting out to northeast Brampton to provide them with the level of support that they need, greater than everyone else in the region of Peel?
So thank you, Councillor Palleschi, through you, Mr. Chair. Thank you very much for this question. It really helps me to emphasize again what I had said in my remarks. Absolutely, testing, all the other pieces that you identified, those are all part of the continuing conversation. But one of the biggest drivers in our community that continues is disparity. And I think that's why I made very clear in my remarks early on, the closure right now is needed to just bring the cases under control in the short term. We need to reduce in-person interactions as quickly as we can. We know it's not necessarily where we wanted to be, but it's about retooling and actually just buying us some time. But I'm planning to bring to council a more concerted plan in the coming weeks. But I've identified some of the pieces that I think we really need to talk about. Workplace blitzes, those have been continuing. We need to do more of them. We need to make sure that employers are taking every precaution to protect their workers, to make sure that they're not getting COVID-19 at work. Income supports and a paid sick leave. I have identified that because that takes out the equation where people, they may need to self-isolate because they're sick or they've been exposed, but they're choosing to work because they got to put a roof over their head. That's absolutely another one, and that will help to stop the spread. The isolation center, and certainly recognize the challenges. We in between the balance of moving quickly versus moving into neighborhoods there. I can tell you that the discussions are absolutely continuing around how do we start getting voluntary isolation supports in the neighborhoods that need it, where people are living in large houses with large families, with multiple families. So that conversation is continuing. Additional sites are anticipated to be announced once the official announcement goes out today, and once we've had a chance to chat with the communities and discuss things. We're engaging with the communities as well. I've met with so many different community leaders, physician leaders in the community, but also faith leaders, cultural leaders, trying to figure out what are other channels, what are other ways we can get messages out there, how can we make sure people are getting them in a manner that's culturally and linguistically sensitive, that targets those areas. So absolutely, these are all parts of an overall plan that our team is actually in the midst of putting together in a nice little package, but I've started speaking to, as you can hear, in terms of trying to bring forward and continuing to put forward a roadmap that will make the most of this pause. And I think the last thing that I'll mention in terms of things, just to quickly explain the data, you're one red and one pink, where you're thinking that the area is mostly cattle. That might be a small number problem. So basically, if you've got only a small number of residents there and a number of them are testing positive, then you're going to see pink, just because it's a smaller number of people, and so proportionally that gets sorted out. So, but anyway, Councillor Pellecci, I really thank you for this question, because again, I can't highlight and emphasize enough. The pause right now is needed, and I know it's frustrating. I know it's incredibly frustrating for everyone, but it's about just reducing interactions quickly so we get numbers under control. But we must make the most of this to put in place those other underlying factors to support these people, ultimately these really vulnerable people, who are actually suffering from COVID, who are the ones who are bearing the brunt of this disease, to make sure that they get the help they need as well.
And that's exactly why you're the best person for the job, Dr. Lowe. And that's what I need to hear. That's what my residents need to hear as well. When you say that you are meeting with all of these, different organizations, groups and stuff, you mean you as the collective, right? You have a team behind you. It's not individually you. I don't want you walking down the street one day because you're up all hours of the night and talking to everybody and you drop dead. Like, if Dr. Lowe gets, and this is a question that I asked in the private sector a lot. Dr. Lowe gets hit by a bus tomorrow. What's the next plan? Life has to go on, right? And heaven forbid, knock on wood, you're not going to get Dr. Lowe. But I need to be, I'm sure that you have the team behind you. Yes. You're constantly working. Thank you. I appreciate that. Dr. Lowe, so it was the initial wave that we were in, and we had started dabbling in what does wave 2 look like. We're now officially in wave 2. So let's start talking about what wave 3 looks like, because I believe, and I may be wrong, but I believe that wave 3 is going to come. And I also believe, like wave 2, wave 3 is going to be worse. Now, wave 3 could be the spread of the virus, or wave 3 could be the collapse of an economy. I'm not sure what wave 3 looks like yet. But when do we start talking about it? When do we start looking at, the shot that's coming out? I'm sorry, I'm drawing a blank. Not the cure, but the vaccine. Vaccine, yes. The vaccine that's currently being tested and being put through the system. I think 3, maybe even there's 4. A 4th company I think has just come out. When coronavirus started, it started with 1 strain. Then it quickly moved to 3 strains. Now we're looking at today 6 different strains of the coronavirus. So I don't know what that looks like in terms of, you know, the testing of the vaccine that they're doing, but there's all these different, you know, moving parts at play here, and I think they all take into they're all a factor when it comes to our wave 3. So can you speak to wave 3 a little bit?
So through the chair to Councillor Palashi, first of all, I want to reassure you that I do have a really excellent team behind me. And so if something untoward were to happen, there would certainly be people that are also involved in engaging the community, as well as all the other questions and planning and pieces that have been identified. They have done yeoman's work, person's work. I've been really supportive with them. I've just been really grateful. And certainly, as mentioned, I've been really grateful for the support of council as well. I think that's been really significant and helpful. In respect of wave 3, my hope is that we know enough now, at least around some of the underlying factors of transmission that I've just identified, that if we actually manage to get these things in play, we can stop some workplace outbreaks, we can stop some, you know, household transmission. I mean, these are the pieces that we've been working on, we've been trying to get to, but it just happened that human behavior being what it is, and the nature of this, the insidious nature of transmission of this disease, the wave arrived at when the wave arrived, right? And we've been case and contact managing. We were able to case and contact manage, as everyone on council recalls, through September and October, with great effect in terms of trying to keep things, you know, level through around 60 cases a day throughout September, and then in the first part of October, really trying to keep it up, going at around 110 cases a day before the Thanksgiving surge came and the wheels kind of fell off. But I think really we know enough about this virus now, both in terms of where it is in our community, who it's impacting, the disparities that are driving transmission, that if we put some of these additional measures in play, in terms of better worker protections, in terms of the paid sick leave, in terms of all these other things, I think we're going to do a much better job of protecting the vulnerable, which means ultimately we're doing a much better job of protecting all of us and the economy in the long run. So yeah, absolutely plan for a wave 3, but I think we know enough now that if we target some of these things that are causing people to be together in crowded, close contact, hopefully any wave 3 would not be worse than a wave 2. It would be attenuated. And hopefully we can attenuate it long enough that the vaccines that are certainly coming out, and I will say the vaccines, yes, there's different strains, but ultimately the testing of the vaccines are targeted at portions that are more stable within the viral genome, so those don't change. So even though the strains are different, it's kind of like, you know, you have a 4-door Honda Civic versus a 2-door Honda Civic with a spoiler, like whatever, I mean, but it's still a Honda Civic.
So it's essentially the SARS component of the coronavirus is what it's...
Exactly. Yes. Yeah. But I mean, so that gives us some hope that, I mean, like I said, we know what to do now in our community. We just need the resources and the wherewithal to do it. And like I said in my remarks, I'm doing it with our team and certainly with the rest of our community partners to try to figure out how we get into those harder hit neighborhoods and make sure that we get it under control there, together with bringing it down throughout the community at this point in time.
Well, thank you, Dr. Lowe, and please keep letting us know whatever there's anything else that we can do to help, and I look forward to having that strategic outline come forward soon. Thank you, Mr. Chair.
Thank you. And just to help everybody out here in terms of time management, it's now about 11:18. I lose Dr. Lowe in 12 minutes. And I think we want him here to speak to the main motion that Councillor Crombie is bringing forward. As we speak, my list on this subject, questions of Dr. Lowe for his previous presentation, is Crombie, Raz, Sato. Mayor Crombie, do you have another question of Dr. Lowe based upon the earlier presentation? None, thank you. Councillor Raz, do you have another question of Dr. Lowe?
No, I did not, Mr. Chair.
Very good. Councillor Sato.
Sorry, Mr. Chair, I took my hand down, but I do have one quick question, Dr. Lowe. With regard to the isolation centers, and I do agree with Mayor Brown that sending residents from the north end of Brampton to Mississauga is not ideal. So I hope you will bring that forward when you meet with the federal reps today. What is the security and checking like at these isolation centers? So if you're putting a lot of people that are COVID positive into one location, what are their what is the security, I guess I'm asking?
It's a fair question. So through you, Mr. Chair, to Councillor Sato, it's a fair question. My understanding is that they do provide wraparound care to these individuals, and in the course of their showing up at the center, they understand that they will be kept at the facility for the duration of the time that they need to self-isolate. Certainly, I will be able to release further information, obviously, after the announcement comes out.
Okay, so just I guess in general terms, it would almost be like they would be put into a hospital setting without hospital care.
So through you, Mr. Chair, to Councillor Sato, no, the aim would be that there would still be, as I mentioned, a medical team on site, so they would still be receiving health care. These are, again, if any individual were to require hospital care, I would imagine they would be transferred to a hospital. Absolutely.
Okay, but there wouldn't be opportunities really for them to decide to go out into the community and go to to pick up food somewhere.
No, so through you, Mr. Chair, to Councillor Sato, as I mentioned, the aim is wraparound care. So they would have their necessities, the supplies, all those other pieces would be provided for the duration of their self-isolation period.
Okay, and I would hope that we are looking at other locations that we could get these residents, especially the ones in the Malton and Brampton areas. I think the rest of my area is very low numbers, thank goodness. But I think it's very important that that we deal with that. Right now, I guess the most critical thing, and I won't ask you about the shopping issue because I don't think that's something you can really respond to. But thank you very much, and go get the feds today. Really, you know, I think you've heard today the concerns that we need to have. So thank you.
Thank you. I have a motion to receive Dr. Lowe's presentation moved by Groves and Kovac. Is anybody opposed? If not, that is carried. Thank you, Madam Mayor. That brings me to you for your motion, seconded by Mayor Brown and also Councillor Groves. I'm going to ask you to speak to it. A quick response from Dr. Lowe. Patrick O'Connor is on standby if he needs to speak to it in terms of if any legalese or process comes up. So with that, Mayor Crombie.
I will be brief because time is of the essence, but we have asked people to stay home and have contact with only their immediate families, and we've shuttered all businesses. We've told people to go out for only the essentials. Unfortunately, people are going out and they're flocking to the big box stores. We've seen what has happened there. They're not masking. There's no crowd control. There are no capacity limits. They're not honoring 4 meters per person. There are large crowds outside and they're shopping for more than the essentials. These items can all be purchased online. They should not be going into the big box stores to purchase anything other than the essentials. It gives a very unfair advantage to big box stores. It is not, and I intend to hopefully level the playing field. They're exporting profits at the cost and at the expense of our small retailers, our small businesses who have done the right thing. They've shuttered when asked to, and yet we have big business, big box that are making huge profits and not honoring the rules either. I think there are considerable health and safety concerns, and I'm asking you today, Dr. Lowe, on the basis of community health and safety, to restrict which items can be retailed, can be sold at those big box stores. Certainly, we've seen precedent for this in Manitoba, in Winnipeg. It is working very, very well there. So it is easy to do. We know that it is. They can cordon off those aisles that are not the essentials. And what do I mean by essentials? Groceries, personal care products, medicines, pharmacies, baby items, etc. What's not essential is gifts and electronics and home decor and sporting equipment. That can still be ordered online, hopefully at a local retailer, hopefully local, because we encourage people to shop local online or at one of the other larger department stores, and you can pick it up curbside or have it delivered to you. This will go a long way to supporting small businesses in our area and leveling the playing field. As you know, had a call when I was up to speak earlier with the Premier and the CEO of Walmart. Their preference is that all stores reopen and reopen safely so as not to impact the supply chain. And that's very well and good. But we have to follow the rules of public health. And you have shuttered small stores, and it's putting them at a huge disadvantage. Many of them are struggling. They are our friends, our neighbors, they're entrepreneurs, and many of them are family members. And we know them all. They're members of our community and they contribute back. They're shuttered. They're using their life savings to keep afloat. Meanwhile, the big box stores are profiting and have never experienced such high sales ever. So it's unprecedented for them and it is blatantly unfair. So we're asking, fine that they stay open. People can continue to go shop for the essentials, no problem. The essentials, the groceries, the personal care products, etc. Anything else should be fair game. Same rule applies to everyone. Online shopping, curbside pickup or delivery, or to have it delivered right to your door. That's what's fair. That'll help us to control the virus, and it'll reduce the lineups and the capacities inside those big box stores. So, seeing if I've missed anything. I think that's pretty much the extent of it. I wanted to highlight two areas. One, we need to stand up for our small businesses who are doing the right thing because we asked them to shutter because we want to control the spread of the virus. But number two, there is a health and safety issue at stake here with the capacities that we have seen, over capacities we have seen in these big box stores, not controlling crowds, not base covering, and huge lineups to get in. So I think there's a very unfair competitive advantage that the big boxes have, and the intent was to level the playing field and do something similar to what Manitoba has done in Winnipeg, which is probably the same size as the economy of Peel. So if it can be done there, it can be done here. That's my motion, and I hope that the seconders, both of them, will speak to it as well. Thank you.
Thank you. So now, Dr. Lowe, if you can speak to it, and Patrick, our solicitor, if you might want to comment on it as well, you're up accordingly. Dr. Lowe.
So through you, Mr. Chair, thank you, Madam Mayor, for the question. I think the calculus of the question at this point in time is, does the closure of non-essential goods within a big box store that remains open address the issues that you've identified? Certainly the lack of masking, the capacity limits. What I understand in the provincial framework and the provincial decision to close these retail, close small retail, and in these is that there are also additional limits within the gray lockdown zone in regulation that big box retailers are meant to adhere to. Those are designed already to reduce the risk of the communicable diseases in those settings. So certainly it's something that I can commit to taking back and looking at, but just on the face of it at this point in time, the use of a Section 22 order, and I'll let our regional solicitor speak to it, speaks to directing measures that must be taken to decrease or halt a communicable disease threat, and is typically issued in the absence of regulation to the same. My understanding is that, as I mentioned, the provincial regulation specifies measures that need to be taken to do so already, and and based on the data and my understanding, I think cordoning off the sections that are non-essential doesn't necessarily solve the problem of enforcement around distancing and masking, which is really already specified as a requirement within the regulation. So I think the possibility that the use of this instrument in that manner is remote, but I certainly do hear you on the competitiveness piece and the fairness piece, which is unfortunately not a matter of health and safety that I can speak to. So I think in that case, I would stop here. I'm happy, by the way, Mr. Chair, to remain on for the discussion of the motion a little while longer, because I do know that we have it's mostly prep time that I was meant to leave at the bottom of the hour. But I do want to be as part of this discussion as long as I can, recognizing the importance of it, and certainly would defer if the regional solicitor wishes to offer his perspective on the use of a Section 22 at this point in time.
Thank you. We will ask him now. Patrick, was there anything you wanted to speak to with regards to the Section 22 and the bylaw framework?
Mr. Chairman, thank you. I think Dr. Lowe has stated succinctly and well the test that he is required to look at in considering whether to issue a Section 22 order. I mean, the request can be made to him, and he has indicated a willingness to take it back. But that said, he is, I think, indicating a leaning, and that leaning is proper under Section 22 of the Health Protection and Promotion Act. He has to come to a conclusion that it's a necessity as a matter of health risk management to do the things that he is enabled to do using a Section 22 order. And that's the bar that he has to consider. He understands that and is well prepared, I think, to make an appropriate determination.
Mr.
Okay.
Chair, I still have the floor. I just have another question.
Go ahead.
Thank you. So if it's not a Section 22, or it could be, but he's going to go back and think about it, is it within the power of this council to pass the motion to ask those retailers to do so?
Perhaps Patrick or whoever, gentlemen, go ahead.
If I understand the question correctly, certainly council could pass a motion requesting retailers to comport themselves in a way that levels the playing field, addresses the inequity, but that would be a matter of request, if I understand the question correctly.
And if so, such would not be enforceable, Patrick?
Yeah, merely passing a resolution states council's views on a matter, but does not give rise to an enforceable requirement.
But certainly would go to a long way to show our goodwill and show our support to our small businesses and encourage those large retailers to do the right thing.
Okay, thank you. My list of speakers and questioners is Sato, Paleschi, Groves, Parrish, Raz, Brown, Demerla, Daskal, and Thompson. Councillor Sato.
Thank you, Mr. Chair. Yesterday at council, when I spoke about this, I thought it was a good idea that it's easy to rope off aisles, but we were brainstorming and it was kind of a throwout. Then I sat down and really thought about it and what the impacts were and would it really help? It's not going to help small retailers. They're still going to be closed. So it's not that people are going to flock to the small retailers. My residents are going to drive a very short way to Milton. 10 minutes away. Councillor Raz's are going to go across the street into Oakville and go to the same stores. They're going to order online from the Costco's, the Walmarts, and they may do curbside pickup, but they're still going to buy those goods. It's not going to stop the shopping there, and I don't think it's going to redirect to the small businesses. I've had concerns. I've had a fair number of emails. Not one is supporting this. The concerns that were raised were the employees. A lot of my residents, I have 2 Walmarts in my ward. A lot of my residents that have precarious employment are working at those 2 stores, plus the other larger superstore, et cetera. They're concerned that they may become redundant if part of the stores are closed and that they would lose their jobs. And they're not going to have any money to support anyone if they do that. My members of our accessibility committee raised a concern, a couple of them, that they cannot access, even if the small retailers were open, that they can't get their wheelchairs into a lot of those smaller stores. And because they are low income, they depend on the larger big box stores for the lower pricing. Yes, it will drive them online. They will order from Amazon. And, I have to say, it's in Councillor Carlson's ward, but the large Amazon warehouse is adjacent to Ward 9. It's right on the boundary. And it employs thousands of residents that live all across the region of Peel, many of whom live in my ward because it's close for them to get to work. So, we do, we don't want to support the big head offices, but we do want to support the employees. And so we have to look at that as well. It's also very subjective as to what is essential. What might be essential to one person isn't essential to another. And I did look at the Winnipeg list. And, we're telling people to get out and exercise and participate in activities. But one of the items on the list is sporting equipment. So, it's a little hard to say go out and exercise, but no, you can't buy the equipment that you might need to get out and exercise. There are, I think it's a very short list, quite honestly, of items that would be considered non-essential. You might look at stuff like home decor, perhaps jewelry, perfume, stuff like that that are, nice to haves, but not must haves. So I'm not really sure how much of those stores would actually be closed off. You can't close off clothing. I know Winnipeg, I think they said winter outerwear. Well, kids are still going to school and parents still need to buy clothing for their kids. So they may consider that to be essential. Clothing to, so, are you going to say outside clothing or indoor, So I just don't, the seniors also, in my area, they love the early hours for the big box stores because they can go and they can buy everything they want in a very, very reduced numbers of people in the stores. And again, they don't have as much of the access to the smaller retail stores that we may be speaking of. I mean, the real answer is to, the smaller stores to allow them more ways and more support to operate. It's but by reducing, the ability of residents to purchase items that they deem to be essential, I don't think it's not helping them. And if you were to say that that would reduce, the only way I would support this is if you said that by reducing the aisles in the stores or, access to the aisles in the stores, removing stuff off the aisles, as people are still going to be moving around the stores, you're still going to have the same number of people probably going to the stores, that is going to reduce the risk, then I would support this motion. But I honestly, I don't think it's well thought out. I don't think it covers all of the concerns that people have raised. And I think it needs a lot more consideration. And I think we should be pushing the province to be doing more for the small businesses. All I think it's going to do is drive people from spending money in the region of Peel to spend their money in York, Oakville, and Milton and beyond. It's not going to stop them from shopping. I mean, let's get real on this. They're still going to go to Costco. They're going to go to Walmart. If they want to go there, they're going to go there. But they're going to go there somewhere else, not in the region of Peel. And that's a health concern for me because we're trying to tell residents that live in Peel, which is a gray lockdown zone, not to go outside the region. We don't want people spreading the virus in those other regions that have lower numbers. So basically, we're going to be pushing potentially, let's go send people who may not be symptomatic, but may actually have the virus, go shop somewhere else and, and increase those numbers. And I just think there's a lot of health concerns on this. So Dr. Lowe, I would, I'm going to wait and hear your advice on this. If it was really, really going to help our small retailers, I would be jumping on it. But the only thing that's going to help them is to enable them to have people shopping. And that's up to the province. So thank you.
Thank you, Councillor Paleshi.
Thank you very much, Mr. Chair. I think, Mr. Chair, you can take the comments that Councillor Sato made and insert them exactly as to what I wanted to say. With just one minor thought was, we have people that are making these decisions that don't know what it's like to not own a computer, to not afford a cell phone, to not even be able to have a credit card. And we're making these decisions thinking that, they'll be okay. So I don't support a reduction in service. I've also received a number of emails late last night and early this morning. And I think I understand and I applaud Mayor Crombie for what she's trying to do and supporting the small business. but I think that the discussion needs to be around how really can we support the small business and allow them. We already know that the small businesses were operating safely. So how can we try and advocate on their behalf to the province to try and get them to be able to open? And listen, I don't mind standing in a little line to go into, you know, a shoe store or a boutique or something that is limiting the amount of people that are going into that store. And that store that limit may only be 2 or 3 people. And if that's, you know, the safe way to allow people into that store, then, you know, that's what I feel more comfortable with. I've been to the Costco's, I've been to the Canadian Tires, where you get stuck in an aisle. All of a sudden, there's people coming at you in all different ways. There is no social distancing in these big box stores, and these smaller businesses have more of an ability to provide that social distancing than any of those big box stores. The big box stores can't handle the amount of people that are going down aisles. They just don't have that many employees to make sure. And nobody's following the directions on the floor. Nobody likes to be told what to do in a world where everybody's telling them what to do. So you know, I support a discussion on the advocation efforts that we can provide, and to send up to the province to say, you know, we need to help our small businesses, and we need to rethink, or we need to ask them to rethink these plans of shutting down the small businesses. The small businesses are the economical driver of our municipalities. We already know that. So thank you, Mr. Chair.
Thank you, Councillor Groves.
Thank you, Mr. Chair. And I too, actually, I was prepared to support this motion and seconded the motion because many of our small businesses, I've been hearing from them since the beginning of the shutdowns that they are struggling. And as we're well aware, businesses in Bolton, they've been struggling for quite some time, and this pandemic has made it even that much worse for them. But listening to, I've had a number of emails as well and phone calls and people actually texting me because they're listening to our meeting right now and voicing their concerns with the motion and closing down aisles in these big box stores. And I guess some of the things that were raised is affordability, and I think Councillor Stato spoke to that as well. There are some folks who are not able to afford certain items in other stores that they might be able to get it a little cheaper in the big box stores. And the other concern is the online. I guess if we close down these aisles in some Walmart, let's say, and they're going to be going to Amazon, and they're going to order from Amazon. So I don't know, and I certainly support and commend Mayor Crombie for what she is trying to do in advocating for these small businesses, because I think we do need to do that. But I don't know what the solution is. I don't know if this is a solution. And I think Dr. Lowe spoke many times regarding the transmission and how people are picking this virus up. It's not in the restaurants. It's not in the stores. It's in these large gatherings. And so I think that we need to do some advocacy, and maybe the 3 mayors and you, Mr. Chair, and maybe a resolution from this council to the province of Ontario to figure something out for these small retailers. I can tell you some of my retailers here, they're at the brink of closing, and they are not sure if they're going to be able to reopen when this pandemic is all said and done. So I don't have the answer. But I can tell you that we do need to figure something out, and we need to push the province of Ontario to figure something out to help these small businesses survive this. Thank you.
Thank you, Councillor Parrish.
Thank you very much. I don't want to pander to Bonnie, but you've done an incredible job through this whole pandemic. I don't happen to agree with you on this one, but I know your intentions are fantastic. There's got to be a better way of doing it. If Dr. Lowe concludes that Section 22nd can't be applied, I'm concerned about lawsuits on this. If companies start losing money and they get together and decide that they're going to whack the city with a lawsuit, I don't know what our defense is. There are, number two, lots of people with no credit cards and no access to the internet. A lot of them live in my riding. I once had a young employee when I was an MP that I had to get a joint bank account with because he couldn't open one because of his credit rating. So there are people out there that can't pick up the phone. They can't use a credit card. They can't order from Amazon. Number three, who decides what's essential? If we can't police distancing in the big box stores now, which Bonnie pointed out, how the heck are you going to police what goes by on the conveyor belt? My grandson works at the big Loblaw store on Dundas and Mavis, and he gets people arguing with him for 20 minutes because he can't take a coupon. This is completely, you're putting too much responsibility on the heads of kids and young people and people who are in precarious jobs, because if a customer complains, the guy at the checkout goes out the door. And I would decide a gift, a toy at Christmas is essential. And that would be my decision. So I don't know who decides what's essential. The other thing that upsets me a bit is hairdressers and restaurants are losing their clients to other regions. And you find a new hairdresser, you like the new hairdresser, you never go back to your old one. And it's not that far a jaunt over into Oakville. And my hairdresser last Sunday worked, I think, 11 hours. The cleaning he was doing between clients, the masks, the stress he was going through, he's going through all the time. Because restaurants and hairdressers and nails, I've never been to a nail place, they're under strict health controls all the time, every year, every day, every month. That's probably the safest place to go. And Dr. Lowe knows about a report I gave him about unsanitary conditions right in a hospital. That I was very upset about. And we had no control over that. So we have to do more to allow small businesses to provide services and products under strict controls. And if there's a breach, you shut them down. And that's what we have to do. And we got to get rid of this. I don't feel like wearing a mask, or I feel claustrophobic. If you have a difficulty with a mask, order from Amazon. If there's a single person in the store without a mask, you close the store down. I believe in human rights, but the alternative is closing all the stores down, period. So I think the mask is essential. I think the distancing is essential. And I don't think financial help's going to do it. I think if you lose clients from your shop that have been going there for a while and they go over to Oakville, you're not going to get them back. You're not going to get half of them back. So I think we have to do more to allow the small businesses to operate. I'm hoping Dr. Lowe, if you have and Mayor Crombie and Mayor Brown, if you have the Premier's ear, you have to say to him, we want our small businesses to be treated like adults, responsible adults, because really, that's not where the spread is. We've talked about this. The spread is house to house, big parties, celebrations, weddings. That's where the big problem is. So, and we have to protect our essential workers. My grandson, I mean, God bless his little soul, it wants to be independent and earn his own money. But there are people there working with him that if they lose that job, they can't feed their kids. So let's look at the other side of the coin and talk about doing more to allow the small businesses to reopen. Thank you. I can't support the motion.
Thank you, Councillor Raz.
Thank you very much, Mr. Chair, and thank you, Bonnie, for putting the motion forward. We've had so many discussions, both here at the region and at the city, on how our businesses are struggling, and we're trying to make decisions, good scientific decisions, in light of all of the challenges. And here, I feel that this motion is a bit of an overreach, one that's getting into economic policy and not really dealing with the health issues. Dr. Lowe said even if you cordon off the aisles, it essentially wouldn't make a difference. That's not a compelling enough reason. I think too many people who shop at Costco and Walmart do so for a reason. And it doesn't, it may seem on its face to appear to be something that can help level the playing field, but I absolutely don't think it does any of that. When we started going through this pandemic and the whole, much broader regions were shut down, we truly felt like we were all in this together. And now that we have neighbors across the street, into Oakville that have very different limitations. And when you live in Southwest Mississauga, you probably do a lot of your shopping in Oakville, grocery shopping and restaurants and whatnot. It's just people on the Mississauga side. Well, how are we different? I know that the numbers may be up, but they just can't relate to them. And same with the small business owners. They can't understand why somebody across the street is allowed to open. And I know we've had these conversations, but I don't think this motion addresses the core issues. When you look at places like, I know Manitoba, there's other examples. Saskatchewan, also a small population-wise for province, but I follow Dan Kelly from the Canadian Federation of Independent Business on Twitter, and he said that Saskatchewan found a common sense pathway to retail restrictions, 50% capacity, and all small retail can remain open. And if there's greater physical distancing and fairness are the goals, this works, and that resonated with me, and I think it probably would to a lot of people around this table as well. So unfortunately, I can't support the motion. I don't have another motion that would help correct the situation, but once you get into making these economic decisions without fully thinking them through, then I think we're getting into some dangerous territory here. Thank you, Mr. Chair.
Thank you. Mayor Brown.
Thank you, Chair Unica. A few things I want to say here, and I want to thank Mayor Crombie for starting this conversation. And I think that's what Mayor Crombie is doing. I think she's highlighted she's amenable to amending the motion for what's legally possible and what's not legally possible. And the reason I welcome this conversation is, let me add a Brampton perspective. I got a call from a local downtown store, Restyle. They sell women's clothing, and I've been in there. My wife likes supporting that store. I've been in there with her, and there's 2 or 3 people there at a time. And they asked me why they have to close when you go into Costco and there's 1,000 people. And honestly, I didn't have a good answer for Evie and Emma and the family that runs the store. They're selling the same products, probably a little bit better, but they're essentially selling the same retail products that are sold at Costco. I got an email just yesterday from the Brampton TV and appliance store. This is a Pakistani-Canadian immigrant who sacrificed to start his own small business in Canada, a story that many have, where they pour their life savings into their business. And unfortunately, he got shut down by bylaw. He tried to open because he thought some of his household appliances were essential, and in terms of kitchen machines, and he was told that no, they're not. And he said to me, I'm selling TVs that they're selling at Costco. I'm going to lose all my business. I'm going to lose my livelihood. I'm going to lose my savings. And he says, why does Costco and Walmart get to stay open? And once again, I didn't have an answer for him. And that's tough, because normally, when we get questions from constituents, we can explain in a rational, reasonable manner why the decisions have been made. And I'm struggling with this. And so I'm glad that Mayor Crombie has started this conversation, because it's not an equal playing field. Right now, I feel like we've given a kick to small businesses right in the gut. And, if personally, I don't see small businesses as a source of spread. I would prefer if we could find a way to reduce capacity limits to small businesses and allow them to function. But that's not something the province is allowing right now. If anything, I would prefer us aggressively attacking where the transmission is happening, and as much as possible, surgically allow small businesses to open in a responsible, safe manner with an expectation of a strict adherence to the public health guidelines, and where there's not, we'd come down with strict enforcement. Because my heart really goes out. It isn't just a health pandemic, it's an economic tidal wave, and our small businesses are facing the brunt. Make no mistake about it, there's going to be bankruptcies. Make no mistake about it, there'll be people who lose their livelihoods. And that's tough to digest as a mayor of a city, and I'm sure Mayor Crombie is going through the same struggle. It's tough to get those phone calls. It's tough to read those emails. And I think the basis of Mayor Crombie's motion is to ask for an equal playing field. And that's what I hope that we can find some wordsmithing to do, is to ask the province to say that as a region appeal, we're not happy that there's not level playing field, and that we ask them, we demand the province, request the province, recommend to the province that they find an equal playing field for goods sold in big box stores and goods sold in small businesses. And maybe some provincial officials will come up with a creative solution of how they can better support small businesses, because whatever support's coming right now, it's not enough. Whatever support's coming in terms of the tinkering around the edges to support small businesses, it's not enough. And I think this is a volley to the province saying, do better. Saying, we know the province wants to keep these big box stores open. And I think if we make this demand, and they know that if nothing changes in a few weeks, maybe we will actually use a Section 22. Maybe we will get into a legal fight, regardless if it's on loose grounds. But I think this motion, and I look to Mayor Crombie if there's a friendly amendment, that maybe this is a recommendation to the province to create an equal playing field between small businesses and big box stores, or else we will look at other legal mechanisms, because we have to send a message that we have the back of our small businesses up against international corporations, big box stores, because this isn't just a health pandemic. And I think our small businesses are saying this is not a level playing field. And we all want to do what Dr. Lowe recommends. We want to make sure that we protect public health. But in that protection of public health, there is inconsistency. We protect public health when it comes to someone in a small business, but we can turn a blind eye for someone shopping for a TV in a Costco. We protect public health when there's someone looking for clothing at a small business like Restyle, but we close a blind eye when they're looking for clothing at Walmart. And so I think we need to really take that challenge to the province and ask them that we expect them to find a better solution for a level playing field for our small businesses. And so, Mayor Crombie, my question to you is there a friendly amendment that you'd be agreeable to, where this is, rather than the imposition of a Section 22, this is almost a challenge to the province?
Mayor Crombie?
Yep, thank you. So given the discussion that we have had, clearly this motion is doomed to fail. So let's make it positive and let's show our support for our small businesses and challenge the province to come up with a framework that it's more equitable, levels the playing field for our small businesses, if that's the approach you want to take. I do want to make a moral statement that this council supports our small businesses, and when what's happening is fundamentally unfair, we are driving the profits to large multinationals that are being exported out of the city, and notwithstanding that, people can still, no matter your income level, can still shop there for the essentials. I'm getting off tangent here. I just wanted to respond to some of the critiques that were made. However, if it's a moral statement, if you'll agree to that, then Mayor Brown, I support you. Let's amend it so that we're making that moral statement that we support our small businesses, and that we think that we're asking the province to come up with a more equitable, a fair framework for them so that they can remain open, whether it's limited capacity or, well, maybe we don't even want to give them the suggestion, let them come up with the framework, but allow them a level playing field so that those big box stores don't have an unfair competitive advantage, because they do. So sure, if we're going to vote this down today, I don't think that helps business. They will just feel like we turned our back on them again today. So let's not do that. Let's change it so that it's positive, and we're asking the province to however you want to word it, Mayor Brown. I haven't looked closely at the nomenclature here, but a framework that will work for small and large businesses to level the playing field and fair for everyone.
Maybe we can wordsmith it with the clerk while other speakers are on the list. But I think the general thesis of what you said initially is this is a challenge to the province, and so we can. And I think they've heard this. They've all seen the news that the Region Appeal was considering a Section 22, and so I think there's, at least for the provincial ministers I spoke to, there's a real concern that they need to do something. And so I think this motion will be helpful, and it incorporates the concerns that the councillors have said.
Thank you. And the team here is wordsmithing as we speak in the back corridor here. So but we will carry on with other speakers, having heard those last comments. Councillor Demerla.
Thank you, Chair. I want to thank Mayor Crombie for bringing forward a very important conversation, and Mayor Brown for steering it in a way that might be easier to support. I can get behind a statement of support for small business. The only thing that I would like as clerks wordsmith this is that it has to be supported by Dr. Lowe and evidence. So I'm happy to support small business, and if the evidence says that small businesses can be open without COVID spreading, I am there, up there, happy to support that. But I want to make sure that it's not council asking for something that flies in the face of what Dr. Lowe or his evidence might be looking for. So I'd just like to make sure that the language includes that the framework, it's evidence-based, and it will not in any way, increase the spread of the disease. So that would be very important for me to be able to support the motion, because I don't want to be seen as just asking for something that may not be medically supported. I'm not saying it's not, but I just want to couch it in those words. The other thing, Mayor Crombie, that you may want to add as a friendly amendment, because I really liked your idea, was around asking the big box stores to follow the rules. It is true that they're not following the rules, and I heard Patrick say we don't have the ability to tell them that, but surely we can ask them as part of our motion, so perhaps you can add that as well. Thank you.
Thank you. Councillor Dasko.
Thank you. Through the chair, I just wanted to, first of all, applaud Mayor Crombie for bringing this to the forefront. This is something I think that has just been boiling and percolating, because there's one phrase that the chair of the Port Credit BIA has, and it's big box thrives while Main Street dies. And I do believe that I think what the real intention here is, it's not to question the science, it's not to question what's happening. It's a question of equitable treatment, and recognizing that and I'll say Mayor Brown has got a good point, and I've said this. I said this at council yesterday, and I continue to. We're not just
pandemic, we're also in an economic pandemic, and this we can't just turn a blind eye and say that this isn't the reality, because it most certainly is, and this is where I'm a firm believer that if local shops been in several, I'm a firm believer in shopping local wherever possible, and always promote that. It's a big thing. For example, yesterday the mayor had a gentleman by the name of Louis, who owns a place called The Cabin, which I frequent. Every time you go into that shop, they have somebody that's checking your temperature and recording when you've entered their place of business. Others that do that as well. So I think, yes, indeed, I think the execution and the framework needs to reflect some practicality. and that's if people are breaking the rules. I circulated with our council as well on October 25th. I happened to be in a big box store, which I left because it was literally people climbing all on top of each other with no social distancing in place at all. People with their masks down below their noses and things of that nature. And very unsafe by all accounts. So, if there's some retooling or amendment that we can come up with here, I do believe that a strong message needs to be sent, and something that is, maybe it's more heavy-handed on the enforcement side of things, but it's got to be more equitable. This treatment of winners and losers, the way this is unfolding, and it doesn't look like we're out of the woods anytime soon. But let's look at where the real problems lie, and that's in the gatherings and things like that. It's certainly not in our small businesses. So, hoping we can retool something a little bit here, and I'd be happy to support that.
Thank you. I don't know if our solicitor has a thought on this or if he's helping with the wordsmith, but he's come on my list. Patrick, any thoughts?
Yes, thank you, Mr. Chair. I do have some wording to propose at an appropriate time that I'm attempting to capture what I perceive as being council's intention.
Very good. I will come to you when the question is put. Then carrying on, Mayor Thompson.
Thank you, Mr. Chair. And Mayor Crombie, thank you for bringing this forward. And I think you've already made a huge statement. And when you've got the Premier calling you along with the CEO of Walmart, I think that tells you that you've definitely brought awareness of the issue. So I do agree where Mayor Brown was going. That's where I was going to suggest we go, is we send back a moral statement, basically holding the province accountable that our small businesses are just as vital as the big box. You look around our communities, it's our small business that is the glue that keeps our communities together. Look at the sports shirts of any team. It's the local small business that supports those guys. It's the small businesses that support the events. This is the time that we need to have their back. I can totally get where you're going, but I got to say, I do not know what Councillor Parrish had for breakfast, but I totally agree with her and where she was going. And we very seldom ever agree on a lot of things, but today this is a big one, so we'll mark it on the calendar. And I got to say, Councillor Sato, you did hit those key issues right. But I think there isn't one councillor that sits at this table that does not care for small business. We all do, and we're all trying to find that fairness. But this is a provincial initiative. We clamp down on the big box. We all lose because they're going to go to the surrounding areas all around us that's still open, and it doesn't solve the problem. So I really think our job is to stand up for small business and hold the province accountable. And I think that's the message we need to send today. Thank you.
Thank you, Councillor Innes.
Thank you. I would ask, all the points have already been raised that I would have said, and to Mayor Brown's point, this is about fairness. When my small businesses said to me, why is the Walmart's open and selling clothing, even though their clothing is of a different caliber? The reality is, I don't have an answer. We didn't have an answer. And I think that needs to be posed back to the province, that they need to give a better answer or to change how they're doing things, that there is a level playing field and equality. The only thing that I would ask is that in that amendment, we look at also forwarding this on to the City of Toronto and any other municipality that is in the same zone as us. And quite frankly, maybe the ones around us as well, because they're next to be added to the list. And asking for them to further endorse, make the same recommendations to the province of Ontario as well, because I think that we speak in volume. And I think that if Mayor Crombie and Mayor Brown and Mayor Thompson and Mayor Tory are all speaking from the same page, that we may be heard a little bit louder. So I would just make that request.
And Jennifer, I can assure you that goes on regularly between Mayor Crombie and Mayor Brown and myself when we talk with Mayor Tory and all the GTA mayors and chairs every Monday morning, and we'll be doing that again this Monday, and I'm sure this will be a subject of conversation as the last 20 or so have been about what we're all trying to do collectively. Councillor Starr.
I just want to read a text that I just got probably about 20 minutes ago. Have you guys, the well-paid politician, have you lost it? Help us. We're the little guys losing money. I won't say who it is. I know who it is. You know, it's a 2 or 3 man shop, and they're desperate. And I think we've forgotten the smaller businesses by forgotten how to make it easier for them. We shut them down and we let these big stores, all the food markets, go into your local Metro or No Frills or whatever else. I did on Saturday, and I'm going to repeat this. Fellow in front of me, mask, yes, I was a mask. He goes to the fruit department, goes over to the, and this is for the second time I've seen this, pulls down his mask to probably just about here, and starts looking at the cantaloupes and smelling them. You know, there's got to be a way that we have to put this, you know, to bed somehow, where there's total compliance, and we're not getting that. And I agree, absolutely. I think the 2-3 speakers, or Mayor Thompson, hit it on the head. So did Pat Sato. Let's get a better solution. And, you know, quit talking to the province. We demand action. You know, every Monday you talk to them, what happens? Let them start paying the rent out of their own pocket for these guys. I mean, and again, another one here. I own a physical therapy shop with 2 employees. I can only get 4 people a day in there. They are going to Oakville. What does that tell us? We haven't done our job. So, you know, Chair, you have these discussions. I don't know how you're going to press upon these people. There's somebody in the basement of Queen's Park making decisions. Let them know how serious it is, because there will be a revolution. I think, Mayor Brown, you hit it. This is an economic pandemic. It's a business pandemic, and it's going to get worse. And I don't want to see these people putting the newspapers up in their stores. So anyway, let's find a way out of this motion that we can do it. And by the way, Mayor Crombie, great that we can at least have this great discussion, and maybe we'll get something out of this. So let's all try to work together. Thanks.
Thank you. Councillor Sato.
Thank you, Mr. Chair. And thank you. I agree. I mean, we had to have this discussion. Even though I didn't agree with the motion, I think it's been a good discussion, and the direction we're going in, I think, is the right one. We were sent, and I'm not sure if the clerk has distributed, I don't see it being distributed, but MBOT also sent an email, a letter this morning to the clerk to share with members of Regional Council in opposition of the original motion, and asking for advocacy to the province. I think one of the things that we need to make extremely clear is we are not the ones that are shutting down the small businesses. The province of Ontario is making these decisions. And, you know, I've told my residents that call and the small businesses is, you know, we have to put the MPP's feet to the fire. Where are they? I haven't heard from one of our MPPs. And, you know, maybe they don't give a damn about the small businesses unless it's a chance to go out and take a selfie and post it on Facebook and Twitter that how wonderful they are. But where are the MPPs in the region of Peel supporting the small business, and what the heck are they doing to push for fairness and change at Queen's Park, a place where they have the decision-making power, not us? And I'm so frustrated with this because, of course, we're the ones that are accessible, and I don't have a problem with that. But they are the ones that are dangling the strings, controlling the strings, and they're the ones making the decision. Now, chances are they really don't have a good voice at Queen's Park, but, you know, I think my MPP is, I can't remember what cabinet she's in, but it has something to do with business and promoting business. And I haven't heard anything. You know, I'm not hearing from them. And Sue, you're nodding your head because we have the same MPPs in our area. And, you know, I don't want to see them taking selfies of delivering masks and food and stuff like that someone else donated. That's really great. Pat yourself on the back for what someone else did. But, you know, if they want to pat themselves on the back, then get off their you-know-whats and get out there and start advocating for the small businesses that they represent. I'm sure when these businesses open up, they're going to be out there, you know, saying, look what we did for you. Well, right now is when they need to be doing something for the small business. And, you know, it's not us passing the blame, because I think we're doing a lot. We're doing the advocating. The Board of Trade is doing the advocating. The individual businesses, the BIAs, we're all out there advocating, but we're doing it on our own. You know, we need the people that were elected in the region of Peel to be there with us, side by side. Actually, they should be going ahead of us in dealing with this. And, you know, I'm just getting really frustrated when I when I hear this, and I know we all are. You know, we're all tired of getting the complaints, and, you know, Councillor Starr, I got that as well, that you are doing this, you have done this, you have made this. And my answer back is, one gentleman, I said, I assume you're copying me on the email that you sent your MPP, because that's who is doing this. And that was it. And I didn't get a reply back. So, you know, they need to be doing something. And with regard to compliance, you know, we need to be much, much stronger on the compliance in those large stores. And, you know, it's not just the Walmarts and the Costco's that have wide aisles. Have you been in a Dollarama in the last while? Narrow aisles. And you can't pass someone you have what, 1.5, maybe 2 feet to pass someone even if they're going the right direction. And most people aren't, because the arrows are on the end of the aisle. They stop in the middle and they forget which way they were going, and they start going the wrong way anyway. And I don't blame them for that. But, you know, the one thing that they do at the Dollarama stores and the smaller stores like that is they make announcements all the time, telling people, get your items quickly and leave. You know, we're all in this together. We're trying to keep people safe. Make sure you keep your mask up over your nose. The nose is connected to the respiratory system, people. So let's look at the compliance. Let's ask the province to, you know, to look at fairness for small business, but let's get after our MPPs. And I would like to see that in the motion, Patrick, with regard to the MPPs, and let's name them in the motion. Let's put their names right out there in front. And maybe on the region's website, we need to post their contact information, because I don't think people know where to find them. Anyway, that's my rant. Sorry.
Pat, thank you. If I could just, I'm not going to speak to it, but just some points of information, Pat, on the week that we're getting ready to acknowledge Hazel McCallion at 100 years. Her epitaph never rang truer, as we all heard her say for many, many times. The federal government has all the power. The provincial government has all the legislative issues that they can throw on us. And we at the local level get all the problems. And this is just another example of that. I did want to, though, just for the record, just to make you aware of your constituents and your businesses that have reached out to the chair, just take 10 seconds to let you know. Certainly the Mississauga Board of Trade reached out to me, and I was on the phone with Brad Butt this morning at 6:45, and he sent something in. And this week I was also speaking with the president of HBC. I was speaking with the CEO of Staples. I was speaking with Larry Rosen of Harry Rosen, and also who have reached out is Sleep Country, Toys R Us, PetSmart, Ashley Home, and Aritzia to the regional chair, and just the point that they made, and I promised I would convey it. And I think Larry Rosen of Harry Rosen said it best. It was, I know it's a big maelstrom. Everybody's fighting for turf. Does somebody have to buy a suit this month? And he realizes maybe not. But the point that they make as a countervailing point is, you know, if you've ever been to their stores, and I in fact have, the retail outlets, the power center up the street here. You walk in, there's never more than 5 or 6 people there, and they say, can we have our sales agents reach out to a customer at a time, say, we'll block a time for you for 1 hour. There's only 3 other agents on the floor. You'll have a maximum of 8 people and 7,000 square feet. Compare that to the Loblaws and to the Costco's, and boy, it was a pretty fair point as well. So I promised I would convey those messages, and what an irony to the point that you're all making when speaking with Ian Nairn, the president of HBC, just judging from the morning papers after getting off the phone with me, he released 800 employees immediately thereafter. And those are real human beings for the longest surviving retailer in the history of Canada. So the wounds are deep. So well said to all. Councillor Paleshi's just come on my list. I'll ask him to speak before I go back to our solicitor, Patrick, for any last comments, Patrick, before I let the mayor speak one last time if she's satisfied with the modified wording. Councillor Paleshi.
Thank you very much, Mr. Chair. Councillor Sato, we are in sync today. We are on the same page. To just elaborate a little bit further, I was in Dollarama last night and disgusted by the aisles and the amount of people that were in there trying to do something good. Anyways, maybe this is yet another discussion that we should be having to, maybe at our locals to say to bylaw or even to the province asking for help that, policing needs to happen, unfortunately, in these bigger stores. They obviously don't have the capability of having people within their stores ensuring the social distancing. So maybe that's taking that one step a little bit further to ensure that, looking at it from the outside, everything looks good. It's a big, massive store that you think that, you'll be safe in, and then you go inside and you're brought to reality with the fact that you're squished in amongst a lot of other people with, trying to get smaller aisles and more merchandise. So, but yeah, same page and further discussion to be had for sure. Thank you, Mr.
Thank
Chair.
you. Thank you. With that, Patrick, over to you. I see you have some proposed wording that I will then ask the mover of the motion, Mayor Crombie, if she's satisfied to then put her motion. Patrick.
So thank you, Mr. Chairman. I have provided that wording actually to the clerk. I'm happy to read it out, but I'm content if the clerk would prefer to do so. I'm in your hands.
What I will do here is I have it before me. I think the salient clause, if I may, reads, therefore be it resolved that the province of Ontario be requested to revise the rules for areas in stage 1 under Ontario Regulation 82/20 in bracket the lockdown to address the inequity created as between small businesses required to close and businesses permitted to open and continue sales so as to avoid unfair competitive advantage and in a manner consistent with the continued effective health risk management. And further, that a copy of this resolution be sent to all Peel area MPPs and the GTHA municipalities. I believe that's the most salient change. Madam Mayor, as the mover of the motion, Mayor Crombie, over to you.
Yeah, just a couple things. In the whereas, the safest way to shop and stop the spread of COVID is through, can we, instead of quick, can we say infrequent? It's not even the point to be quick, but it's not to go often.
Sure. Your motion?
Yeah. And the other one was profit. I take exception to the word profit. I don't think anyone's making money except for big box stores. I think they're making revenue. They're making cash flow, paying some bills, not others. So I don't want to...
Totally appropriate. Acknowledged, Madam Mayor, and totally appropriate.
There was one other thing. Oh, yes. With capacity limits, what do I want to say there? I wanted to say capacity limits and albeit with capacity limits. See there? The supply chain is to ensure people can get the essentials they need, like groceries. Large retailers have been permitted to continue to operate. Okay. I just wanted to try to get the sense of enforced capacity limits, but maybe that's okay. Also, a mention has been made twice of an MBOT letter. I have not seen this MBOT letter. I don't know what it says. I don't know if it's supportive of us, and I don't have it in my email. Where is said letter?
Madam Mayor, if I can help, all I know is that I think it was 6:45 this morning. I was on the phone with MBOT through Brad Butt, and he said he would try to get something in just as a matter of record before the meeting started. But in truth, I have not seen it as well, though the clerk is advising me as we speak that Commissioner Lockyer may have some information. Commissioner, over to you.
Thank you. Through you, Mr. Chair, we did receive a letter, but it was well after the meeting started and after we'd already approved the agenda. So we will include it in the package for the December 3rd meeting. Thank you.
Can you just let us know what their position was, please?
Yes, why don't you give us the flavor of that letter? Here, go ahead, please.
The second paragraph of the letter says that the Mississauga Board of Trade would like to express its concern with this motion in that it is both unworkable and logistically nearly impossible to implement.
Funny that they made it work in Winnipeg, but okay.
Okay, Councillor.
I'm happier with the way the motion is worded as a statement of support for business and challenging the province to do more for our small businesses. Can you please ask the seconder, Mayor Brown, if he's all right with it as well?
Patrick.
Yep, that's fine.
Okay, I have one. I don't know, Councillor Sato, you're a laggard or you're still on my list, Councillor Sato?
Yes, I am still on the list.
Go ahead.
Actually, Madam Mayor, the letter said a little bit more than that. I do have a copy. Brad sent it to me directly this morning. They spoke about some of the concerns with the original motion, but they do say it would be more appropriate for Regional Council to call on the Government of Ontario to allow all retail stores to reopen with appropriate capacity limits based upon operations and square footage, and allow all retailers to serve their customers at the point of purchase. They are very concerned about how the Government of Ontario's system has been implemented. They've written to the Premier and advocating for the Mississauga business community. So they are, I mean, the letter was basically against the original motion, but I believe that what they've said in the letter supports this motion, and they are doing the advocacy. A few things that I would like to see in here. I don't see anything in here about the compliance and lack of compliance and the risks, health risks of the numbers of people in the large retail stores. I'm skimming through, and I really don't see anything that showing. And many of us have addressed a concern today for the risks and lack of compliance, and maybe a statement that the larger retailers that are open, all retailers that are open, that compliance be really enforced, and whatever wording you can come up with. I would also like us to name the MPPs. As I said in my little rant, they're invisible. They're hiding behind the Premier, and the wording that you have, and actually it's hidden by little blocks of people on my screen, but that a copy go to the Peel MPPs. I want to call them out by name. I want anyone reading this motion know who exactly this is going to. And I don't just want a copy of the motion to go to them. I want us to make a request for them to step up and speak on behalf of and support the small businesses that they represent in the region of Peel. So I really want this motion to be more fulsome, and direct it to the people who are responsible. So I would ask Madam Mayor and Mayor Brown, if you would agree to having extended wording to that regard. And I'm trying to move my screen around so that I can actually see it. There we go.
And Pat, if I may, as you were saying, our solicitor's come back on the screen. He may try and address what you're speaking to. Why don't I let him try, and I will come back to you. Patrick.
Okay, thank you.
Thank you, Mr. Chair. I will try. I have some additional wording to address Councillor Sato's first point. about enforcement, which would be, and further that strict enforcement of requirements for masking, social distancing, and limits on numbers admitted to big box and other businesses be emphasized and pursued. I haven't been able to provide that wording yet to the clerk, so I apologize for that. As for naming the MPPs, I would suggest if you're going to do that, that it would immediately follow the original wording and precede this bit about enforcement, because enforcement is a matter that's to some extent in our power to focus and emphasize. So those are my comments. I don't have wording for engaging with the MPPs.
Okay, so Mr. Chair, if I could suggest that it be name the MPPs, and where you've said that, I'm not really sure whether request is strong enough. And I'm not sure what the word is. I'd like to say demanding. I would like to say that they advocate and speak up on behalf of the small businesses that they are elected to represent.
Mr. Chair, I figured out how to get my arm up, but I do. Oh, there it is. I want to speak too. Okay.
And Bonnie, once again, to you and Mayor Brown, I will be coming to you last to ensure that it's the motion you wish to put. So rest assured, I will be coming back to you. Councillor Sato, was there anything further at your end?
No, I think if they would agree to that, and I'm open to massaging that wording, but I do think that the strict enforcement wording should be in this motion as well, because I think we need to be seen as advocating. We've talked about public health, that's what we're here for. And we need to be advocating the enforcement of those public health rules.
Okay, and with that, the finalized redrafted motion is now before you. I again have speakers and seeing it for the first time. They would be Groves, Peleschi, and Thompson, after which I will go to Crombie and Brown. Councillor Groves.
Thank you, Mr. Chair. I guess one of the things that I'm struggling with is the word essential. So we've got, I don't know, are toys essential to a senior? No, but is it essential for a young family with young kids? I'm just struggling with the word essential services, because that word, it actually limits the type of retailers that can be open. So I'm just throwing it out there. If Patrick has any suggestions, I just don't like that word essential services, because it still limits the retailers that can be open, because we all have different views on what's essential.
Can I just speak to that for a second? That is clearly prescribed by the province. There are lists of what is considered essential and not. So let's want to start challenging their framework. There are lists of what is essential.
I understand that, Mayor Crombie, and I'm not getting at this. I understand it's the province who's doing that, but we can, while we're advocating for the small retailers, that's something that we need to advocate with the province to have some consideration on and take a look at it again, revisit that, because again, they are limiting the type of retailers and how many retailers can open. Thank you.
Thank you. Mayor Crombie makes a good point. Essential seems to be in the vernacular of all the discussion around it, but a point made. Councillor Peleschi.
Thank you, Mr. Chair. So I'm not sure if anybody caught it, but on CP24 this morning, Minister Zakaria was having a press conference, and the question was asked about the reopening of small businesses, and although he didn't speculate on whether they were looking at doing this, I felt like they were digging their heels in a little bit, but referencing the medical officer of health. So, and it seems like all the MPPs are doing the exact same thing, as referencing the advice of the medical officers of health, which they should be doing, but that's not really in the motion. So I think maybe the request we could be asking the MPPs, but additionally, we could be sending the correspondence and the request to the medical officer of health.
Okay. Mayor Thompson.
Thank you. One thing I was just wondering, like, if we heard everybody talk today about the big box stores, we're not social distancing. Is there any way that we can ask, even we're asking them to treat the small businesses, but everybody, even the big box stores, need to be monitoring their social distancing? Because I think that's the one thing that we've all been observing is people are crowding in areas where they're not to. And if they have the opportunity, as Mayor Crombie says, they're doing okay because they're getting all the sales of people needing to get things. But we gotta have them social distance. And I just don't know where we can roughly put that. I was trying to read through the motion as to whereas I think that's a health, there it is. Okay.
Yeah, I think it's touched upon, Alan. I think in the revision it was dealt with.
I think we've got it there. I see it now, masking, social distancing and the limits. And that's where I just trying to get, sorry if I missed it. I was trying to find that to make sure, because at the end of the day, it's all about health here.
Thank you. I go to Dasko, DeMerla, and then Crombie. Councillor Dasko.
Thank you through the chair, and thanks for the indulgence on the second round. I think that you brought up one of the most important parts of this whole puzzle as we're going through all this. When you said that very much to former Mayor McCallion, saying that it's the municipalities and de facto region that is doing all the heavy lifting. Might I ask
that there is a request for financial resources for enforcement, because I do know that our municipal bylaw folks, etc., are extremely maxed out in terms of the issues that they have to deal with. So I would ask that if we're agreeable that that ask be put through here as well, because I do believe that it goes in sync with this motion. Thank you.
And no question, it's quite a burden. I will leave it to the mover and the seconder accordingly, who you'll hear from shortly after we hear from Councillor DeMerla.
Thank you, Chair. The motion's fine. I would like a small change because I really want to make sure that as you know, we strike that balance between advocating for the economy, but also not look like we are not doing evidence-based. So with continued effective health risk management and input from public health units, if you could please add that, I think that would be prudent. Thank you.
Just to be clear, I think the clerk folk here want to be sure they've got it. Is that to the staff? Is that sufficient direction, or would you like Councillor DeMerla to clarify it again? Councillor DeMerla, give me 1 second.
Okay, so it's the first paragraph in red.
There it is. Yeah.
Yes, perfect.
Yeah. There it is. They've got it. Okay, I'm back down to Mayor Crombie as the mover of this motion. Is this the motion you would like to put? Over to Mayor Crombie.
Well, a couple of things. First of all, input with public health. I don't think they're supportive of opening small businesses, but yet they're okay with large big box being open. So I don't know what input public health is going to do, because I don't think they'll agree. This has got to go to the province now. Secondly, we have this strict enforcement required for masking. I don't like social distancing. There's no social distance, it's physical distancing. And also, we have capacity limits there. On safe physical distancing with capacity limits, and I don't know what the number is. I think it's 1 person per every 4 meters. And that's something these big box stores are not doing, ensuring that there's 1 person per every 4 meters of their store. Mind you, there are a lot of back end, so I don't know if they would put that in their calculation in their formula or not. I do want something to say that if big boxes cannot safely open, then small retail can safely open somewhere as well, but to be done safely with the restrictions on capacity based on a per meter maybe you can only have 1 or 2 people in your store. Can we make that a little more evident here? To address the inequity created as small business required to open and close for very competitive advantage. Okay, resolution. And maybe put the whole advocate out with MPPs closer to the end. It's kind of, it's taking away from the message. That's the advocacy part.
Yes.
Do that anyways, yeah. And further, that strict enforcement of requirement of masking physical with capacity limits. You might want to say capacity limits on the per square meter of the floor space or whatever, per square meter, because that would be per square meter basis. And then we need a solution for our restaurants.
Yeah. Okay. My list again, in looking at the final amended motion, DeMerla and Parrish. Councillor DeMerla, did you have something else?
I'm okay for now, thank you. As
Thank you.
it is, I'm fine.
Thank you. Councillor Parrish.
Well, first of all, I can't read this and I can't figure out how to make it big enough for my screen. And as a former English teacher, it's probably better I can't, because a camel is a racehorse designed by a committee, and I'm not comfortable with the way this is going at all. It's too long, it's too wordy. And I agree with the mayor that we've got to include restaurants, and I agree with the mayor that it can't be in consultation with the health officials, because as I mentioned to Dr. Lowe, you also need somebody there that understands human nature. And I think that's our job. And I agree with you, Bonnie. I think this whole thing should be put to the end of the meeting. We should have a copy of it emailed to us, and we take another look at it with a fresh set of eyes. It's too long, it's too wordy, it's too complex. Bonnie and Patrick need to, and Alan need to be able to march down to Queen's Park figuratively and present a message. So I, for one, am not happy with this, and I'm sure Bonnie isn't. She doesn't have a happy face on. So if we move this to the end of the meeting, have the clerk email it to us so we can at least look at it on our laptops, and ask Patrick and whoever else is drafting this to try to streamline it a little bit. They're not going to read a complicated missive from.
Yeah. It may have gone a little wayward along the way, Councillor Parrish. I think your point's well made. But Madam Mayor Crombie, over to you. How would you like to proceed?
Well, I agree with Councillor Parrish. Unfortunately, I have other municipal business this afternoon, but I could get my staff to look at it and log on later. I would prefer to get the sentiment moved and passed so we know that it has been, and then wordsmith it. I think the sentiment is on point. I think just a bit, it requires a bit of wordsmithing at this point. So I don't mind moving the sentiment and just continue to tinker with the words. I think I think this meeting will end up going very late tonight, and I bet I'm not the only one who has other municipal business pending a little later today. That's my concern.
Okay. If you're satisfied as the mover, I will leave it at that. And you're right, there can be some fine tuning through all those involved in the chair's office to hopefully get to where we want to be with it. Councillor DeMerla, did you just come back on my list?
I did. I just wanted to say that I might be in the minority, but I am not comfortable supporting a motion that doesn't say we're going to work with public health. It just makes us look like we want to add. I'm not comfortable. I mean, public health has a role in all of this. We must not lose sight that the original intent was the reason, if you're a small store but you're selling groceries, you still can be open. So it's not a big versus small. It's essential versus non-essential. And the rub is when some stores have both. So I'm not comfortable supporting unless we say we're working with public health. I think that's really important to say. We want to be evidence-based as well. So I'm going to leave it at that.
Thank you. Mayor Thompson.
I agree with Councillor DeMerla. We need to have public health. You just saw yesterday how the Attorney General went after the province. So it's public health who we take our direction from, and that's where they need to be part of this. Thank you.
Thank you, everybody, for the conversation and your input and your thoughts. I'm down to the mover and the seconder. Mayor Crombie, for all the reasons you've stated, is this the motion you would like to put at this time?
Yes. But
Thank you.
given that we will do a bit of wordsmithing along
Right.
the way.
Thank you. Mayor Brown, you are still my seconder for this motion? Patrick, if you can hear me, I'm trusting you're still satisfied to be the seconder of this motion.
I'm calling him.
Yeah, I have no reason to believe otherwise. When we call the vote, if I hear his name, we'll go from there, even if we have to double back. Madam Clerk, I'm over.
Order?
Yes, go ahead. Who's asking for the point?
Councillor Innes.
Go ahead, please.
I have a question. So are we voting on this motion? Because you can't vote on an intent. You have to vote on a motion that's before us. And if we're going to change it later, then really what we should do is just ask for this to be deferred to the end of the week. I mean, you can't, we all agree on the intent, but you can't vote on a motion and then change it later on.
Understood and well put. Yes.
It's Mayor Brown here, so my internet just conked out for a second. I was going to say that I think what Mayor Crombie has said is that the motion is not perfect, but it works enough to get the message across. And essentially, we're going to use this, Mayor Thompson, myself, Mayor Crombie, to go to Queen's Park and say, you need a more level playing field. As our small businesses are hurting, come up with a better solution. And so that's the short form of a long motion. We expect our small businesses to be treated better because they're in a heck of a lot of pain right now.
Yeah. And if I may, if I'm reading it right as the chair from the mover and the seconder, I think a broad statement's being made here, and I don't know that a comma here or a word there will change anything unless you want to spend another couple of days trying to hash it out. I think the sentiment is what we've wanted, according to the mover and the seconder, and just to keep us moving along, I think it's what I have before the chair. Councillor Sado, one last time I see you on the list.
Yeah, thank you. Councillor Innes called it as a point of order. I had put it on. That's why I put my name on. I'm not comfortable, again, voting on an intent. And several members of council have said that they feel, Councillor Demurle, I agree with you that, we can't ignore public health. I think that's very irresponsible of us. And I don't want to vote against the motion, but like Councillor Demurle, I don't, when you take out any consultation with public health, I think we're treading on very dangerous grounds and making a political decision that isn't based on advice from the people that we pay to advise us. So, we've been wordsmithing. Even the movers have said that, they're not 100% on the wording, but you want us to vote on it. I think Councillor Parrish had the right idea that we leave it to the end of the meeting and we come with a proper motion and we vote on a proper motion. We're booked here until 3:30. I'm sure we can get the wording to come to us before then. But I don't want to vote against it, but
thank you.
Unless we split it up or something and, maybe Councillor Demurle wants to move an amendment that consultation with Peel Public Health be included, and then we vote on the amendment and then vote on the overall motion. And if council votes against conferring with public health, then it doesn't go in. If they vote in favor of it, then it goes in. So I would second if Councillor Demurle, because you raised the issue first, if you want to move that, I'll second it and we'll put it to a vote.
I'm happy to do that.
Okay. I will deal with that as a separate vote. I've come down to Mayor Crombie one last time as the mover of the motion.
Yeah,
Mayor Crombie,
listen,
what would you like to put before the chair?
I, for one, and I'm sure many of you have other municipal business, and this will go till much later than 3:30. We haven't even touched our agenda yet. I am happy with in consultation with public health. Add that. We don't want a second vote. We have to stay together. This is more harm to our small businesses now that we can't even agree on this. Honestly, let's just vote on this. I think it's got as Patrick said, it's got the right sentiment. We'll take it to Queen's Park and advocate, and it's the right thing to do to go forward. Are we happy with that if we put in consultation with public health? That tempers it a little bit, but it does make the point. And I'd be prepared to send this to a vote now. We've spent a lot of time on COVID issues. It is 1 p.m. and we haven't touched our agenda yet.
I think that insertion, I hope it helps in consultation with public health. I hope that makes the movers who otherwise had another motion, I think hope you can live with this. And I think we're sending a message here, and I think that's been done. So with that, Mayor Crombie is satisfied with the motion as the mover. Mayor Brown's told me he's happy to second it. We are going to call the vote. Madam Clerk, over to you.
Thank you, Mr. Chair. This requires recorded vote. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demurla?
Yes.
Councillor Demurla in favor. Councillor Dasco?
Yes.
Councillor Nasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Early?
Yes.
Councillor Early in favor. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Yes.
Councillor Groves in favor. Councillor Innes?
In favor.
Councillor Innes in favor. Councillor Kovac? Councillor Kovac? Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
In favor.
Councillor McFadden in favor. Councillor Medeiros?
In favor?
Councillor Medeiros in favor. Councillor Paleshi?
In favor?
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
In favor.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor?
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson?
In favor?
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor, and that motion carries.
Very good. It carries unanimously. And can I say, as chair, I hope tough slugging to get here, but for us to devote more than 3 hours just to get the wording right on a couple of paragraphs to express our concern, I am very proud of my regional councillors, and it's a testament to how seriously you all take, from Mayor Crombie on down, how big an issue this is to your constituents, your businesses. And so such as we can, we've tried our best here today, and I really think it speaks to the commitment that my colleagues have, and I'm very, very proud of you all as chair. With that, and just to give everybody their fair due, I think everybody should take a little break so that I have your full attention and the remaining delegates have your full attention. So I'm going to call it for 1:15. That's about 20 minutes. And at 1:15, we will adjourn, and hopefully you're all fresh to hear a couple of more delegates, and then we will carry on with the rest of our business. A recess till 1:15 with thanks.
Mr. Chair, can you just send, Mr. Chair, hello?
Yes, yes.
The mayors would like a copy of that motion, not tomorrow, but right now, please, even if it's a screenshot, because we're already being inundated with media.
Very good. Can I have the appropriate people push the appropriate buttons to make that work? And I'm getting nods, Bonnie, so hopefully you will have that imminently. Thank you. Okay, everybody, welcome back. We're just a moment or two past 1:15. A little bit of housekeeping before we go to our next deputant. Deputant 7.2, the presentation with regards to Catholic Family Services, they've been gracious enough to be put off or deferred to another time, but I need a formal motion to deal with that. And so I want to deal with that. I believe we've reached out to Councillor Santos as well to see if 15.2 and her motion on same might also be put over to another meeting as well. But I don't know that I see Councillor Santos yet, or whether she's acknowledged that that can be made to work in the interest of time.
I'm here. I did move to defer 7.1, the Peel Poverty Reduction Committee report and delegation. I also sent an email to defer the Vision Zero report, which I held as well, which there's no urgent business there right now, so happy to defer. But I'm going to keep 15.1 and the motion, just because we have to get back to our small businesses, since we spent 4 hours
and
talking
15,
about small business.
Sorry, so just so I'm through the clerk, we're just managing this accordingly. 7 point, Madam Clerk, if you could make your point clear.
Hello, Councillor Santos. The delegate is here on 7.1 and ready to proceed. So we're asking if that could go forward today.
That's 15.1 because it relates to 7.1, correct?
7.1 and 15.1.
Yeah.
Right.
Okay.
And you're good with that? Okay,
I'm
Madam
fine
Clerk?
with that. And then 15.2, I definitely want to see move forward. Thank you.
Okay. All right, Madam Clerk. So then with that, all we are doing for the time being is 7.2's been asked to be deferred. If that would be moved by Councillor Fonseca and seconded by Councillor Fortini. Do I
Sorry.
have any objectors to that?
And 11.1, the vision.
And 11.1, also to be deferred at this time. Is there anybody in objection?
Mr. Chairman?
Oh, sorry? Yes, Ian.
Tinkler,
Yes.
11.2 could be deferred also.
And we will add that to the list as well to be deferred at this time. Thank you, Ian. So that is the motion before you. Is there anybody in objections to those deferrals to keep us moving along? Seeing none, thank you to all. That brings me back to delegations. First, with apologies and thanks for Daniele's patience. My first delegation, Daniele Zanotto, Chief Executive Officer, United Way, Greater Toronto Area, and Co-Chair, Peel Poverty Reduction Committee, and Ann Coughlin, Member, Peel Lived Experience of Poverty, Peel Poverty Reduction Committee, which also relates to the update item 15.1. Daniele.
Regional Chair Yanika, mayors, members of Regional Council, staff and guests, it's so great to speak to you, fueled and fed now. An honor to celebrate and share what is, in all my decades of work across the GTA, a truly unique Made in Peel, Best in Community Partnership that I co-chair with your very own Sonia Pace, Director of Community Partnerships, the Peel Poverty Reduction Committee. And yes, our 10-year vision and roadmap for demonstrably moving the needle on poverty in Peel Together is hailed and cited as the long-term collaborative model for municipalities and regions across Canada. But it is our 10-day activation of this report that brought the Peel Partnerships, collaboration, and the power of community to life, from paper to practice. With over 80 active members, beginning with Peel residents and families with lived and/or living experience of poverty, and including agencies, community groups, and system partners. And within days of the world pivoting from work to home and face-to-face to Zoom, we mobilized our 7 action tables to address the urgency and impact of COVID-19 in Peel, an impact you know that is disproportionately impacting low-income, racialized, hardworking frontline heroes and our most precariously employed, but to address COVID within the reality for far too many in Peel that you also know and work daily to address. COVID-19 is merely magnifying, amplifying the now unignorable pre-pandemic fault lines: poverty, lack of affordable housing, race and immigration status, precarious employment, and fair access to health and social services. And our 7 action tables have been acting on the intersectionality ever since. We've convened virtual volunteer income tax clinics in partnership with the Canada Revenue Agency to help frontline staff and agencies work with residents to access rightful benefits and returns. We worked with agencies, labor, and so many of you locally to learn about community benefit agreements and how you can support employment opportunities through already planned large infrastructure projects across Peel. We've raised awareness on Peel's vulnerable population eviction prevention and Bill 184 related to housing. And we've worked with the regional COVID-19 community response table to address the growing digital divide and increasing basic need of access to technology. This Made in Peel, Best in Community Poverty Reduction Committee at work across Caledon, Brampton, and Mississauga, thanks to your support, is centered in the input and action of our Lived Experience Roundtable. And I will now ask Ann Colan to walk you through the work of our Lived Experience Roundtable. Anne, over to you.
Thank you. My name is Ann Kuglin, and I am a member of the Peel Poverty Reduction Committee Lived Experience Roundtable. Say that fast. I've been a longtime resident of Brampton, and my lived experience has been a person living with a disability as well as a parent of 2 adult children with disabilities. Our, as Daniel mentioned, our committee is made up of 16 individuals from across the city of Brampton, Caledon, and Mississauga. Newcomers, seniors, youth, racialized, quite a variety of lived experience and knowledge. And we've been a part of several consultations, including the 2020 budget consultation, Peel Food Action Council's strategic plan, and Peel Public Health COVID-19 consultation. But I would say our most important ones has been regarding COVID-19, obviously. And we've given recommendations based on everything that all of our members are experiencing and contributing to the housing supports, access for everyone based on for technology and internet, and financial assistance to support people who need access to jobs and resources in the community. One of our biggest ones is health supports, including mental health and consideration for individuals living with disabilities, raising that awareness that not everyone has access to all of the COVID-19 supports within our region. And one last thing, we're going to continue to voice what we feel is needed on a need-to-know basis as much as we can. Thank you very much.
Thank you. Danielle, anything further from you?
No, Regional Chair. Thank you.
Very good. Then I have a list of questions. Thank you very much for your presentation. I have a list of questioners. Councillor Parrish, then Santos. Councillor Parrish.
I want to thank you for the work you're doing. I think you're performing a very valuable service, and it's so far looks very successful. I got an email this morning from Megan Nichols, the CEO of the Mississauga Food Bank, and she delegated council in January and had read the report online and had some questions of you. Could you get in touch with her on my behalf and sort of coordinate a conversation? I think she initially appeared a little disappointed that there wasn't more addressed in there, but I'm sure you've got all the detailed answers that she would require.
Happy to, Regional Councillor.
Now, do you need her contact information, or you can get it pretty quickly?
We're well connected. Thank you.
Thank you very much. And you're doing a great job.
Thank you. Councillor Santos.
Thank you so much, and thank you for your presentation and the report. Just a few questions. I don't want to go into too much of a preamble, but one question is just on sick days. I noticed that so during COVID-19, obviously those who are in precarious work and are vulnerable in our community, working part-time jobs, etc., don't have access to paid sick days, and just wanted to know if you had any comments about that, because I wasn't able to find too much of it in the report itself. Mind you, COVID-19 has certainly highlighted that particular issue. And then the other question I had was if you could comment, because we are having difficulties in Brampton balancing the lack of affordable housing and illegal basement apartments. And our problem is if we crack down on illegal basement apartments and enforce them, we potentially create more vulnerabilities to those who are already vulnerable without housing. And then the final question is on the collection of data and making sure that we use this information to build and support our case when it comes to funding and advocacy to the provincial and federal government.
Thank you, Councillor. A whole series of questions, and I think some that we can get back to you on. But clearly, we've been hearing both at the our advocacy action table and at the lived experience that those who are precariously employed do not have access to the sick days required. And there's been movement both on an advocacy and a policy front on how that might be embedded provincially. And so we can keep you apprised of those discussions and how they move to action. I think we're also seeing significant innovation on affordable housing throughout Canada, and the role that basement apartments might play, but more importantly, how we may accelerate either conversion of existing low-rise or unused space or modular housing in specific areas. It would require about the same amount of time you spent this morning on the topic at hand, if not more, for all of its complexities. But we would welcome an opportunity to discuss it further, and the tension between managing existing stock and then accelerating new stock, especially in Peel, that is already gapping on affordable housing. And then I think your final question, remind me, Councillor. I got so excited with the first two.
It was just about the how we're going to track and collect further data as this plan moves forward, so that we can continue to build our case, federal provincial government, on equal funding for a lot of these things we're asking for.
Yeah, I think Regional Councillor Parrish spoke passionately this morning about access to service and fair share, and a long-standing refrain in Peel. And I think one that we're seeing and need to continue to discuss. While there have been wins, and there clearly are, we know that whether it's in the community COVID pop-up testing or some of the other areas, we're still tracking behind, both on health and, more important, on some of the social services. And I think there's room in that discussion for us to talk not only about funding at the local level, but how we might engage different levels of government as well. And so the issue around data, what we're seeing in other parts of the GTA is that even with some of the COVID pop-up testing sites that we've been able to leverage in North Etobicoke, for example, one of the key ingredients, and again, spoke to this morning briefly, is engaging local residents, hiring local residents as ambassadors to reach out to their networks, people with lived experience who could communicate to their circles and networks in their own language, through their own media, to dispel some of the myths and move in. And in fact, what we've seen in some of those communities is a doubling of accessing COVID pop-up testing sites when we've been able to engage local residents and agencies in that work. And so data is key to that, knowing who's impacted and where that's most impacted, and also issues of race as well.
Thank you. And so I'm wondering, final question, because Councillor Parrish and I spoke about this briefly before, about it would be interesting to see what the COVID-19 heat map looks like layered in with a poverty map in the region of Peel. And I'm not sure if there would be any correlation, but I'd be interested in seeing that. And I'm happy to follow up as well online on some of the other questions I asked earlier.
If you and Regional Councillor are suggesting that it might be shockingly similar, I might agree with that. I think we may be talking about the same map.
Okay, Janice, see, our commissioners just chimed in. Janice, you may have something on that. Commissioner Sheehy?
Thank you, Chair. I just wanted to go back to the question that Councillor Santos had raised about illegal basement apartments. to remind council that they did approve the My Home second unit renovation program that provides financial assistance to homeowners to take such apartments and make them safe and make them legal. And I wanted to plug the program. It recently began, and there is a wealth of information on our website. So thank you.
Thank you very much. That ends my list of questioners. So at this time, if I can have Councillor Parrish and Councillor Santo move receipt of the delegation. And Councillor Parrish, we moved up 15-1 at this time, so we will deal with receipt of 15-1 as well. As I said, moved by Councillor Parrish and Councillor Santos, though I first want to thank all the group here from the Peel.
Let me know what you think about the vertical.
Oh, can somebody make sure their mic is off? I was going to thank you. I was going to say I also want to acknowledge the Peel Poverty Reduction Strategy group and committee that's here, because I think you've got a group of 15 that are listening in, and I see many of your faces on the screen. So thank you to them as well. With that, you've heard the motion. Anybody opposed? That is carried. Okay. Now, next, can we deal with delegation 7-2? Oh, and 7-2 is good to go. Oh, very good. So I'm going to correct myself. As it turns out, delegation 7.2 is in fact good to go right now. That is Sharon Main Devine, Chief Executive Officer, Catholic Family Services, Peel Dufferin, and the Davis Center for Families, and Nancy Polzinelli, Commissioner of Health Services. Sharon, thank you for your patience, and please proceed. Unless, Nancy, you're kicking us off, one or the other.
Thank you, Chair Yanika. I will kick us off. So good afternoon, members of council, and through the chair. I am happy to be here today with Sharon Main Devine, CEO of the Catholic Family Services Peel Dufferin. We are here before you as co-sponsors for the Family and Intimate Partner Violence campaign. So family and intimate partner violence is a pervasive and troubling issue that can affect anyone regardless of race, class, gender, or religion. This important issue requires a comprehensive, collaborative, and thoughtful response. And that is why on February 13th, 2020, Council requested the development of a region-wide domestic violence campaign. The campaign was developed in collaboration with our 3 municipalities, as well as Peel Regional Police, the Ontario Provincial Police, Caledon Detachment, and a number of our community partners. Next slide, please. In 2016, more than 1/4 of all reported violent crimes in Canada was from family violence. Exposure to violence and experiences of abuse can lead to poor health and mental health outcomes, and potentially lead to injury and even death. The causes of family and intimate partner violence can be found in a range of individual, family, community, and societal factors. Child abuse or neglect, substance abuse, family conflict, poverty, and gender norms can all contribute to the risk of family violence. For these reasons, the Community Safety and Wellbeing Plan adopted by Regional Council in October identified family violence as a key area of focus. And as you see in the slide before you, the federal and provincial governments have also made commitments to addressing this issue, because it is an issue that is experienced far and wide. Sharon will now speak to how our campaign is a made and Peel approach. To you, Sharon.
Thank you, Nancy, and it's such an honor for me to be here today to speak with you. Yesterday was the International Day for the Elimination of Violence Against Women, which kicks off 16 days of activism against gender-based violence. And you know what we were able to do together across our 10 partners who worked on the development of the campaign was really develop a campaign that is impactful and that is inclusive of our entire community. We had to have some really courageous conversations with one another because, of course, talking about the violence that happens in families is a very difficult thing for people to talk about. And we have so many different perspectives that have to be balanced. And most importantly, we don't want to stigmatize any one person or any one group that is grappling with the issues related to violence. You know, we know that violence against against women. It cuts across all cultural groups, racial groups, socioeconomic groups in our community, and often goes hidden in families because of the shame associated with it. So we have this very robust engagement, and if you can show the next slide, you can see what some of those partners are that engaged in this. And in addition to this, a very robust engagement with a number of community tables and tried to be as inclusive as possible. Next slide. So the goal then for the campaign is we want people to know that they're not alone. So if someone is experiencing violence in their family, if women are experiencing violence, they know that they're not alone. We wanted to engage the entire community to take ownership of the problem. And we wanted to be able to share what the scope of the problem is within our community. And I'll spare you going through all of the details of that, because I think everyone here today knows the scope of the problem in our community, especially during COVID. All of our services have been completely overrun as people are experiencing so much stress in the isolation that comes with physical distancing. Next slide. So there's also a call to action with this campaign. And in order to get people the help they need when they reach out to us, because inevitably that's what we want people to do, right? We want people to say, it's happening to me, or it's happening to somebody I know. What do I do? Where do I go? So we are working with 211 because we identified that we needed a single portal for someone to call, and 211 provides us with that portal. They're available 24/7, multilingual service, and then through them, they will connect people with the services that they need in the community. So if that's shelter at Interim Place or the Family Life Resource Center, if it's to get people to the Safe Center of Peel or any one of our community organizations, 211 will be the portal for that. And of course, we'll have 911 on our flyers in case of a dire emergency that requires police or ambulance intervention. And of course, we're anticipating that we're going to increase the demands on our services before we're going to see any kind of reduction in this. And, this is tied also to our community safety wellbeing plan, which is a 4-year plan in order to really look at how we can address this issue in our community. Next slide, and over to Nancy.
Thanks, Sharon. And as you can see, the campaign planning and preparation are well underway. And as Sharon said, we're happy to announce that the campaign was active yesterday, November 25th, which does coincide with the International Day for Elimination of Violence Against Women and the start of the 16 days of activism against gender-based violence. It is our hope that counselors and other community voices in Peel will help to get the word out. And again, as Sharon mentioned, this will be the inaugural campaign in what will now be an yearly initiative in developing the campaign, and community pointed this need out to us to maintain this sustained effort. And as a collective, we are committed to do that on an annual basis. Back to you, Sharon.
Next slide. Our campaign is sitting alongside things that are happening provincially, federally, and internationally. Next slide. And alongside other campaigns that some of our organizations are also doing. So it's an amplifying voice, and we'll all be linking into each other's campaign, and again, invite you to join us in getting the word out to our community. It's pretty historic for a region to have a collective response like this. So we'd like to invite you to partner with all of us in this. Next slide. We want to show you the slides of the campaign. Again, they're multilingual, and we are using many channels to get the word out. Next slide. And if you can just click on that, there's a short animation for you to see the campaign. It's not okay. The next slide. Peel Regional Police, in partnership with OPP, developed an infographic as well that conveys the scope of the problem in our community. So this will be distributed as well. And I know you've got all these slides in your deck, so you'll be able to look at that further. And if I can go to the video, we have a very, very short video that we'd like. Oh, sorry, Nancy, it's over to you then, the video. I'm so mindful of all your time. You've been here all day, so.
This slide really is to capture the fact that measurement and ensuring that we maintain an advancing and improving campaign is fundamentally important to the team. So we are working through the community safety and wellbeing reporting structure so that as we build onto this year's campaign, we do continue to improve, and we are able to use data to help us understand where we need to focus next and how we improve and get out to the community in better ways. So we will, as a collective, be tracking social media engagement, website visits, how many video views and the length of time people will stay on the videos. And also 211 is able to track the number of calls they receive related to this campaign. And further to that, in addition, the Community Safety and Wellbeing Plan and the Family Violence Action Table will include family and intimate partner violence in its continued community engagement. So the goal for this group is really to continue to improve, so together we do make a difference.
So the next, so now the video that we'd like to show you.
In 2019, police in Peel responded to more than 19,000 incidents of family and intimate partner disputes. On average, that's 50 incidents every day, or 2 every hour. And that's just what gets reported. Most incidents aren't. It's not okay. Family and intimate partner violence is any type of controlling or threatening behavior, violence, or abuse between intimate partners or family members. It includes psychological, physical, sexual, financial, and emotional abuse. It affects people of all ages, from all backgrounds. Violence and abuse can lead to poor physical and mental health, serious injuries, and even homicide. It doesn't matter who you are or where you're from. Family and intimate partner violence is a problem in Peel. And it affects all of us. If you or someone you know needs support, call 211 toll-free 24 hours a day, 7 days a week. Visit peelregion.ca/itsnotokay.
So that's a very impactful video, and just want to thank you for your time this afternoon to celebrate the launch of this campaign for us in our community. And thank you for your support and endorsement. Without all of you and that initial motion back in February, we wouldn't be here today looking at this campaign. And I'm just so mindful, given the conversation of the morning, how critically important our services around violence are during this time where people are struggling with so many losses and difficulties. In their lives, all these issues connect. Thank you so much.
Thank you very much for your presentation, and we have questions. Councillor Santos.
Thank you through you, Mr. Chair, and thank you for all of your hard work. That motion in February, Peel took a lead, we took a lead with our municipalities to do something about it. We kept hearing over and over again that domestic violence, intimate partner violence was the top number of calls from Peel Regional Police. And I'm very proud that our region and our council and our staff, our team, are raising awareness to get rid of the stigma and to make things a little bit easier for victims to get the support they need. I know that you came to City Council yesterday to delegate on the International Day for the Elimination of Violence Against Women. I asked them questions at that point. I'm not going to ask them here now because you answered them, but I know that this is the start of one campaign and we're going to have a lot of learning to do in this campaign, and it's just going to get better and better in years to come. So thank you very much for all your hard work.
Thank you. Councillor Groves.
Thank you, Mr. Chair, and thank you, Nancy and Sharon, as well, for your hard work and your dedication to this, and to all of us for taking the lead and recognizing that it is not okay. Violence against women is not okay. I really like that poster. I think it's just a great poster. It sends the message to folks that not okay for violence against women. Having worked in a women's shelter, I have seen many, many of these instances, these cases, these families that came to us at the shelter. It is it's very difficult on these families, especially the children. Children having to watch violence against their mom, their dad. And I'm glad that you are doing a gender-based as well, because while we focus a lot on violence against women, there are those men who are also being abused. So I'm glad to hear that it is gender-based. But I guess I have a question for you. I have a couple of questions. And these women, sometimes they're afraid to come forward because they're embarrassed. They don't want to break up the family because they know that if they report it to the police will step in, maybe children's services might step in, and they don't want to break up their family. So how do we get these women to come forward and not be afraid? Like, is there anything that you can do working with the police and just to encourage these women to come forward? Because I'm going to give you an example, and you may recall that neurologist who actually killed his wife, chopped her up and put her in a suitcase and threw her body into the Humber River. Violence there prior to that happening. And I know that the police were involved at some point, but the end result was she lost her life and she left 2 children behind. Those children have now lost both parents because the father is in jail and I don't think he's out on bail, and the mother is not here any longer. So how do we encourage women to step up?
So that's such a great question and such an important question. I've been working in this field for 30 years, and I know that for every woman who's experiencing abuse, every person experiencing abuse, somebody knows. But people are afraid to speak up or to say anything. And women, time and time, have said to me over the years that they knew people knew, but nobody said anything to them. And when nobody said anything to them, for them, that meant that it was either okay or there was no help. So what we need to do is teach our community and challenge ourselves to be able to turn to a woman and say, I can see something is happening. It's not okay. It's not your fault. Maybe I can make a call with you to get you the help. And I think part of what we need to do, and what we're going to be doing over the campaign over the years, is we need to dispel some of the myths. And some of the myths are that you're going to lose your children. And that's a myth. You're not going to lose your children. Yes, it's a matter for child welfare when a child witnesses abuse, but the way we work together in this community, which, by the way, is ahead of the curve in the way that we've done child welfare reform in this community, is that we work collectively together and wrap around that woman to ensure that she can continue to have her children. And that's where places like the Safe Center of Peel, which Regional Council has supported over the years, again, without you, we wouldn't even have the Safe Center of Peel. We wrap around that woman. So we need to dispel those myths. We need to work collectively to be able to get that message out to our community that these things aren't going to happen to her if she comes forward. And I think that's where Peel Regional Police also has their campaign to educate the community as well. It's complicated, but together I know that we can push this message out.
Thank you, Sharon. And I'm glad to see that, because one of the things that these women need most of all when they're experiencing this sort of issue is support. If they know that they have a good support system in place, somebody
to turn to. It eliminates those fears that they have, whether it's for their own lives or their children or whatever it is. So I'm so glad that you are there. You've been in this field, you said, for 30 years. We need more people like yourself, Sharon and Nancy. Thank you guys for really stepping up. And I guess, Mr. Chair, the final question that I have, or the final point, is you talked about the ages. It really has no borders. And so what I've seen, especially in young girls and in high school, they have a boyfriend. The boyfriend becomes very controlling, wants to see her phone, wants to know who she's talking to, wants to know where she's going, that sort of thing. And this is happening to 15-year-olds, 16-year-olds, and that becomes a problem later on in life. And sometimes it's very difficult to get these young girls away from these guys who are very controlling, and the controlling part of it, I think, it's a sign of abuse, and whether it's verbal abuse, mental abuse, and I've seen it in many of these young ladies. So how do we? I don't know how do you deal with that, or are you working with the schools to deal with that sort of thing?
Yes, we absolutely are working with the schools. We're working with Peel Regional Police. We are also, there's been a very large campaign in our region with the support of Peel Regional Police around anti-human sex trafficking. So we're doing a lot of education of parents, of school officials, of the community, so that we know, again, how to reach out and how to identify it and know how we can move in. We have outreach workers who are on the ground identifying young women, girls at risk. So we have all of those things actually in place. And through the chair, if I could suggest at some point, we would be happy to even do something, not during a council meeting, but at another point, so that we can showcase for all of you, all of the programs that we actually have in our community at this point in time. So we would be happy, absolutely happy, to showcase everything that we have going. We're very innovative in this community. The Community Safety Wellbeing Plan is just going to make us stronger and better. And I fully believe that in 4 to 5 years, we're going to be able to present internationally around how a region together as a community across differences to come up with a way to respond to a community that is so multi-ethnic, multicultural, diverse, and we're going to do this, and we're going to do it together. I have every faith in that.
And thank you, Sharon. And I know that all of us around this table, and I can say that on behalf of all of us, is that we have that confidence in you and your team as well, that you are going to do this. So thank you again for your very hard work and in continuing to advocate on this very important topic for families. And if you don't mind just emailing me that poster so that I can share it on my social media page, because I think it's just an amazing poster that really sends a strong message that it is not okay. Thank you, Mr. Chair.
Thank you. Councillor Early.
Thank you, Mr. Chair. And Sharon and Nancy, that was an excellent presentation. I learned a lot. I have a few questions. Sharon, you've been in the business for 30 years, and obviously you've seen a lot. And it's clear that specifically even during COVID and in the last couple of years, the awareness has been elevated substantially. I love the work that you're doing. I think we need to keep talking about this. We need to ensure that women feel very comfortable that they can tell a friend that they're in peril and that there is help out there for them. My question is, you said 2019, we had 19,000 calls, I think almost 50 a day in Peel. Do we have any of the statistics, how this is broken down by municipality? And I actually think, from my perspective, my ward is growing quite substantially, and it is on the southern tip of Caledon. And it would be an interesting note to see if we are growing in domestic violence in Caledon, or whether or not it's broken down in that capacity.
Through the chair to Councillor Early, thank you for the question. I am certain we can gather that data for you. I don't have it. We don't have it with us today, but allow me to take that back to the team and we'll be able to get some information back to you.
Thank you, because I think it would be something, and I know certainly in conversation with our inspector that we are seeing a rise on domestic violence, and it is something that I think then is a case in Canada that we need to ensure, and everywhere in Peel. But this is, I always think of a family in need, and I think about the children, and I think somebody has already said it on this call, that the children fear the most. They fear to call 911. That's the number they would know, not 211. And they're very afraid to call that number simply because they may be taken away from the house. And whether the house is damaging them in any way, the fear of being taken away is greater. So I really love that we are promoting this and supporting it. And I certainly will do everything I can from my end from an awareness factor, and always happy to help. So I just want to say thank you very much for this.
Thank you. Councillor Demerla.
Thank you, Chair. It's always nice to see something start as an idea and then become real. So congratulations to Councillor Santos, who brought the motion forward, and to Nancy and Sharon's team for creating such a powerful campaign. Just a quick question out of curiosity. I recall that the province of Ontario had a It's Not Okay campaign about 3 years ago, 4 years ago, in the last under Kathleen Wynne, and in fact it was Premier Wynne who sort of was personally involved in that. And I just wanted to know if there was if these just came up independently, or there's some connections there that one campaign builds on another. Thank you.
Would you like me to take that, Nancy? So we had a lot of conversations about what would be an impactful kind of tagline, and we had conversations about the provincial campaign. Our wording is slightly different, but it may as well be the same. It has that kind of catchy. And I think that part of the reason we went with it is because there is some familiarity with it as well. And it has to do with, analytics and numbers of tweets. And we had all these, media experts kind of work with us around that. So I think one of the things we really want to do is, make sure that our campaigns talk to one another and that they layer in together and across one another. So there was some.
Yeah, I'm delighted that it lives on in some form. So that's fantastic. Thank you.
Okay, thank you very much, Sharon. Nancy, those are all our questions. Thank you for your great efforts. It's very, very much appreciated. I have a motion here moved by Councillor Santos, seconded by Councillor Groves, that the delegation 7.2 be received. Are there any objections? Seeing none, that carries. Thank you very much. Okay, that deals with our public delegations. Now we're on to staff presentations. We dealt with 8.1. 8.2. Update regarding waste management services, an oral presentation from Norm Lee, Director of Waste Management. Norm.
Good afternoon, everybody. Today's presentation deals with two specific service changes. The first is the waived CRC fees for up to 100 kilograms per vehicle at CRCs. And the second is the allowance for two free bags of garbage at the curb. A longer version of this presentation was given to the Waste Management Strategic Advisory Committee on November 19th. Next slide, please. In April of 2020, Council directed staff to waive all CRC fees and to waive the requirement for garbage tags and allow 2 extra bags of garbage for biweekly, or 2 extra bags of garbage biweekly for residents, in an effort to help residents out dealing with COVID, and also to kind of prevent against illegal dumping. In June of 2020, Council changed the CRC direction that the first 100 kilograms be free, not the entire loads. So the waived CRC fees served their purpose initially and were welcomed by residents coping with the uncertainties of COVID. But they're now being taken advantage of, it seems, by commercial customers and by a few residents who return often with smaller loads to take advantage of the 100 kilogram limit. These customers who are taking advantage of the small loads are causing delays for all other customers, with the number of visits actually up 24% over the same period last year. And the revenue loss from the waive fees is becoming significant. Currently, it's over $3.6 million this year, and it's projected to reach $4.2 million by the end of the year. And the 2021 budget submission assumes that this revenue stream is restored. The 2 free bags at the curb also serve its purpose initially, allowing residents to dispose of extra garbage while working at home. Now residents seem to have settled into a routine with about 2% of households setting out extra bags, which is pretty much in line with the number of households who set out extra bags pre-COVID. A very small fraction, something like 0.1%, continue to set out more than 2 bags, but that's a very small number. It seems the other 98% of households are really then subsidizing the disposal habits of this 2%. The revenue loss associated with not charging extra bags is not as significant as the CRC revenue loss, but it is projected to be $360,000 for this year. And again, the 2021 budget submission assumes this revenue is restored. Allowing free disposal of this extra garbage, either at CRCs or the curb, also impacts Peel's diversion rate. Next slide, please. Given that the service changes have met the residents' need, and in order to manage ongoing costs, staff is recommending that the CRC fees be reinstated at the beginning of January, and that the 2-bag allowance remain in place till the beginning of February. The reason waiting for January for the first one is just it's to give staff time to communicate the changes to the public. And the reason for the staggering of the 2 dates, there's a couple of them. First, it phases out the allowance, so once the CRC fees are reinstated, it still gives residents an opportunity for another month to set out extra bags of garbage. It ensures that the extra bags continue through the post-holiday period in January, when residents sometimes set out extra waste. And third is February is actually the slowest month for garbage set out all year, so it's the easiest month for residents to transition back to not having the free bags. And finally, I'd say from an illegal dumping perspective, staff have been monitoring illegal dumping throughout the pandemic, and parks operations staff in the area municipalities have also been kind of tracking it. And our understanding is that initially, when COVID first hit and people were at home, there was an increase in illegal dumping, and that level seems to have persisted through all of these things. It didn't go down when we added the 2 extra bags, and it didn't go down when we allowed the free disposal at CRCs. So these changes, this is staff's recommendation to reinstate these 2 programs. And of course, if approved, these changes would be communicated well in advance to the public. Next slide, please. And with that, I welcome any questions.
Thank you. And there are. Councillor Daskal.
Thank you through the chair, and thanks, Norm, for the presentation. And I've got to say, I have heard from local residents that the 2-bag addition that we brought up and put forth on a temporary basis was well received. I'm just wondering, I guess I've got a couple of questions. First question I have is what feedback did you receive? Have you liaised with the municipalities to see how the effect of extra garbage in parks, because that was part of the initial ask for the extra bags, was to take some of the pressure off the parks. Have you spoken with them to see if that was effective in terms of?
We have, and through the chair. So we've talked with parks operations staff, including in Mississauga, and I just had an update this morning. I got my final update from them. They said that they have not been tracking, 311 calls for this sort of stuff. They don't have hard data. But most of the staff who go out and work in the parks and collect the garbage and see the extra bags that are set out, they did say exactly what I said earlier, that they saw when COVID first hit, the number, the amount of illegal dumping went up. They said that they didn't really see a noticeable change when we introduced the 2 free bags, and the illegal dumping kind of continues to this point. So the illegal dumping in parks, it's going to continue to be a problem, I think, as long as COVID persists. And we will continue to work with the local staff to try to counter that as best we can. I don't think that anymore the 2 bags is going to is making a difference, or it doesn't seem to have made a difference now.
Okay, no, much appreciated. I've had a heck of a time this year, as I think I mentioned to you as well, with illegal dumping down in the parks, and also beside quite a few of the My Way bus stops where they have a garbage can and people tend to dump garbage right beside it and things like that. So, but I've got to say, if we have that extra time of some good communications that goes out saying that the program is winding down, that would be great. But I would certainly be open to, in the springtime, if we're getting another hit of this, hopefully we don't, that we might revisit. But thanks for the report, Norm. Much appreciated.
Thank you.
Thank you, Councillor Raz.
Thank you very much, Mr. Chair. And I don't know if it's the appropriate time to also bring forward the motion associated with this item.
I have it before me, and it's duly moved by you and Councillor Innes. Yes, and you can speak to the motion if you like.
Oh, thank you very much, and thank you for the update again, Norm. I'm on Waste Management Committee, and we had a really good discussion about this the other day. I think for the most part, a lot of the people who were, doing those purges in the early part of the pandemic has subsided. I know when on garbage day, when I drive around the neighborhoods just to see how things are, there's a very few people that have the 2 extra bags set out, so it has certainly gone down. And with the effective date being early in the new year, if people, choose to do those cleaning outs of their closets and whatnot over the course of the holidays, there's still that opportunity over the holidays to put out those extra 2 bags. So I am happy with the direction. I think we need to get our waste collection system back on track, make sure that the waste that is being put out is going into the proper waste streams, and get people lulling out of the complacency of being able to dump whatever they want. So thank you, and I'm happy to move that motion, Mr. Chair.
Thank you. Councillor Sato.
Thank you, Mr. Chair. I was actually trying to find an email that I'd received yesterday from our commissioner on the issue of the dumping and whether there was any improvement or not when we initiated the 2 bag, because you would kind of assume that people wouldn't need to dump their household waste in our park bins or at the bus stops if they could put out the 2 bags. But in actual fact, our dumping increased across the city by 200%, even with the 2 bag limit. So when you said you spoke with our staff, they confirmed that I was actually staggered by the amounts. I know I've had specific areas that have been extremely bad and ongoing, but I would have thought that people being able to put out 2 extra bags of garbage, that they would have no need to go dump in the parks. But we are still finding household waste in our parks, and dumping has been worse than ever. I'm not sure what the answer is. I'd love to find out why they're doing it. Is there something about our system? I know a lot of them seem to be coming from townhouses, and that just didn't make any sense to me because of the system that they were on. But I think we do need to maybe do a little bit of outreach to residents, maybe some surveys or something. I'm not really sure. I mean, these people aren't going to answer surveys, but I'd love to know why the numbers have gone up so much. And, is it a waste management issue? Is there something that we're not doing that we should be doing? But I mean, whatever it is, I think what we did was at the right time, and I'm glad we did it. It has helped, the majority of the residents out, apart from those that don't care about their community. And yeah, I mean, it's as Councillor Raz said, I think most people have gotten rid of all the big things. They can still put it out with their waste, the bulk items. And I would suggest that we communicate that more to people. I know I get questions, what can I do with this? And I'm saying, well, it's a large item. You can put it out with their garbage. And I'm always surprised how many people are not aware of that. So yeah, I support us. And I think the time frame for the 2-bag, taking it into February, I think that's extremely fair timing. So I'm glad that it's come forward now so we can move ahead.
Thank you. That ends my list of speakers. Norm, thank you for the presentation. I have a motion before me moved by Councillor Raz, seconded by Councillor Innes. The salient clause which reads, therefore be it resolved that the fees for dropping off waste at the Region of Peel's community recycling centres be reinstated as effective January 4, 2021, and further that the collection of 2 bags additional of waste as part of the bi-weekly residential waste collection without the requirement of purchasing bag tags be discontinued effective February 8, 2081. All those in favor? And a recorded vote. Over to you, Madam Clerk, a recorded vote.
Thank you, Mr. Chair. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie? Mayor Crombie? Councillor Demurla?
Yes.
Councillor Demurla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Early?
Yes.
Councillor Early in favor. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Yes.
Councillor Groves in favor. Councillor Innes?
In favor.
Councillor Innes in favor. Councillor Kovac?
Yes.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros? Councillor Medeiros? Councillor Paleshi? I think I heard yes, Councillor Paleshi?
Yes, in favor.
Thank you. Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson?
In favor.
Mayor Thompson in favor. And Councillor Vicente?
Yes.
Councillor Vicente in favor. And that carries. Thank you.
Yeah,
Thank
sorry.
you.
And this is Councillor Medeiros, just for the record, yes as well.
Okay,
Very good.
thank you.
Martin, thank you. That carries. Brings us on to items related to public works. Item 11.3, report of the Waste Management Strategic Advisory Committee meeting held on November 19, 2020. Councillor Innes, you asked that this be held.
Thank you. There was a motion from that meeting, and I just wanted to make an amendment because it's dealing with the full producer responsibility. And we did discuss previously, but I would like to see that we make an amendment. I believe that you have it before you, but essentially it's to include schools, parks, and public spaces to be included, and asked that our school boards and our lower tier municipalities also say that they are, that this go down to them so that they can make a comment back to the province and be part of that full producer responsibility discussion.
Very good, Madam Clerk. You have that motion before me. Thank you very much. That motion moved by Councillor Innes, seconded by Councillor Raz, that the recommendation of WMSAC 2020 contained in the report of the Waste Management Strategic Advisory Committee held on November 19, 2020 be amended to include the following. And further, that a copy of the subject report be provided to the Town of Caledon, City of Mississauga, City of Brampton, Dufferin Peel Catholic District School Board, and the Peel District School Board, and the Ministry of the Environment, Parks and Conservation. And further, that the local municipalities and school boards be requested to support the designation of schools, parks, and public spaces as eligible sources with commentary to the Ministry of the Environment, Conservation and Parks. And further, that the report of the Waste Management Strategic Advisory Committee meeting held on November 19, 2020 be adopted as amended. Madam Clerk, the vote over to you.
Thank you, Mr. Chair. This also requires a recorded vote. Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson.
Yes.
Councillor Carlson in favor. Thank you. Mayor Crombie. Mayor Crombie. Councillor Demerla.
Yes.
Councillor Demerla in favor. Councillor Dasco.
Yes.
Councillor Dasco in favor. Councillor Dillon. Councillor Dillon. Councillor Sorry, did I hear Councillor Dillon? Okay. Councillor Early.
Yes.
Councillor Early in favor. Councillor Fonseca.
Yes.
Councillor Fonseca in favor. Councillor Fortini.
Yes.
Councillor Fortini in favor. Councillor Groves.
Yes.
Councillor Groves in favor. Councillor Innes.
In favor.
Councillor Innes in favor. Councillor Kovac.
Yes, in favor.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden.
Yes.
Councillor McFadden in favor. Councillor Medeiros. Councillor Medeiros. Councillor Paleshi.
Yes.
Councillor Paleshi in favor. Councillor
Also
Parrish.
In
Sorry. Councillor Medeiros, was that you?
Yes, that was me. Thank you.
Okay. Thank you. Councillor Medeiros in favor. Councillor Parrish.
Favor.
Councillor Parrish in favor. Councillor Raz.
Yes.
Councillor Raz in favor. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair. Councillor Sinclair.
In favor?
Councillor Sinclair in favor. Councillor Starr.
In favor.
Councillor Starr in favor. Mayor Thompson.
In favor?
Mayor Thompson in favor. Councillor Vicente.
Yes.
Councillor Vicente in favor, and that carries. Thank you.
That carries. Thank you. Items related to human services. Item 15.2, additional immediate actions to address concerns about homelessness. Councillor Santos.
Thank you, and through you, Mr. Chair, just a quick thank you for putting all of the recommendations together in such a short period of time. We were briefed on this particular report as it impacts Councillor Vicente and myself and Councillor Medeiros' wards directly. And very pleased to see the recommendations in the report for the Out of the Cold Center as well as the health clinic services. Since September 24th, when we had a series of delegations regarding the issues in downtown, we've been in touch with the businesses, with residents, organizations on almost a daily basis, and I'm sure Councillor Vicente will also have things to say about that. And I'm happy to second the report and the recommendations. I believe Councillor Vicente would like to move the report itself as well. And I was wondering, Mr. Clerk, if we would bring forward the motion as well on top of the immediate actions recommended by staff.
Yes, I believe we can do that. And as the clerk's looking for that, Rowena, if you have nothing further, I'll go on to my next speaker, Councillor Parrish.
Let Councillor Vincenze go ahead of me and then I'll speak.
And I think Councillor Demerla may yield the floor as well. Councillor Vicente.
Thank you, members of council. Just want to reiterate what Councillor Santos said, that we have been dealing increasingly with a number of calls. It happens daily now. It's on a regular basis. Issues with regards to homelessness, an increasing problem that really has been laid bare by the COVID pandemic. It has compelled us all to act, and I'm very appreciative of staff for their continuing work to assist the homeless and our vulnerable populations. I know that in the past, our chair, Nando, you've talked about how as much as we already do at the Region of Peel, we can always do more. And that is where the opportunity, I think, lied here, that staff worked with us to find new ways that we can help those who need it the most. We, of course, are supportive of this report and the recommendations. And I think we all realize that this is always a continuing work in progress. The work that the Region of Peel does is a living, breathing document and effort. But we do want to thank staff for responding so quickly for us here, leveraging provincial funding to literally help us bring people in from the cold. I just want to, quick question to staff. How will we be communicating these additional services to the public, but more particularly to those who need it?
Can someone give us a hand with that?
Apologies, sorry, I'm having just a few technical difficulties.
Go ahead.
The question, and through the chair, in terms of communicating these new initiatives to the public, we did recently begin an outreach campaign, and some of you may have noticed in Brampton that we have been using the big screen. We have advertisements. We are getting the information out to residents and business owners about the work that we are doing there. So we will continue that outreach. We will continue to work with our clients. Mobile outreach staff will also be out in the community, making sure that our clients are aware, as will our community agencies. So we will be making sure this information gets out formally and through our informal channels. Thank you.
Thank you very much, Janice. And I don't want to add more to our time as the meeting is going into overtime already, but please don't let my brevity suggest that I am not extremely pleased that by the fact that we're looking at this report today and have this opportunity to do more. So thank you, and I'm pleased to move the motion to
thank you.
The report and the recommendations. Thank you.
Yes, thank you. Councillor Parrish.
Thank you, and I want to congratulate the three councillors, Santos, Vincenze, and Medeiros. First of all, I was very impressed with your delegations from your businesses in Brampton when they were last here, I guess September. They were well organized, they were polite, they were to the point, they expressed the same concerns that I'm experiencing in Malton and have been for as long as I've been elected. I think one of the bullets here says these initiatives can be implemented immediately on a temporary basis, using up $550,000 of the federal money, leaving none for other things. I think that's a good use of money. I think sometimes when we try to do too much with $500,000, we don't do enough for any of the projects. So I'm happy to see this has been done so quickly. Very impressed, Commissioner Sheehy, that you pulled all this together this quickly, because things usually move a little bit more slowly, especially when we've got all these other things on our plate. So congratulations to the Brampton councillors. I'm delighted to see this. This is a really good project, and St. Leonard's Place, Peel was ready to take it, and hope you have all the success with this. And I hope we come out of this just like we did with the seniors dental. We started putting, this time it's not our money, but we started putting money into projects like this and addressing things like seniors dental. And eventually the province caught on. So perhaps if we have a really good result from this, we can then start doing this on a fairly regular basis in other locations, and we can take care of our homeless people on a much more compassionate basis than what's happening with them now. And maybe the province will learn from us again. We're leaders in these fields. So congratulations to everybody.
Well said. Councillor Demerla.
Thank you, Chair. And I also want to thank staff for this report. And of course, Mississauga is also going to be getting some of this money. And so I'm very grateful for staff. And as I've said to Janice, we had a really good conversation and I look forward to working with you on the details. In some ways, the Brampton councillors, I sort of envy you because there's three of you with the same problem. With Cooksville, it's really a big problem here in Cooksville for me as well. And I'm trying to do my best and definitely inspired by what the three of you are doing there. And I look forward to some of this short-term money being invested in Mississauga as well to help alleviate the problem. And of course, I look forward to the discussion around the motion. But and Janice, I just wanted to say that, as you know, I have struck Cooksville homelessness table out of my ward, and it was fantastic. The last table meeting was absolutely very productive. I want to thank your staff from the Region of Peel for all of their input. You have some fabulous people doing work on the ground in Cooksville, trying to house people, trying to build those relationships. And I hope that you'll be able, I'm hosting this table every 8 weeks, and I really hope, Janice, that for the next one, you will be able to attend it as well. We have to find solutions and they have to be collaborative, and this table is one way. So I look forward to the continued partnership, Janice. And I hope you got some reports back from your staff who attended the table. Thank you.
Thank you. Councillor Paleshi.
Thank you, Mr. Chair. So if you could bear with me a little bit here, members of council, I have I was at actually Dollarama last night, coming out of there with my kids, and I ran into a very nice young gentleman that was looking for some money. He needed something to eat. He needed a place to stay. Didn't have a phone, wasn't able to get anywhere, and had contacted Toronto, and they had said that the closest available housing spot for him to take him was fully booked. So he was a little bit disheartened, didn't know where he was going to sleep last night. So we chatted for a little bit, and I called the Region of Peel. The Region of Peel, the people that were working the phones there were absolutely unbelievable. Was able to find him a place very close, really quickly. We're really efficient. We're just fantastic. So once we got that all done with, they had his name. They were expecting him to be there as soon as he could. I explained to the gentleman where it was, how to get there. This gentleman was about 26-year-old, so he was just out of the youth age. He was a gentleman that was a little bit bigger than me, a little bit wider than me. So a big boy, big young lad, very soft-spoken. And so he looked at me and he said, I don't know if I can go there. It's a really rough area. I'm a little bit scared. And so we talked about that for a little bit and tried to build his confidence. But in the end, when it came down to it, is if we can't provide safety for some of the people that are going to our shelters in areas that should be safe, then it's something that we have to look at. So I guess my question really is related to any of the funding that's being provided by any of the levels of government. How much of that can we contribute to trying to ensure that these places are and the residents that have no other place to go but here, how can we ensure that they feel safe and that they're safe?
So if I may, through the chair, I will address that question. Thank you very much. So unfortunately, shelters, and not just in Peel, but across the province, and I would say the country, sometimes have a reputation associated with them. Our shelters are very safe. They are at 50% occupancy, so we are practicing physical distancing. In some other municipalities, they've installed plexiglass to try to keep clients separated, but we are practicing physical distancing. So yes, we try to get the message out that this is a good place for someone to go to. The nature of many homeless people is that they are transient and that they move from municipality to municipality. So we are challenged with that, but as I did mention, we have started a new outreach campaign, and much of that campaign is directed towards residents so that if they see someone on the street, they will feel comfortable enough to go up to them and talk to them about the services that are available in Peel. Thank you.
Okay, thank you. Thank you all. With that, I have the motion before me as moved by Councillor Vicente, seconded by Councillor Santos, that up to $250,000 of federal or provincial COVID-19 emergency funding for the vulnerable be allocated to St. Leonard's Place Peel to operate an out-of-the-cold program until March 31st, 2021, and further that up to $300,000 of federal or provincial COVID-19 emergency funding for the vulnerable be used to enhance access to healthcare for the homeless and other vulnerable residents until March 31st, 2021. A recorded vote. Madam Clerk, over to you.
Thank you, Mr. Chair. Mayor Brown. Mayor Brown?
Yes, can you hear me?
Yes, I can. Your vote, Mayor Brown? Sorry.
I heard Theodore say yes. It's good enough for me. Moving on.
Mayor Brown in favor. Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie? Mayor Crombie? Councillor Demerla?
In favor.
Councillor Demerla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey? Oh, sorry, Councillor Early. Councillor Early. Councillor Early? Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Yes, in favor.
Councillor Groves in favor. Councillor Innes?
In favor.
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
In favor.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yes.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson?
In favor.
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor, and that carries. Thank you.
Thank you.
Councillor Early in favor, sorry. I couldn't
Councillor-
get back on. Thank
Noted.
you.
Councillor Early was in favor as well. Thank you. Okay, on to 17-1.
Mr. Chair, I'm sorry, I got missed too.
Oh, and Mayor Crombie acknowledged in favor as well. Thank you, Bonnie. And if we can make sure everybody else has got their mics muted, thank you. Moving on, 17-1, proposed work plan for the Region of Peel Planning Advisory Committee. Oh, sorry, my apologies. Which motion was that? Oh, the St. Leonard one? Or, sorry, my apologies. That was St. Leonard. Oh, I've got that as 22.1. Okay, we were going to deal with it at the same time. Councillor Santos, item 22.1, which is further down, but we should have dealt with it at the same time. I have the motion here moved by Councillor Santos, seconded by Councillor Demerla. I will read the therefores. Therefore, be it resolved that regional staff investigate and report back to regional council by early second quarter 2021 on the feasibility of granting program administered by the Local Business Improvement Association, BIA, in downtown Brampton and Cooksville that would subsidize local business owners with services to include, but not limited to, additional garbage collection and graffiti cleanup, and further that the report provided provided information on details, logistics, accountabilities, funding sources, and risks related to such a program, and further, that any further service enhancements be contemplated or provided in downtown Brampton or Cooksville to the vulnerable populations be done only after meaningful consultation with the BIAs. Madam Clerk, a recorded vote? Go ahead.
Comments.
Oh, sorry, do I have
please.
speakers? My apologies, I have two speakers. Councillor Parrish.
Yes, Chair, I was curious as to why Cooksville got on here, given that this was kind of a pilot project. But since it's on here, the Malton BIA has written me several emails wanting to know why I hadn't put them in the mix. And the reason I hadn't put them in the mix, and they probably have the worst problem other than downtown Brampton, probably the worst 20-year problem of the whole region. We've had stabbings, we've had playgrounds burned down by guys trying to stay warm. We've had people defecating at 2 o'clock in the afternoon when there's seniors going shopping. It's a zoo, and the region has done as much as I believe they could within the bounds of what there is to work on the problem. And I appreciate what they've done. And Peel Regional Police have done what they can do, and the security at Westwood Square has done what it can do. But if this is not going to be a single pilot project, and we had a 20-page report done on the Malton neighborhood in 2018, which I thought was pretty thoroughly done. I would be very remiss of me not to add Malton to this study. Matter of fact, I would probably be in big trouble with my BIA. So my first thought was it should be just Brampton, because you've got the St. Leonard's thing working, it's all together. Get a report in a couple of months, and then we can add the other BIAs in. But if there's more than one BIA in, I want it to be, I want to add Malton. I feel badly doing it because I really believe this should have been a Brampton project.
Thank you. After the conversation, I'll go to the mover and the seconder. Hopefully that's a friendly amendment. But moving on for now, Councillor Demerla.
Oh, thank you, Chair. I'm happy to support Councillor Parrish, but I think it's somewhat unfortunate that she thinks that Cooksville isn't deserving of this. I think staff will speak to the dire situation in Cooksville and some of the groundwork that we have been doing quietly, working with staff. And in fact, it was staff that suggested that Cooksville be included as well. So I feel very strongly. Just last night, there was another shooting, and you don't need a big study when you have small businesses already struggling. We spent so much time this morning talking about supporting small businesses, and I have restaurant owners who have come to me saying that there's vomit in the front of their restaurant door from some of the vulnerable population. And how much can these small businesses, how much can they clean up? The situations where some of the homeless people are just putting up tents on private property, and it becomes very difficult at that point to address that situation. And not everyone has the resources. These are all small businesses. I have one print shop that has had to pretty much blockade the little yard he has behind his business because it's become this place where people put their tents in. So these people need help. I'm happy to take anyone who wants to come and visit Cooksville and see firsthand. And I don't dispute that the problem is there in other areas, but I think staff will support that. Cooksville definitely could, the businesses there could definitely, if there's going to be a program, that it should be fair, and that the businesses in Cooksville that are really struggling with all sorts of things, and on top of that, trying to deal with the side effects of the vulnerable population, having to clean syringes off their properties and all of that. They need some support and help. And all that this motion really does is look at the feasibility. So that's where I'm going to leave it at, and I hope I can count on the support.
Thank you. Commissioner Sheehy on that topic.
Thank you. I apologize. My system seems a little bit slow. Thank you, Chair. Just a point of clarification. We did have a discussion about areas across Peel Region that were experiencing homelessness challenges, but the decision to expand from Brampton to include Cooksville was not based on a recommendation from staff. Thank you.
Okay, thank you. Councillor Santos.
Thank you, through you, Mr. Chair. And this is what I was afraid of. Might happen when we came up with this idea to begin with. When we originally had a meeting with staff to talk about this idea, Councillor Vicente was there. It was suggested that in order to perhaps garner some support around the council table, that we include some folks from Mississauga as well. The reality here, everyone, is that on September the 24th, we had a series of delegates from downtown, Councillor Vicente, Medeiros, myself, the mayor. We have been hearing a lot directly from residents, from organizations in different pockets of the downtown, on top of businesses as well in the BIA advocating. I sit on the board, Councillor Medeiros sits on the board, and Mr. Weisner, who is the insurance company that lives or that is situated across the street from Regeneration and Grace United, where there are a number of services, social support services and agencies located. They were directly dealing with feces, human feces on camera, with vandalism, with graffiti, with light fixtures and cameras being ripped off of their business. And those are all matter of fact. I know that I think it might be worthwhile as we look at a feasibility study to include something I think that Malton did with the Youth Hub, which is a feasibility study to look at some of the data and facts in the neighborhood in terms of the contributions to the damage being done and the negative impacts of the concentration of social support services in downtown Brampton. And so if it is a back and forth on, you know, who this pilot project, where it should start with first, et cetera, I'm happy to go back to the original idea, which was just to do it with the pilot project in downtown Brampton. If folks can support that, happy to support that. And assuming that the data is there, and assuming that perhaps Cooksville as well as Malton can have the supporting neighborhood data. I know that Malton, for example, did it with the Youth Hub, for example. If Cooksville also wants to put together a similar neighborhood information report, then we proceed after the downtown Brampton thing. What I don't really want is for us to stall, and I'd prefer for this to be done quickly for downtown Brampton BIA to say, yes, we could do these things, or no, we cannot. Instead of saying, yes, we could do these things, and no, not in Cooksville, no, not in Malton, et cetera. So maybe we should just start with one, with the original idea. If my colleagues in Mississauga are willing to support that for downtown Brampton, we would really appreciate that. And assuming that the report is positive, and we also have data to support the case for Cooksville and data to support the case for Malton, let's proceed there as well. So that's my suggestion. Thank you.
Thank you, Councillor Dasco.
Thank you, through the chair. And, you know, I appreciate a lot of the comments that are coming up. I have two. I hate to pile on, but I feel like Councillor Parrish mentioned, I would be barbecued at the stake if I didn't mention there's a significant issue in downtown Port Credit with drug use, syringes, people living under bridges and parks. As many folks like to come down and enjoy the waterfront, it's also become a bit of a refuge for folks as well. So there are some significant challenges that have been going on there, and there's a newly established since last year, just pre-pandemic, in from the cold program as well. So I don't know if something like this maybe gets looked at through a separate kind of lens and assessment, and we just stick to Brampton right now to address their issues. But I do think that maybe there's a larger issue that needs to be tackled here, and maybe just pinpointing and getting a start with one might be the way to go, because I wouldn't want Cooksville or Malton or Port Credit or downtown Brampton all to be you know, possibly bogging down all which need help from getting a program up and running.
Thank you, Councillor Demerla.
Thank you, Chair. Can I just ask staff to tell me what information are you missing from Cooksville that would help you say that Cooksville, should get the same, the businesses in Cooksville. So essentially what the motion is saying is that tax dollars be used to help businesses in Brampton clean up after some of the issues they have to deal with the vulnerable population. The exact same scenario is happening in Cooksville, plus now I'm hearing it's also happening in Malton and Port Credit. To me, it seems manifestly unfair to say of the four, only one gets the pilot. I mean, these are tax dollars from across the region. All of them need the same, help. And I'm not sure why it would be that one area should get it and not the others. It just seems somewhat, we're all struggling with the same thing. So if other BIAs want to be included, that's fine. But it seems, I don't think there's any data that is missing from Cooksville that would allow staff to continue. And if there is, then I'd like to know so I can work on that.
So through the chair, there are pockets of homelessness challenges across the region. So it's not a question of data. What the motion asks staff to do is to go off, investigate, and report back to Regional Council on the feasibility of proceeding with the pilot project. So we would come forward with information on the details, on the funding, on the accountabilities. At this point, we are only being asked to come back with a report, and we could report on the cost, et cetera, across Peel if we implemented a similar program region-wide.
So then I would ask that you do a region-wide report, every area that has it, but whatever it would take to make sure that it's equitable, because, valuable time is lost if Cooksville is not part of that study. Then you do a pilot, then 2 years later, we come back to Cooksville. In the meantime, it's important to help the businesses and try and nip the problem as early as possible. So then I would say, Chair, that if the other Mississauga councillors who have BIAs want in, I am welcoming you. I mean, it's just a study. No one's allocating money yet. So if you want to be part of the study, I'm happy to have you in, but please don't not support my request for a study for my BIA area.
Thank you. Mayor Brown.
Just to say, I think what Councillor Parrish was attempting to do was to simplify this, and that we had the work ready to go with the BIA and with the ward councillors who have brought this up here a number of times. And thank you, Councillor Vicente and Santos, for your advocacy here. But that's not to say that if the same collaboration happens in Cooksville or Port Credit or wherever, I'd be the first to support it. Things have a tendency to be further along. You look at the Mississauga Youth Hub, it's further along than the Brampton one was. And I remember at the time, Councillor Parrish said that she would be happy to support a Brampton one when it was ready. And so, I would just say, let's go full steam ahead, help those that need the help, try this pilot project, but let's not try to do everything, rush everything, and lose the original focus. Sometimes it's very easy in these meetings to amend a motion so many times that you lose something pretty straightforward that you're trying to do initially. So I hope that can be considered, and to Topeka and to any other areas that are looking for support know that we'll be there to support that request when it's ready.
Thank you, Councillor Parrish.
Very good, Patrick, because I can't figure out if you are saying let's just do the Brampton one first and then the rest can benefit from the news. May I ask through you, Mr. Chair, if that's what Patrick?
Yeah. Well, what I was saying, I think the Brampton one's ready to go, and that's what I think we've heard from staff. But as soon as other ones are ready to go, we're all in this together, and where there's poverty and challenges, we want to help.
Okay, thank you. Then can I ask to have the vote split or the motion split? I'm happy to withdraw, and I think Councillor Dasco said as long as he got his speech on the record, and we know we'll benefit from the study. I think we're both prepared to withdraw. So could we separate out the vote, please?
Yeah, Councillor Parrish, maybe if I could just step in for a second to try and achieve some outcome, and I appreciate your question, Councillor Parrish, of clarity from Mayor Brown. Here is just an observation that I have as the chair. It's tax dollars, and $1 is a lot of money, but when I look at $250,000, $250,000 from the COVID emergency fund, and then an additional $300,000 from the secondary fund, provincial, federal, $550,000 for the magnitude of the problem that they have in Brampton, that everybody's working so. That doesn't go a long way to do all the analysis you have to do. My fear is this: if it gets, and forgive me because I think Councillor Topeka is absolutely right, DeMerlo is absolutely right, Councillor Dasco is right. If we water it down in a manner of speaking and you try to divide it amongst four and do the analysis, I'm fearful we're setting ourselves up to fail. That suddenly we didn't really get a good analysis, we don't have a good flavor of it. If instead the one in Brampton is a success, we focus on it, then can come back and say, here's another $500,000 and another $1 million for each other hub that's, and who needs to explain that Malton's needs the assistance above and beyond all Carolyn Parishes does, and what Dipika is saying as well, and as what Councillor Dasco. But I think under the heading, Councillor Carlson, if no good deed goes unpunished, here was the original thought that downtown Brampton was had a great community contingent here, spoke to the need, and Carolyn, you're right, they were so articulate. My fear is, and I'm being very sincere, if we water it down now, we may be doomed to failure entirely come the new year. So just for what it's worth, unless you want to devote a lot more money to it here and now, but then we don't know how the Brampton model works. So Councillor Parrish, that's my way of trying to get around splitting it and maybe having a consensus on the Brampton site, but I will leave it at that and carry on with my list, but just something you may consider. Councillor Ras, Vicente, DeMerla, Parrish, Sheehy. Councillor Ras.
Thank you very much, Mr. Chair. I think I'm just looking for clarity. At this point, the motion is asking for staff to investigate and report back, correct?
Yes, as Commissioner Sheehy explained, yep.
Right, okay, so we're still expecting more information to come back. I do have a question because BIAs by their nature are lower tier entities, and I'm just wondering what type of coordination are we going to be doing with the lower tiers? When things like graffiti cleanup, I just worry about scope creep. So how are we going to coordinate the lower tiers to deal with some of these issues that, it's related to region, to police, and to the local municipality as well. So I'm just wondering how that is going to work.
Commissioner?
Thank you very much. I appreciate the opportunity to talk to the report because I want to make sure that I am clear as to what council's expectations are. So we have a report on the agenda today with 3 action items that can immediately be implemented. One of them is exclusively in Brampton and 2 of them are in Brampton and Mississauga. And then we have a separate motion which is requesting that staff work with the BIAs, consult with them, and investigate the possibility of coming forward with a program. So bring a report back which provides information to a potential program that would grant funding to the BIA. There is work and investigation to be done on this report because traditionally this has not been a role of Human Services or of the region. And these types of programs, the ones that we have been able to locate in Ontario, have tended to be funded by the local municipality or the BIA itself. So at this point, I believe we're just being asked to go away, do some work, and come back with a potential program. But I would appreciate further clarification. Thank you.
Thank you. Councillor Vicente.
Thank you, Mr. Chair.
Mr. Chair, I'm not too sure I was done.
Go ahead, Councillor.
Thank you.
I apologize, please.
Thank you. I guess the proper term is I still have the floor. Okay, so we've just approved a very, very robust plan. I think I hear some angst in Janice's voice. Do staff even have the bandwidth to do this in addition to the other things that we've just approved?
So, sorry, my system is very slow today. So through the chair, we are completely happy to go away and investigate a potential program as it's described in the motion. But what we would like to do is report back to council on how a program would work, how it would be funded, because this type of program would not be funded through provincial or federal COVID funding. It is not eligible. Who would be accountable for it. So we are confident that we can go away and do this work and come back with a report early in the second quarter of next year that would describe the program. And then council would determine whether or not they wanted to implement it as a pilot project in Brampton or expand it farther across the region.
Okay, thank you very much, Janice, and I look forward to the report. Thank you, Mr. Chair.
Thank you. Councillor Vicente.
Thank you, Mr. Chair, and thanks to members of council for all of your opinions. I think that it may be best for us to look at the Brampton downtown area and the BIA there as a model. We're asking staff to look at this and to come back. And, we heard loud and clear from the businesses in the Brampton downtown that they are being disproportionately impacted or affected by the problems that exist down there. And so we would like to proceed with this today. I think time is of the essence. And if we're just looking at downtown Brampton, I'm fine with that. It is to ask for staff to report back. And I wish to point out further to Mayor Brown's comments that, in fact, it is Councillor Santos and Councillor Medeiros who are both representatives of the BIA there. And, I am, of course, part of these discussions on a regular basis, but they are accountable to the Brampton Downtown BIA. And so really, I just want to thank them both for bringing this forward and for working with staff and everyone to try to advance this. Thank you.
Thank you. Councillor Demirla.
Thank you, Chair. I think a case is being made that the Brampton homelessness situation is in some form further ahead for staff to work on than Cooksville. And I'd like to understand from staff if that's true, and if that is true, why that's the case, because I don't understand, in what way Brampton is further ahead to, in terms of facilitating this kind of a report back, and why Cooksville can't be included.
Thank you. Perhaps the CAO has a thought on that. Then I'll come back to you, Deepika, to answer that very question or other staff, but the CAO's chimed in.
Yeah, thank you, through you, Mr. Chair. I think one thing that we could probably put forward to help this situation, the investigation and the work that staff can go away and do and then bring back as in terms of an environmental scan and then an assessment and benchmarking against what other municipalities and other organizations are doing really doesn't have to be rooted in any particular geography within the region. I mean, I think what we want to do is go away and look at broadly what other programs may be operating that are in the vein of what the councillors are asking for. We can come back with that broader high-level assessment, and then I think from there, assuming that council wishes to proceed with some or all of what staff have found in their investigation, that's really when I think we start to have the conversation about, so how do we roll this out? Do we roll it out as a pilot project in one area? Do we roll it out as a broader project across a number of different areas? So I think actually today, and hopefully in support of an assistance to council, we don't really have to define the geography for purposes of the work that staff are going to go away and do. It is a conversation we will need to have later, but we don't really need to resolve that issue today. I don't know if that may be helpful.
Thank you, Councillor Demirla. You still have the floor. Anything further?
Yeah, I mean, you know, I like Janice's suggestion. Either, you know, if it's going to be location specific, I would need to understand why Cooksville doesn't qualify at this point. And if it's not location specific and, you know, you're going to look at all of the troubled areas across Peel, I'm fine with that.
Thank you, Councillor Parrish.
Curious now because I was under the impression when we passed the motion on the project in Brampton that all of the 550,000 was going into that project. And I think the councillors affected were also, so could I have clarification on that?
Yes, through the CEO or Janice, perhaps?
I'm not sure which Janice, but I'll jump
Sorry,
in.
you're my Janice, Commissioner Sheehy. Go ahead.
Thank you. So the report consists of initiatives that we are going to implement immediately that cost $550,000, and they are separate from the motion to come back and report on a new program.
No, I understand that, but I was under the impression that all 550,000 was going into the emergency situation in Brampton.
No, there are 3 initiatives in the report. One is a Out of the Cold program specifically for Brampton. The other 2 initiatives, which are enhancing health services and also enhancing our ability to clean up needles, etc., are in Mississauga and Brampton.
And in Mississauga, they're just in Cooksville?
No, they're across Mississauga.
Thank you.
Oh, okay, thank you. Councillor Santos.
Thank you, through you, Mr. Chair. And I think we've debated this now anyway, we got to move on. So I'm okay just to have a more broader look at this as a feasibility study and not necessarily name a community per se. But what I will say is that the entire premise of this motion was brought forward because of the hard work that was done in the downtown Brampton core and the delegations from September the 24th. And at the end of the day, I think we do have to start somewhere. And if we do start somewhere, i.e. the somewhere being downtown Brampton, that doesn't, assuming that the feasibility study that is done there, that doesn't mean that we can't, when the report comes back, implement that in other areas as well. And the other reason why we wanted to focus on downtown Brampton was because of the possible correlation with the concentration of social support services and agencies within the downtown core that are located within the downtown core. And that was consistent in the delegations that came forward on September the 24th. So I'm going to follow the lead of Mayor Brown as well as Councillor Parrish in terms of maybe just pulling it back, keeping it to the feasibility study to the downtown core. And that does not, Councillor Demirla or any other Mississauga councillors, that does not mean, as Councillor Brown, Mayor Brown had said, that we're not going to look at the other areas later on. I just think we do have to start somewhere.
Thank you, Councillor Medeiros.
Thank you, through you, Chair. And I think there's been a lot of great points. I think, and I appreciate the CEO chiming in, and I appreciate when you're doing an environmental scan, you're going to look at the different areas. I think the case that we've been trying to make from the onset is that we have some unique features in our downtown Brampton, which I would sort of challenge that are very unique, similar to Port Credit having water is unique to that area of the city, and we don't have it. Notwithstanding, we have the same issues, but there's some unique features and attributes that we have in our downtown, and certain challenges. And Councillor Santos talked about the concentration of services and our just even the physical nature of our downtown. It's probably one of the only sort of natural, similar to Streetsville, which has that sort of natural downtown where everything is crowded, everything is together. So there's a lot of sort of unique features, and certainly from the community in which we've brought on. And I don't want to sort of go into a historic sort of since 2014, since I've been on council, and how many times we've looked at the downtown. We at the City of Brampton, just to assure Councillor Raz and others, we've done our part at the lower municipality where we did sort of pass a motion specifically addressing all the sort of issues that we could from a lower tier municipality and working with the BIA. But one thing that really became sort of noticeable is that there were issues that were out of our scope. And I really love the fact that you talk about scope mandate, and I often sort of repeat that at the City of Brampton. So that's why we've sort of brought this conversation here to the region, because we're doing what we can at the City of Brampton. So we've got, and even we've gotten a downtown precinct and working with our Peel Police. We're working with every entity we can. We're looking at some other work about looking at other areas where we can sort of break up that concentration of services as well. So when we go away, I really want us, and what I would hopeful that all my colleagues would support is just recognize that where we are in the process, recognize that we've rallied the community, and it's not something that we're just tackling on now. We've done our part in Brampton. We've moved motions in Brampton focusing on the downtown, and there are right now issues that we're trying to address on a regional perspective. So I look forward to part of that work that comes back from staff, and certainly they'll point out areas in which are not traditional business, and we might want to have that more lengthy conversation. Thank you.
Thank you. And in the interest of clarity, Councillor DeMerla, you're next on my list, but I just wanted to be clear because I want to make sure staff have the right direction going forward. In the motion moved by Councillors Santos and DeMerla, the initial intent is pretty clear in the first paragraph. Whereas at the November 26, 2020 Regional Council meeting held, report titled Additional Immediate Actions to Address Concerns About Homelessness in Downtown Brampton, in quotation marks I might add, is being presented to highlight proposed service and program enhancements to support the homeless in downtown Brampton and to work towards addressing the concerns of business owner and local residents. And whereas a disproportionate number of social service support services are concentrated in downtown Brampton, and then the next clause is where it opens up, and whereas Cooksville also has a significant increase in homeless population, and then it opens up from there, but then the therefores only speak to Cooksville and Brampton. So, you know, we need clarity if we're all on the same page. Is it Brampton standalone? Because I agree with everybody else, Councillor Parrish and Councillor Daskell. And if it's not, you know, after Cooksville, you've got to put comma Malton, comma Port Credit, I would think. And if that's the intent, that's not what this motion says. So Deepak, I will come back to you. Then Councillor Pelleggi wants to be on. But I hate to belabor it, but I do think we need some more clarity. Councillor DeMerla.
Thank you, Chair. I didn't get an answer to my question last time around, which was, I think the main case that's being made is that the Brampton homelessness situation is in some form or fashion further ahead than the Cooksville one in terms of work done. And I'm just trying to understand what that is from a staff perspective, because from what I can tell, I think staff would have to do exactly the same amount of work, whether it's Brampton or Cooksville, to turn this report out. And I don't believe that, you know, there's anything that makes it easier to do it in Brampton or that it's further ahead. Yes, I understand that the drop in center piece is, you know, it's a legacy piece that Brampton has, but beyond that, the other money, as I understand it from the I think it's from the short-term funding money through COVID is going to come to Mississauga and Brampton. Maybe Brampton has a homelessness problem only in downtown. I don't know. In Mississauga, it's more widespread, perhaps. But I need to understand, in the spirit of fairness, in what way is Cooksville not able to participate in this study? Because I think, you know, it would be only fair to have at least one Mississauga and one Brampton as a starting point, but I'm happy to include others or have a broad one. But I need to understand, because the primary case somehow is being made that Cooksville is not as prepared to get this study. So I need to understand what the gap is.
Commissioner Sheehy.
Yes, thank you very much for the question, and through the chair. I will just reiterate what our CAO said. You could take out all geographic specific information from this motion and ask staff just to report back on a program that provides a grant to the BIA similar to what has been outlined in terms of garbage collection and graffiti cleanup. So there doesn't have to be any geographic information in this motion. We could do the report Peel-wide. Thank you.
But that doesn't answer my question, Janice. Is there something that I, as the councillor, need to do, which is what is being alleged indirectly, that would make Cooksville more ready to be part of this? Or I don't think so. I mean, I get the point that Brampton had the delegations of businesses, and if that's the missing link, I'm happy to arrange that, you know, and if that's what I need to do to get council to support me. But it just seems to me manifestly unfair to say that two areas that are really struggling, and you know, maybe Janice, you could speak to, if you were to rank the hot spots of homelessness in Peel, what would they be? Are they all equal, or, you know, where would Cooksville bubble up?
So through the chair, I'm not in a position to actually speak to where the most serious challenge exists in terms of homelessness in Peel region. I haven't analyzed the data, and I should tell you the data itself is very limited because our homeless population tends to be transient, and we haven't done the type of point and count exercise that we have done in previous years because of COVID. So I wouldn't be able to express an opinion at this point as to where the problem is most significant.
So can I just ask, is Cooksville as easy for you to do a study on as Brampton downtown in terms of the data and whatever process we need to be at?
Through the chair, I believe earlier in the conversation, Councillor Parrish was referring to a report that was pulled together for the Community Hub from our neighborhood information tool. And yes, we are able to pull that type of information together for every area in Peel. It may not be specific to homeless, and it may not be exactly what we're looking for, but we are able to pull it together.
So Janice, what I'm really hearing from you, I don't want to put words in your mouth, what I'm hearing from you is that, you know, Mayor Brown had somehow suggested that the whole homelessness issue in downtown Brampton was further ahead in terms of work done. And what I'm hearing from you is that's not necessarily the case insofar as it, this particular report, what this report is seeking. So my only plea to council would be, in the spirit of fairness, either support both or support all four, or make it really generic. That would be my only ask.
Thank you. Councillor Paleshi.
Thank you, Mr. Chair. I called the question on the original motion. Unless it was split by Councillor Parrish, then I called the question on the split motion.
Okay, and I'm going to the clerk because we need clarification on the motion itself, because as I read it, I want to make sure the words say what I'm hearing around the table, and I'm going to leave it at that. To the clerk.
Thank you. I'm just want to clarify that the motion, as Councillor Parrish had proposed to be split, would just remove Cooksville. Is that correct? That's correct. Okay. All right, so we can move forward and take a vote on that motion. All right, this does require a recorded vote. And this is the motion as moved by Councillor Santos.
Can we see the motion on the screen?
Yes, we will put it up. You don't have it up? Okay, if you can just give us a few minutes and we'll have it projected.
Point of order. So the first motion that we're voting on is for the motion that is split to remove Cooksville. Is that correct?
That is correct, Councillor Santos.
So Chair, does that mean that I will be able to put a motion then asking for Cooksville?
Through to the clerk.
What we could do first is vote on the amendment. No, sorry, I'm going to go through to Councillor or to Commissioner Locklear, please.
Thank you. If you want to actually split them, then it would be the entire motion with just Brampton, and then the entire motion with just Cooksville. And that way you'd have the two motions, and they'd be split, one for Brampton, one for Cooksville. That's what I understood the split to mean when it was proposed by Councillor Parrish and confirmed by Councillor Paleshi. What Councillor Demerla is just proposing is that it's an amendment, that Councillor Santos' motion would just be for Brampton, and Councillor Demerla is asking for an amendment to put Cooksville in which case you'd vote for Cooksville first. But what I believe that it's a split that was called for the call of the question. So it will be two separate votes, one for Brampton and the second one for Cooksville.
And if I could, just to be 100% sure, in fairness to Councillor DeMerle, the one and only motion I had, regardless of how you split it, had Councillor DeMerle as the seconder. I can't imagine she'd be signing a motion as a seconder that excluded her Cooksville. So perhaps if the clerk could be clear, I leave it to you to, I think it might have been Councillor Parrish, but certainly Councillor DeMerle wouldn't want her name on a motion that does. So I just want everybody to be aware of that. Madam Clerk, back over to you in terms of how you'd like to proceed.
Actually, Chair, I'm happy to support Brampton. I have no problems seconding that. I'm just hoping, because it's split, that Councillor Santos will continue to support Cooksville in the round two. That's all. But I have absolutely no problem supporting Brampton.
Very good. Thank you, Madam Clerk.
Fairness on the
Yes.
same issue. That's all.
Madam Clerk, over to you to conduct the votes.
I'm going to include Councillor Parrish, if Councillor Parrish is okay with that, as a seconder, since she did propose the motion to be split. Okay, so we've got the motion moved by Councillor Santos and seconded by Councillor Parrish. With council's indulgence, I can read the full motion, or I can just do a short reading. All right, I'll do the short reading.
Short reading.
Thank you. Therefore, be it resolved that regional staff investigate and report back to regional council by early second quarter of 2021 on the feasibility of a granting program administered by the Local Business Improvement Association, bracket BIA, in downtown Brampton that would subsidize local business owners with services to include, but not limited to, additional garbage collection and graffiti cleanup. And further, that the report provide information on the details, logistics, accountabilities, funding sources, and risks related to such a program. And further, that any further service enhancements being contemplated or provided in downtown Brampton or Cooksville to the vulnerable population be done only after meaningful consultations with the local BIAs. As I said, this requires a recorded vote. Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson.
Yes.
Councillor Carlson, and I apologize, I just asked.
I'm sorry to interrupt. Yeah,
mute,
microphones
please.
off, please. If everybody can make sure they're on mute, please.
Thank you.
Thank you. Carry on with the vote,
you.
please.
Mayor Crombie.
Yes.
Mayor Crombie in favor. Councillor Demurla.
Yes.
Councillor Demurla in favor. Councillor Dasco.
Yes.
Councillor Nasco in favor. Councillor Dillon.
Sorry, my audio had got cut out. This is a split vote for, this one is on Malton only, right? Brampton only.
Brampton only, that's correct.
Okay, yes.
Councillor Dillon in favor. Councillor Early.
Yes, in favor.
Councillor Early in favor. Councillor Fonseca.
Yes.
Councillor Fonseca in favor. Councillor Fortini.
Yes.
Councillor Fortini in favor. Councillor Groves.
Yes.
Councillor Groves.
Yes, in favor.
Councillor Groves in favor. Councillor Innes.
In favor.
Councillor Innes in favor. Councillor Kovac.
In favor.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden.
Yes.
Councillor McFadden in favor. Councillor Medeiros.
Yes.
Councillor Medeiros in favor. Councillor Paleshi.
Yes.
Yes.
Councillor Paleshi in favor. Councillor Parrish.
Yes.
Councillor Parrish in favor. Councillor Raz.
Yes.
Councillor Raz in favor. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair. Councillor Sinclair.
In favor.
Councillor Sinclair in favor. Councillor Starr.
In favor.
Councillor Starr in favor. Mayor Thompson had to leave the meeting, and Councillor Vicente.
Yes.
Councillor Vicente in favor, and that carries. So this is the second motion. I have a mover as Councillor Demurla, and this is only in regards to Cooksville. We need a seconder.
Can I have somebody second that? I see Mayor Crombie waving. Mayor Crombie seconds the motion. Thank you.
Mayor Crombie, thank you. I will read the motion, the therefore clause again. Therefore be it resolved that regional staff investigate and report back to regional council by early second quarter of 2021 on the feasibility of a granting program administered by the Local Business Improvement Association in Cooksville that would subsidize local business owners with services to include, but not limited to, additional garbage collection and graffiti cleanup. And further, that the report provide information on the details, logistics, accountabilities, funding sources, and risks related to such a program, and further that any further service enhancements being contemplated or provided in Cooksville to the vulnerable population be done only after meaningful consultations with the local BIAs. And this will also require a recorded vote.
I see, Councillor Dasco, I see your name on, but I know the question was called,
So,
correct,
yeah,
Madam Mayor?
yeah,
We're
so
on to the
We
vote.
started the vote, so we
Yeah,
have to
thank
continue
you.
with the
Please
vote.
proceed.
Mayor Brown?
No.
Mayor Brown opposed. Councillor Carlson?
No.
Councillor Carlson opposed. Mayor
Madam
Crombie?
Clerk, I think weren't we going to add Port Credit and Malton into that motion?
That's not my understanding. It was just Cooksville.
I'll support. We can come back and add the other two next time.
Okay. Mayor Crombie in favor. Thank you. Councillor Demurla?
Yes.
Councillor Demurla in favor. Councillor Dasco?
Yes, and I concur with Mayor Crombie.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
Yes.
Councillor Early.
Yes.
Sorry, I keep doing that.
Yes.
Thank you. Councillor Early in favor. Councillor Fonseca?
So for clarification, we're coming back and adding Port Credit and Malton?
That wasn't a motion that was put forward. The only motion put forward was to split Cooksville and downtown Brampton.
Okay, then no.
Councillor Fonseca opposed. Councillor Fortini. Councillor Fortini. Councillor Groves. Councillor Groves. Councillor Innes.
No.
Councillor Innes opposed. Councillor Kovac.
No.
Councillor Kovac opposed. Councillor Mahoney.
No.
Councillor Mahoney opposed. Councillor McFadden.
No.
Councillor McFadden opposed. Councillor Medeiros.
No.
Councillor Medeiros opposed. Councillor Paleshi.
Yes.
Councillor Paleshi in favor. Councillor Parrish. Councillor Parrish. Councillor Parrish opposed. Councillor Raz. Councillor Raz.
Yes, and I hope others come back at a future date.
Thank you. Councillor Raz in favor. Councillor Sato.
No.
Councillor Sato opposed. Councillor Santos.
No.
Councillor Santos opposed. Councillor Sinclair. Councillor Sinclair.
Sinclair opposed?
Councillor Sinclair opposed. Councillor Starr.
No.
Councillor Starr opposed. Mayor Thompson had to leave, and Councillor Vicente.
No.
Councillor Vicente opposed.
Madam Clerk, it's Councillor Groves. Can you hear me?
I can?
Yes?
Okay, all right, can you hear me?
Yes?
we can.
Would you
Thank
like to vote?
Yes, my vote was a no.
Thank you.
Thank you.
Councillor Fortini, I'll try you one more time because I think you were passed. Can you hear me, Councillor Fortini, and would you like to
It
vote?
was a no. I said no.
Very good. Thank you. Madam Clerk.
And the motion is lost.
Thank you. Okay, moving on, that brings us to item 17.1, items related to planning and growth management, proposed work plan for the Region Appeal Advisory Committee. I understand Commissioner Smith had an amendment or a point of clarification. Adrian, is that right?
Yes, thank you, Mr. Chair, for the opportunity to speak briefly to this report. And as you'll know, this report relates to the proposed Region Appeal Planning Advisory Committee. And it's been a little bit of time since the last discussion on this back in 2019. And At that time, there was council direction to proceed with a planning advisory committee comprised of members of the public and excluding members of regional council. And based on the direction outlined in the report that's before us today, the committee would be comprised of 9 members of the public. Essentially, it would function as an extension of our ongoing public engagement efforts and seeking input from the public on our regional policy work plan. And the committee would not be responsible for providing, detailed local or site-specific development type matters or decision making. And what happened is that the terms of reference attached to the report inadvertently still retained an earlier reference to members of council in defining quorum. And we just looked to revise that so that the quorum would reflect a majority of their membership from the public. And with that correction, the report recommends that we move forward with the terms of reference and the work plan, and of course we report back to council for final approval and selection of the committee membership at a future date. So thank you for that. And I think the correction is shown up on the screen there.
Very good, Madam Clerk. Do you need a mover and a seconder for that? So I need a recorded vote. I need a mover and a second for that amended report from staff. I see Councillor Parrish and Councillor Sinclair. Madam Clerk, those are my movers and seconders. Over to you.
This requires a recorded vote. Mayor Brown? Mayor Brown?
Yes.
Mayor Brown in favor? Did I hear that correctly? Mayor Brown? Okay.
Yes.
Nope. Mayor Brown in favor. Thank you. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie? Mayor Crombie, your mic is muted.
Yes, I support.
Thank you. Mayor Crombie in favor. Councillor Demerla?
Yes.
Councillor Demerla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Early?
Yes, support.
Councillor Early in favor. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Yes.
Councillor Groves in favor. Councillor Innes?
In favor.
Councillor Innes in favor. Councillor Kovac?
Yes.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
In favor.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yes.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes, yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson had to leave the meeting. Councillor Vicente?
Yes.
Councillor Vicente in favor, and that carries. Thank you.
Very good. Next item I'll deal with just quickly is we're at 3:30, and I need a motion that I hope I can get from Councillor McFadden and Councillor Sinclair that we go beyond the usual 3:30. All those in favor or any opposed? None. Thank you. Moving on. Councillor Parrish, you're on my list. Did you have something, Councillor Parrish, or is that a residual?
I was just going to move that motion for the committee.
Okay, very good. All good. So moving on then, items related to enterprise programs and services. 19.1, election of regional section chairs and vice chairs and appointment by members of committees. And for this, I turn the vote over to the clerk and to the commissioner. Over to you.
Thank you, Mr. Chair. Council will recall that on December 13th, 2018, section chairs and vice chairs and various committee members were appointed to coincide with the midterm of council. As we're now approaching the midterm, council section chairs and vice chairs must now be appointed for the second half of the council term. Council will also recall that in accordance with the electronic meeting procedures, the role of council section chairs was discontinued to maintain an effective meeting flow. However, the appointment of section chairs and vice chairs is still required because membership on a number of council committees is dependent on who holds the positions of chair or of council section chair or vice chair. The procedure bylaw only permits a member to serve as chair or vice chair of one section during a term. If there's more than one nominee for the position of section chair or vice chair, nominees will be voted on by a recorded vote, and the nominees who receive the majority of votes will be elected. I'll now begin the election of the council section chairs and vice chairs, and we'll start with the health section. Indications of interest for the health section were received from Councillor Groves in the position of chair, and for the vice chair position, Councillor Demurla. If there are any other councillors who wish to serve as chair or vice chair of the health section, can you please confirm your interest by unmuting your microphone, stating your name and the position you're interested in? Seeing none, we'll now close the nominations. Are there any objections to closing the nominations? Hearing no objections, the nominations are now closed. Need a mover and a seconder for these nominations.
I see Councillor Parish and Councillor McFadden's arms.
Thank you. I have a motion before me which states that the chair and vice chair of the health section of Regional Council for the remainder of the council term or until successors are appointed by Regional Council be as follows. Councillor Groves as chair and Councillor Demurla as vice chair. Are there any objections? Hearing none, that carries. Next section is the Enterprise Programs and Services section. Indications of interest for the Enterprise Programs and Services section were received from Councillor Fonseca in the position of chair and Vice Chair Councillor Raz. Are there any other councillors who wish to serve as chair or vice chair of the Enterprise Programs and Services section? And if so, can you please confirm your interest by unmuting your microphone and stating your name and the position you're interested in? Okay, not hearing any interest. We'll now close the nominations. Are there any objections to closing the nominations? Hearing none, the nominations are now closed. Do we have a mover and a seconder for these nominations?
I see as a mover Councillor Mahoney, and I see Councillor Starr as a seconder.
Thank you. I have a motion before me which states that the chair and vice chair of the Enterprise Programs and Services section of the Regional Council for the remainder of the council term or until successors are appointed by Regional Council be as follow. Chair, Councillor Fonseca, and Vice Chair, Councillor Raz. Are there any objections? Hearing none, that carries. We'll now move on to the Human Services section. Indications of interest for the Human Services section were received from Councillor Medeiros in the position of chair and Councillor Fortini in the position of vice chair.
I will withdraw my name, please.
Okay, thank you.
So it's Councillor Dillon. I'll add my name for vice chair.
Thank you. Are there any other councillors who wish to serve in the position of chair or vice chair? Seeing none, we'll now close the nominations. Are there any objections to closing the nominations? Okay, not hearing any. The nominations are now closed. Do we have a mover and a seconder for these nominations?
I acknowledge Councillor Fortini as the mover and Councillor Fonseca, as the seconder.
Thank you. I have a motion before me which states that the chair and vice chair of the Human Services section of Regional Council for the remainder of the council term or until successors are appointed by Regional Council be as follows. Chair, Councillor Medeiros. Vice Chair, Councillor Dillon. Are there any objections? Carries. Moving on to the Public Works section. Indications of interest for Public Works were received from Councillor Starr in the position of chair and Vice Chair Councillor Fortini. Are there any other councillors who wish to serve as chair or vice chair of the Public Works section? If so, can you please unmute your microphone and indicate your interest? Right, not seeing any hands. We'll now close the nomination. Are there any objections to closing the nominations? Hearing none, the nominations are now closed. Do we have a mover and a seconder for these nominations?
I acknowledge.
Moving that, Madam Clerk, it's Councillor Groves.
Thank you.
And I see Councillor Dasko's name up as a seconder.
Thank you. All right, I have a motion before me which states that the chair and vice chair of the Public Works section of Regional Council for the remainder of the council term or until successors are appointed by Regional Council be as follows. Councillor Starr in the position of chair and Councillor Fortini in the position of vice chair. Are there any objections? Hearing none, that carries. We're on to the last section, the planning and growth section. Indications of interest for planning and growth management were received from Councillor Parrish in the position of chair and in the position of vice chair, Mayor Thompson. Are there any other councillors who wish to serve in the positions of chair or vice chair for the planning and growth section? If so, can you please confirm your interest by unmuting your microphone? Okay. Not seeing any hands. We'll now close the nominations. Are there any objections to closing the nominations? Hearing none, the nominations are now closed. Do we have a mover and a seconder for these nominations?
I see Councillor Starr and Councillor Carlson.
Thank you. The motion before me which states that the vice chair of the Planning and Growth Management section of the Regional Council for the remainder of the council term or until successors are appointed by Regional Council be as follows. In the position of chair, Councillor Parrish. Position of vice chair, Mayor Thompson. Are there any objections? Hearing none, that carries. We'll now move on to the appointment of members to committees. And these appointments will only be for committees where the term of appointment is 24 months. And this will include the Audit and Risk Committee and the Waste Management Committee, Waste Management Strategic Advisory Committee. We'll begin with Audit and Risk. Councillor Fonseca and Raz will automatically become members as a result of their position as chair and vice chair of the Enterprise Programs and Services section. And indications of interest were received from Councillor Starr and Councillor Santos. Are there any other councillors who wish to serve on the Audit and Risk Committee?
Councillor Sinclair wishes to be a member. Thank you.
Thank you. Are there any other councillors? All right, hearing none. Do we have a mover and a seconder for these nominations?
I see Councillor Parrish and I see Councillor Dasko seconding.
Thank you. I'm going to have a motion before me which states that the members of the Audit and Risk Committee for the remainder of the council term or until successors are appointed by Regional Council will be as follows. Councillor Fonseca, Councillor Raz, Councillor Starr, Councillor Santos, and Councillor Sinclair. Are there any objections? Hearing none, that carries. Moving on to the Waste Management Strategic Advisory Committee. Councillor Starr and Councillor Fortini will automatically be members of the Waste Management Strategic Advisory Committee as a result of their position as chair and vice chair of Public Works. And indications of interest were received from Councillor Raz, Councillor Dillon, Councillor Innes, Councillor Demurla, and that was it. Are there any other councillors who wish to serve on the Waste Management Strategic Advisory Committee?
It's Councillor Mahoney, I would think.
Thank you.
Also, Councillor Sinclair is a member, please.
Councillor Sinclair, thank you. Any other councillors? Okay, just need a mover and a seconder for these appointments.
I see Councillor Innes and I see Councillor Fonseca, mover and second.
Thank you. I have a motion before me which states that the membership of the Waste Management Strategic Advisory Committee for the remainder of the council term or until successors are appointed by Regional Council be as follows. Councillor Starr and Councillor Fortini, Councillor Raz, Councillor Dillon, Councillor Innes, Councillor Demurla, Councillor Mahoney, and Councillor Sinclair. Are there any objections? Hearing none, that motion carries. And there's actually one more. It's for the Toronto and Region Conservation Authority Partners in Project Green Executive Management Committee. And we require 2 councillors. Indications of interest were received from Councillor Fonseca, who's a current member. Are there any other councillors who wish to serve on the Executive Management Committee for the TRCA?
Councillor Vicente.
Councillor Vicente, thank you. Any others? Do we have a mover and a seconder for these appointments?
I see Councillor Innes and I see Councillor Mahoney, mover and seconder.
Thank you. So I have a motion before me which states that 2 councillors be appointed to the Toronto and Region Conservation Authority Partners in Project Green Executive Management Committee for the remainder of the council term or until successors are appointed by Regional Council be as follows. Councillor Fonseca and Councillor Vicente. Are there any objections? Hearing none, that carries. And that's it.
Well done, Madam Clerk.
Thank
Well done
you.
to all. That takes us down to communication items to be held. The additional item 20.2, communication regarding council composition from the City of Brampton. I think it was Councillor Parrish. Did you ask this be held, Councillor Parrish?
Yes, I did. Thank you. I would like to hear from the Brampton councillors as to what the essence is of their motion, please. Through you, Mr. Chair.
Thank you. If, I don't know if Mayor Brown or someone could help us out with the Brampton resolution and the direction they wish to go.
Yeah. Sure. Councilor Madeira will speak first, and then I'm happy to speak.
Very good. Thank you.
Thank you very much. Essentially, yesterday, and this has been a discussion that we've had internally, not only at the City of Brampton in terms of fair representation. And yesterday we had a fulsome discussion, and Mayor Brown moved a motion unanimously supported by Brampton Council to seek support here at the region today for representation by population. And in the communication, I'm not sure if the clerk can put up Brampton's motion, but basically on numbers which have been also shared with the region. If I'm not mistaken, it was prepared by Hemson Consulting, which as of our population projections for 2020, that would mean that all Brampton councillors would be at the region appeal. And so specifically from a data perspective and from fair representation, that is Brampton's position, and I'll let the mayor speak. However, we do recognize as well, and some of the comments I made yesterday is we are sensitive to ensuring that there's some collegiality to gather support. On one hand, in Mississauga, we want to ensure Mississauga maintains their balance of power, and at the same time, Caledon, we don't wipe out or do it all at the expense of Caledon. So those were some of our concerns, but ultimately, unanimously, a motion which all Brampton Council supported, which was seeking support for Brampton's position of representation by population. Thank you.
Thank you. Patrick, did you wish to add anything else?
Yes, just to say, we are big believers in representation by population, and obviously that's not the case. And I understand for historic reasons why it might not happen overnight, but I think it's fair to say, no matter where you are in Mississauga to Caledon, that it not happen over by night. It's probably been moving at the pace of a snail, and so we hope that there can be some change in the right direction. If you look at the current numbers right now, if you're an elected official in Brampton, you represent 97,000 residents. If you're an elected official in Mississauga, you represent 65,000 residents.
And if you're an elected official in Caledon, you represent 15,000 members. And that's not fair. It's not equitable that someone in Brampton doesn't have the same voice. And so we're hoping that we can come together and move the yardstick in the right direction. The stats don't mislead. You know, the population figures speak to a significant disparity, and I believe that the province is willing to make an accommodation. I think their preference is that we have all three municipalities on side, but even if there isn't all three municipalities on side, I think there's a willingness to be reasonable. And so let's see if we can get all three parties on side before the province has to consider adopting their own solution. And if you look at the basis for provincial and federal legislatures, a democratic principle in Canada is representation by population. And if you look at the ridings, the 6 ridings in Mississauga, 5 ridings in Brampton, Caledon is part of a portion of a riding. The federal and the provincial ridings being identical, it's all based on representation by population. And so it's difficult to explain to residents why that basic democratic principle does not exist in the region of Peel. We should not be in a position where we're saying someone in Brampton is worth less than someone in Mississauga. A resident of Brampton is worth less than someone in Caledon. So I hope we can all be reasonable and determine what would be a solution that we can all live with. And I know federally there are some. PEI has 4 seats, even though their population doesn't merit it, and people have learned to live with that. But overall, they try to strive for rep by population. I hope that we can try to strive for as close as we can get to that in the region of Peel.
Mayor, thank you very much. My list is Parrish, Groves, Innes, Raz. Councillor Parrish.
Well, thank you very much. As chair of the Policy and Procedures Committee, we had this on our agenda, and because of COVID, it got bounced back. I think we weren't going to look at it until January or February, but I had done quite a bit of work on it, just so that we could start exactly this conversation. Representation by population is not just good for councillors and the numbers of people they serve, but it's good for who they serve, because a vote in Caledon is worth 8 votes, or that carries the weight of 8 votes in Mississauga and Brampton. The last time we looked at this, the discussion was to keep Caledon at 5 and boost everybody else up to a crazy number like 32. The province just before this last election went in and reduced Toronto down to half. And if you look at the numbers, and I don't have them in front of me, I'm sorry. If you made some modifications to shift some seats into Brampton and divvy things up a little bit more fairly, you're still going to get roughly the numbers in Brampton and Mississauga that Toronto councils are serving. So I don't think the province will object to this. We in Mississauga have 54% of the population, so it's fair to have half the seats. Brampton looks like it's around 41%, and Caledon has 5%. I think representation by population is something to shoot for, and I think you're going to see population shifts because Caledon is starting to grow in numbers. I think I could not support 11 seats going to Brampton and leaving 1 in Caledon. I could support 2 seats going to Brampton, which is an interim step, and leaving 3 in Caledon, which makes it more tenable. You would have the mayor and 2 councillors attending the region, but it's time we made a significant change, and it's got nothing to do with my being overworked, because I have 92,000 people and I have all the industrial complex in Mississauga, and I handle it. I enjoy it. I wouldn't trade it, and I wouldn't split my ward with if anybody wanted to add a seat. So, but I think I would be happy if this motion is on the floor to go to representation by population. That implication is it's 11 seats going to Brampton. and leaving one in Caledon. I would be happy to amend that to, for a start, that 2 seats go to Brampton and 3 seats stay in Caledon, just so that we can make some progress. And as in other years, the regional designation was discussed after every election. I think Catherine Lockyer made it clear in the minutes when we asked her at procedures that this time it's going to last for 2 elections. It won't be reviewed again until after the 2026 election, at which time things may change greatly all over the region. There'll be more people in Caledon, and we may have to have somebody will have to have a better look at it. I'm not going to be here, but I'm happy to make that amended motion.
Thank you. Councillor Groves.
Thank you, Chair. I understand the whole concept of representation by population. Quite frankly, I hear it over here in Bolton all the time, because Bolton feels that we should have more councillors at Caledon Council table because we have the largest population. So we deal with it here on the local level as well. However, to Councillor Parrish's point, in fairness to Caledon, and I like my neighbors over there in Brampton and my colleagues, but I don't think that we can actually basically wipe Caledon out from the regional table. I think that we need to have a voice there, and we need to have some representation other than just one, because Caledon will be growing, and I understand it'll be a while before we get to where, even close to where Mississauga and Brampton is currently, but we are going to be growing. So I can't support the motion from the city of Brampton with respect to the representation by population and bringing up all the Brampton councillors. So I don't know, Mr. Chair, procedurally, what's on the floor, or are we, I heard Councillor Parrish. She put an amendment. So is the amendment on the floor, or is it the?
Thank you. And I wanted to, and I probably should have clarified that as well through to the commissioner, because this is here before us. I don't want to sound flippant, but I want to ask, why is this here before us? What are we expected to do with it? What happens next? What procedural track are we on? Because Councillor Parrish quite rightly said we were working towards it in months gone by. I just want to know what the evolution, and I think others do as well. So how should we be dealing with this, and what happens next? Then I will carry on with the list. Madam Commissioner.
Thank you very much. What's before you right now is a letter that was received from Brampton that talked about what they passed in Brampton and requesting that the letter be brought forward to Regional Council. So at this moment, there is no motion before this table. At the beginning of the meeting, it was passed by this council that you would deal with this matter today, but to date in this discussion, there's been no motion put forward. I think that Councillor Medeiros alluded to a motion that would, but I think that we'd have to get clarity from Councillor Medeiros that he would like council composition to be changed to a straight rep by pop. The problem with that vague kind of motion is that we actually need the numbers to change the council composition. So if the numbers that he's talking about is 11 from Brampton, and 1 to Caledon and 12 to Mississauga, I think you'd need to clarify that. We do have a form of motion that we could put up that shows the framework that a motion to change council composition is required to follow to meet the expectations of the legislation. It talks about the legislation, it talks about the requirements for a public meeting, and it talks about what the change would be. I have that motion here with the words with X and Y and Z for the numbers to be completed. If that's the motion that Councillor Medeiros, type of motion that he's speaking about, then he could put such a motion on the floor, as he was the one that raised this and added it. But at this point, there is no motion on the floor.
Okay, and I'm going to come back to Councillor. Just one, and then I'll come back and assuming a motion of any kind passes today, what happens next?
So if the motion passes today, it's the intention that that is the proposed change of council composition. There needs to be notice provided to the public. A public meeting needs to be held. Our notice requirements require a 10-day period of notice to the public before a public meeting can be held. And then the motion also has to be sent to the local municipalities because this is subject to a triple majority. So the triple majority process needs to happen at the same time.
Okay, and then finally, I'm being flippant again. And the next morning, we don't show up with those numbers. Is this understood that it's for the very next election? Somebody said 2026. Do we have to send it to the province and the province has to ratify it? Just for complete clarity.
Yes, we would send it to the province at that point. And if all of this was completed before the December 31st, 2021, then it would be effective for the next election in October 2022.
Thank you very much. Councillor Groves, you had the floor. Did you have anything further following those clarifications?
No, I don't. Thank you, Mr. Chair.
Thank you. Councillor Innes.
Thank you, Chair. So I don't think I need to completely reinstate Kaladin's position. We've had lengthy conversations around this table and the previous council table in regards to this matter. And Mayor Brown touched on it himself. PEI does have those seats. Northern Ontario got an additional seat in the last round with the federal and provincial changes. So yes, rep by pop is part of it, but also rural effective representation is also part of it. It's actually constitutionally mandated. So I think that we have to be cautious when we enter into these discussions. I also think more importantly that an item as important as representation of our population deserves to be a full public process. That's not happening, and that's disappointing. I find myself repeating over the last couple of months about this not being a public process. We need to stop. We walked this on. Residents don't know about it. My residents don't know about it. Brampton's residents don't know about it. Neither does Mississauga. And that's not right. There's no reason why this couldn't have been next week at the December 3rd meeting when we could have had at least a week notice for our residents. And what's more, I'm not quite sure why this isn't even being referred, this correspondence being referred to the Policies and Procedures Committee. As a member of that committee, I asked the chair, I'm happy to have an emergency meeting. If Brampton wants us to deal with this before the end of this year, even though it's not necessary until the end of next year, I'm happy to have that and make it a priority. But it has to be public. There has to be a public process. And rushing it on the agenda today, I don't think is going to do. There's items that are being missed. I think back to former Councillor Tovey's suggestion in regard to weighted voting and looking at those opportunities. So today I won't be supporting anything coming on this. I thought we were going to be talking about the information and perhaps referring it either to committee or to the next council meeting. I think the public expects that, and I think that they deserve it of the council. This is far too important to walk on almost at 4 o'clock after a long day to deal with this issue right now.
Thank you. My list is Raz, Medeiros, Crombie, Sinclair, Brown, Paleshi. Councillor Raz.
Thank you very much, Mr. Chair. And I mean, knowing that something was coming, but not being able to see it until this morning it's just, I think, not appropriate for this meeting. I would love to hear either we have a more fulsome discussion where we can carve out some time at a council meeting or send it to Policies and Procedures and come back. But you know what? I think I've said this the last time. It's like Groundhog Day. We're not going to be able to have a triple majority, and then we're going to be spinning our wheels and left in the exact same position. So, whatever happens, happens. But I don't think we're going to make any headway on this. I don't think there's people in Brampton clamoring for more politicians in Brampton, it sounds like self-serving conversations in a time of COVID. So I would prefer not have to deal with this at all. I don't think it's appropriate. Thank you.
Thank you, Councillor Medeiros.
Thank you. Chair. I'm not sure because I do see Mayor Brown is in line. If I can yield my spot to him, because as he initiated this process in Brampton, I would like to yield my opportunity for him to speak.
I would need the concurrence of Crombie, Sinclair, and I think we'll get to in a moment. Medeiros, Councilor Medeiros, if you had something to say, I think you should probably say it now.
Well, it's just in terms of a motion to move the motion, so I'll just yield and I'll wait for his turn.
Very
and let
good.
him move the motion.
Okay, and you can come back on the list. Mayor Crombie.
I go down further the list too, please. I've got something else going on.
Okay, Councilor Sinclair.
Yes, sir. Thank you. I would have preferred having the letter referred to Rules and Procedure Committee for discussion. And the rather big item to consider is a walk-on motion at the end of the day. And if you really are talking about 3 members of council for regional council for Caledon, I think that ends up with 2 wards at 189 square kilometers. You'd have a difficult time even seeing your constituents at that scale. So there are other aspects afoot. And I think it needs more discussion. Thank you.
Thank you. Mayor Brown.
Thank you, Chair Unique. And so in terms of this being a walk-on, we've been talking about this for 5 years, and we were informed previously that we had to deal with this before the Christmas holiday recess. And so we know this was coming. All municipalities knew this was coming. And, you know, in terms of if this was truly by representation by population, Caledon would only have 1 seat. That's not what we're saying. So even under Brampton not having rep by population, there's still a disproportionate representation in Caledon. And so, you know, I think that shows an appreciation for the historic position that Caledon is in. And so, you know, no matter how you look at the chart, there's a massive misrepresentation here. And so, you know, when Councillor Parrish said that maybe a better compromise rather than having true rep by population would be 3 additional Brampton seats, I take that as a friendly amendment, because you have to have some reasonableness to this. You know, we would not want Caledon down to 1 seat. That would be unfair. But if it was based on representation by population, that's what it would be. And when they added, you know, an additional seat to Northern Ontario, they added 1 seat. They didn't add 5 additional seats. And so there has to be some reasonableness on what the overrepresentation should be as well. And so for the purpose of this discussion, I would put that motion on the floor that Brampton get 3 additional seats, which would, I just reiterate, this would not be rep by population. It would fall short of rep by population, but at least it's a step in the right direction. And in terms of the public participation, I believe the clerk has clarified that there will be a public process. So there's going to be an opportunity for everyone to have a fulsome discussion. There will be an opportunity for the public to provide their input. And just so the clerk could clarify, what opportunities would there be if we were to proceed with this for the public to have participation either at a local level or a regional level?
Thank you. Through you, Mr. Chair. The opportunities would be the public meeting, and the motion will be at each of the local councils on the public agenda as well.
So there would be opportunities for the public to participate both locally and regionally?
That's correct.
Okay, so this is not something that we're deciding today. This is initiating a process, and the timing of this is dictated by the province. Is that correct?
The timing that you're referring to, there's 2 timelines. One is the first timeline where the minister is leaving it up to the municipalities, and beyond that time frame, the minister could step in and pass a regulation. The second time frame that you're talking about is in order to make the change for the 2022 election, and that final deadline is December 31st, 2021. The first deadline in which the municipalities can make the change without the possibility of the minister making a regulation is 2 years after the council is organized. The council was organized at the, regional council was organized at the inaugural on December, I'm going to say 10th, 2018. So it's December 10th, 2020. Thank you.
Okay, but just to verify, this is a process that is this timeline, this process in terms of the calendar we have to follow. That is a provincial timeline. Is that correct?
That is correct.
Okay, and so that's why we're dealing with this today. And the reason, Councillor Parrish said we need to deal with it today is because we are we're running out of time. And I appreciate that Councillor Raz said it's not something that people are clamoring for us to deal with. But I can tell you that if she was representing a Brampton ward where there's been historic underrepresentation, you would be hearing from your constituents. In Mississauga, you represent on average 65,742 individuals. In Brampton, it's 97,000. In the cases of Councillor Dillon and Councillor Paleshi, it's actually over 100,000. And so, I'm asking for some understanding that there has to be some inherent fairness here. And so, we're not asking for the full enchilada. We're not asking for 11 all members of regional council, even if that's what true rep by population dictates. We believe this is a step in the right direction. And eventually the province is just going to force something if we can't come to a reasonable solution. And so I think this is a step in the right direction, and I hope everyone would give it their due consideration. And in terms of us, not spending too much time on it, we don't have to spend too much time on it. We've had this debate 100 times, and everyone who served on the last council will tell me they've had it. Well, frankly, the last 8 years will tell me they've had this debate 100 times. So maybe this time we don't need to have all the same discussions, and we can say this is a step in the right direction. Let's proceed.
Patrick, thank you. Councillor Paleshi.
Thank you, Mr. Chair. There's not much more I can add that wasn't said by the mayor. This isn't about Mississauga. This isn't about Caledon. This is about the fairness. Sometimes we have to do things that people may not want to do, but in the end, it's the right thing to do. And this is the right thing to do. We've been talking about this for years and years before my time on council. Like Mayor Brown said, Councillor Dillon and I represent the most amount of people outside of the mayors at regional council. It's something that we talked about: fair share for Peel, fair share for Brampton, and this is its fair share. So, but there wasn't Mayor Brown, I think, identified all the public consultation portions of it and the timing of everything. So, thank you, Mr. Chair.
Thank you. Next up is Councillor Medeiros, and I had the thought, but you heard the Commissioner Clerk also reference the same. You did allude to what sounded like a motion you wanted for on the floor, and I think Councillor Parrish even spoke to amendment, but I need absolute clarity from you now if you have in fact put that motion so that I know what it is that we are speaking to, and then please proceed to speak. Councillor Medeiros.
Mr. Chair, don't forget about me. I just asked to go down the list.
Oh, I've got a long list after that, Madam Mayor. Thank you. My list is Medeiros, Crombie, Sado, Innes, Parrish, Thompson, Dillon. But now that I have the confirmation from the Commissioner that I just want clarity on where we're headed and what Councillor Medeiros proposed as a motion, it should be very clearly enunciated at this time. Councillor Medeiros.
Yes, and I think Mayor Brown just moved the motion. I'm happy to second it. And thank you very much, Chair.
Okay, can we be, I want to be 100% clear on the motion before, Madam Commissioner, and if we could have some clarity as the clerk's office understands it, and the chair for that matter.
Thank you. If I can, through you, Mr. Chair. Mayor Brown, if I could seek some clarification from you. You are actually putting forward a motion. I didn't catch the numbers, but if I may, I might read what I think that you mean.
Okay.
And then you can tell me if I'm on the right track or not. I'm just taking this from what you said, that it would be to adopt a bylaw to change the number of the regional councillors that represent the city of Brampton and the town of Caledon by increasing the number representing Brampton and decreasing the number representing Caledon, to be effective for purposes of the municipal election to be held in October 2022, and for purposes of the composition of council for the term of office to result from that election. Is that what I'm getting from what you're saying? And what I wasn't clear about is what the numbers that you were purporting to reduce and increase.
So Brampton had originally suggested 4, Councillor Paris suggested 3, and we're fine with that friendly amendment of 3 additional councillors.
So you're saying that Brampton would have 10, Mississauga would have 12, and Caledon would have 2? Or when you say 3, are you saying that
Yes.
Caledon will have 3, Mississauga would have 12, and Brampton would have 9?
It would be 12, 10, and 2.
12, 10, and 2. Because I think Councillor Parrish said 12, 9, and 3.
Yes, that's what I said, Catherine.
Thank you, Councillor Parrish. So that's the clarification that I'm seeking, Mayor Brown? So that we know what the motion is that's up, that would be up for debate once that's on the floor and you have a seconder.
Yeah, that still falls significantly short of rep by population if it's only 2 additional seats. But if that's what Councillor Parrish is agreeing to, it's still a step in the right direction. So let's have that motion on the floor.
So just so I can be clear, and the clerk and Councillor Parrish and Mayor Brown can confirm, I believe I have a motion on the floor moved by Mayor Brown, seconded by Councillor Parrish, that the new allocation, as per the verbiage the clerk gave you, would be Mississauga at 12, Brampton at 9, Caledon at 3. I believe that is the motion on the floor. Mayor Brown, as the mover of the motion, is that my understanding? Is that your wish?
Originally, yes.
Thank you. Councillor Parrish, are you seconding that motion? I see her nod and saying yes. That is the motion before me. Councillor Medeiros, you still are on the floor. Anything further at your end?
No, I just want to thank Mayor Brown for his leadership in really showing, the ability to sort of recognize the other municipalities in terms of working with Mississauga, allowing them to maintain their position, and certainly being mindful of the valuable contribution Caledon and also for their geographic size. So I think 3 is very reasonable. So I hope that everyone can support it, and I think it's a real reasonable approach. And just to emphasize, as the mayor did, we at the City of Brampton, as much as we want fairness, we're also we're really showing a position. So I hope just unanimous support by everyone today at Council. Thank you.
Thank you. Mayor Crombie.
Thank you, Mr. Chair, and sorry I had to drop down the list. So yes, 12, 9, and 3 to equal 24, so that the size of regional council isn't changed is something that Mississauga has always supported. In fact, this is a recommendation we had agreed to back in 2014, and you could have gone to the 2018 election with these numbers, but your previous council was steadfast that 8 additional councillors be added. 4 in Brampton, 4 in Mississauga, and so of course we didn't want to increase the size of regional council, and we know that no one has an appetite to add politicians, so we didn't approve it. Now, I think it's also important to state that this isn't a discussion for P&P Committee, Policy Procedures Committee, because it's too important. It involves all of us to discuss. And so here we're having the discussion today. It's kind of late in the day, I agree, but it's a discussion I've been having personally for 6 years. So anybody who's been on this council, I know Councillor Innes has, Councillor Rass, Councillor Medeiros, Councillor Sato, and Parrish. We've had these discussions before many times. So let me just say that there are a couple of ways we could do this. Obviously, rep by population is one, and this is certainly a movement in the right direction, Mayor Brown. So I hope you're I hope you're satisfied with it. I mean, certainly Mississauga could add a councillor too, but we don't want it. We don't want to add any councillors. We don't want to add the size of regional council. We could also look at financial contribution, and then Mississauga could have 60% of the councillors. So there are different ways that one could do this. So I'm going to support this because I think it is important that that Brampton have proper representation and move closer towards rep by pop. We aren't affected. We are satisfied. We are holding our own, and we're happy at our 12 councillors. We don't change the composition of regional council, which is important to us. And we maintain 50% of the vote, which is also important to Mississauga. So I'm going to support it. Thank you.
Thank you. Councillor Sato.
Thank you, Mr. Chair. You and I are probably sitting here smiling at some of the comments about representation by population. You'll recall that I sat on a committee, can't remember what year it was, but it was with former Councillor Cullum and the late Councillor Frank McKechnie. So that was a long time ago. And we brought a report to council and to the region asking for representation by population. At that time, we had 70% of the vote. 70% of the population and the assessment, and we had 47 or 48% of the vote. So, and Brampton and Caledon at the time threw up their hands and actually left the room when we put that motion. The mayor of Brampton at the time, Peter Robertson, I think it was, got up and took his counsel and didn't go anywhere. So, Patrick, I wish you had been around back then because maybe you would have stayed and we could have had things done back then rather than waiting until 2014. I understand perfectly what it's like to represent a ward of over 100,000. Councillor Carlson and I, for many years, had 120,000 in each of our wards. And we had that until 2014 when we split the wards and added 2 more in the city of Mississauga. And that only happened because of the Justice Adams report. Not that I think he did a good job, but it did reduce our wards down. So yes, it's really difficult, and it certainly made a huge difference having much smaller wards to represent from the 120 that we were dealing with. And at that time, we had a single staff person, so it was much easier now. Councillor Raz, I think, had commented that, when you have to look at triple majority, it's not going to pass. Triple majority only requires regional council to pass it and 2 of the municipalities, the majority of the municipalities with the greatest population. So if Brampton and Mississauga approve it in the municipalities, then yes, it will pass. If you look at when Durham changed their population, and they did take 2 seats, I believe it was from, I think it was from Oshawa, and added them to the other municipalities. Oshawa was in opposition, but the other 2 municipalities supported it, majority municipalities, and it went through. So just to clarify what triple majority actually is, doesn't mean all 3 need to vote yes. So I'm going to support this. I think, I would be very hypocritical if I was to be yelling representation by population for Mississauga for the last almost 30 years, and then voted against Brampton, which is growing significantly, voted against Brampton, aiming for the same thing that we tried. So I guess I could have sour grapes and say, well, we didn't get it, so you're not going to get it, but I'm not going to do that. I agree with Mayor Crombie. It should not go to the committee. This is a regional decision, and if we debated it at the committee, we'd bring back the same motion, I'm guessing, and then we would debate it all again at council. So I think we're having a good, fulsome debate today. And Councillor Sinclair, as much as I sympathize with the land size in the town of Caledon, you don't represent land, you represent people. And it's the people who elect you and the people that are calling you And yes, it might take you a bit longer to get around your ward than some of the rest of us. But then again, you know, in Mississauga, we're not as big. But we've had this discussion where, you know, the councillor that represents downtown could potentially, he doesn't live that close, but could walk to City Hall while the rest of us have much longer and further drives to City Hall and up to the region. Councillors in the south end of Mississauga have a really long way to go up to the region. So, you know, you really can't look at it that way. We need to look at people. We need to deal with the people and the people that elect us and how we represent them. That's what I look at. So I know Mayor Thompson, you have said this before about the land size, but I still don't accept that. So Mayor Brown, I think you're being very gracious in dropping one of your requests for council. And I really, I think Caledon should appreciate that because what you brought forward, quite possibly initially what your council voted, quite likely would have passed here today. So, you know, by negotiating and reducing the numbers, I applaud you for that, but I'm supporting the motion. And I do have a question for Catherine. You know, public process. The motion today is to, I just need clarity on that. I don't know if it's up in front of us or not because I can't see it. I have a tiny little square. Is the motion to move to public process? Where are we here? No, notice be given of council's intention to adopt. Okay. And then the public meeting. Okay, no, that's fine. I just want clarity on what we were actually voting on today. So I'm supporting it. Thank you.
Thank you, Councillor Innes.
Thank you. A couple of questions of clarification for Walker, please. The process that you outlined indicated that council has until December 31st, 2021 to make a recommendation. However, if they make that recommendation after December 31st, 2020, the minister could step in at any time and make a recommendation himself or herself. Is that correct?
Correct, except for it's not December 31st, 2020. It's 2 years from the date of organization of the council, so it's December 10th, 2020.
Okay, and so I guess that's my first concern is we're rushing to deal with this now, even though we have a provincial government who's focused on COVID, like we all should be, and who isn't going to be, you know, making changes to our council in the next, I don't know, 3 to 6 months, which would give us time to even have this discussion in public. Yes, to Mayor Brown's point, you know, Brampton had been talking about it this week, but the reality is my public does not know we're even discussing this right now. They're not listening to the conversation. They weren't made aware of it, and that's wrong, first and foremost. Secondly is, I guess my other question is for Ms. Lockyer, through the process, after we have the vote today, then we have the 10 days notice for a public meeting, then we host our public meeting, then it comes back to council for a vote. Is that correct?
Then it goes to, after the public meeting, it goes to all of the local councils for the triple majority.
So the vote today is the only vote that the region appeal will be taking place. There isn't a vote after the public meeting.
This is the resolution. The resolution goes to the public meeting. The resolution goes to the local municipalities. It comes back to the region for the bylaw, to pass the bylaw.
So what happens if, when it comes back to the region to pass the bylaw, there isn't a single town of Caledon councillor sitting around this table?
We wouldn't have quorum to take a vote.
That's correct. So basically what our colleagues in Mississauga and Brampton are saying to all of the residents of Peel, Caledon has a decision to make. They can either decide during a global financial and health pandemic to stall the business of the region of Peel, or they can vote to reduce their representation at council. Wow. Impressive, guys. Shame. Shame on all of you. This is not the appropriate time. This is not the appropriate way. I'm happy to have these discussions. They're important. But at what cost? You're putting Caledon and all of Peel, quite frankly, in a pretty horrible position. And if I was a province looking in on this, I would second that. I'll leave that with you, and I'm going to ask that this actually be deferred. Actually, I can't defer it. Sorry, referred to the next council meeting.
Thank you. You're right, you've spoken to it. Madam Clerk, you're noteworthy of that. I will carry on with my list. Councillor Parrish.
Yes, thank you. This is 20 years in coming. It's no surprise to Caledon that you've been representing pretty small numbers of people for a very long time and enjoyed the pleasure of doing that at the expense of Brampton. And Brampton tried last time to change it, and then we've tried it every single time. And this is timely in that. And I know Catherine has said December 10th, but that's quite a technicality, Catherine. I think if we do the vote today and majority of council decides that we're going to do the change of numbers, I don't think anybody's going to come back and say you had to have done it by the 10th. I think as long as it's completed with the public meeting by the 31st and into the minister, I think we're going to be just fine. One of the things I want to add to what Councillor Sato said was the triple comes in at, as she told you, the majority of municipalities, 2 out of 3 have to vote for it. Majority of those of us sitting here at the region today, half plus 1, and the majority of the population, whichever we happen to have 54% in Mississauga. This has to go back and pass at Mississauga. And that's why it failed last time, because at Mississauga we vetoed it because we had more than half of the population. So, I mean, I understand you're upset, Councillor Innes. I would probably be upset too, but you have enjoyed, or Caledon has enjoyed, 8 votes for every one of mine for a long time. And it's not fair. You would not tolerate it if the shoe was on the other foot. I understand you're trying to delay it today so that the minister could come romping in next year and save Caledon. You guys seem to have a hotline down there. But I think today's the day to take the vote. I think we finished the process, and I think the process should be completed by the end of this year. So it's in for the 2022 election. Thank you.
Thank you. Mayor Thompson.
Thank you. I was in a NAMO board meeting, so I had to come back. You know, to me, this is dirty pool. I didn't even get a phone call from the mayor of Brampton to say, hey, this is what we're bringing forward. A walk-on without public notice to do something that's going to have a huge impact on Caledon. I would support Councillor Innes, so at least we can go back and have a discussion at council and at least have just out of sheer respect. Representation by area is how most of the municipalities, but 16 out of the province of 444 that are represented by POP. So I understand that Brampton needs representation. I don't disagree. But the smug look on a lot of people here today, I'm disappointed. We're all partners here at the table for the goodness of Peel. I don't think Caledon's ever been a lightweight. We've been very supportive of most initiatives by for Brampton and Mississauga as time has been in the past. Mississauga has really enjoyed it, just ramming it to Caledon when they had, just even with the representation you've got now. But I'm saying, come on, guys. We've got a crisis. We're all trying to work together. Show a little bit of respect. I'm extremely disappointed in how this has come forward, walked on, that's going to have a huge impact on one municipality, ram it right up the wazoo without us. We're going through a ward boundary discussion, so it's very timely. We're going to have a discussion with that next week. But, you know, I don't disagree that Brampton needs fair representation, but at least let's be a little bit respectful for one another around here. And there just hasn't been any. And, and I'm sorry, it's been a little toxic at the regional table here.
And it's not going to get any better just doing with what you're doing. And I'm really disappointed in Brampton, not even having a conversation with us ahead of time on where this is going. And I'm just really disappointed. This is what you're doing to your people in Peel. We're trying to figure out where it is. And really, at the end of the day, I don't think the public really cares who is what, if you really had to take a major vote on it. But I think we need to be, we're grown adults. Let's have a little bit of respect for one another and have a little bit of respect for Caledon. And even with less representation, what is the point even having Caledon here if this is the way you're ramming it to us? So I'm extremely disappointed on how this has been walked on. There's been a lot of motions walked on at the detriment of Caledon. We have a process and a procedure bylaw that we all should respect. And I don't think there's any major votes that's how this has come to. I'm extremely disappointed on how we've had to come here at the 11th hour to do something like this. This is just dirty, dirty pool. And I'm disappointed because you know what? I try to respect everybody for who they are and the area that you represent. But, you know, at least show a little bit of respect and give Caledon a little bit of couth to let us go back and have this discussion. I'm just disappointed in the whole process. And, you know, Mayor Brown, with all due respect, and Medeiros, Councillor Medeiros, I'm extremely disappointed in your conduct from both of you. And I'm going to just leave it at that. But, you know, let us go back.
Well, point of order, Chair. I've been named. Point of order.
Yeah.
So, Chair, it was a unanimous decision by Brampton Council, a public meeting. Now, it's not my fault that people don't pay attention. It was a public meeting, transparent, and it's been an open discussion. I do appreciate your frustration. I will.
But you walked it on today, sir.
Okay, gentlemen.
With all due respect, I have the floor. The reason why you're named
Okay,
is you walked it on
gentlemen.
today.
Unanimous Brampton Council, and there was a notice of motion. As of
No, sir. You walked this on.
Gentlemen,
If you
gentlemen,
had a
order,
unanimous,
please.
Why didn't you bring it through the process?
Yeah,
Sorry.
gentlemen, I think both points have been made. Mayor Thompson, do you have anything further?
I'm going to leave it at that. Thank you. I'll
Thank
support
you.
Councillor motions.
Thank you. Councillor Dillon.
Thank you, Chair. Can you hear me?
Yes, I can, though the clerk tells me that what is pressing upon me now first is the motion of deferral, but I have two speakers left, and I thought under the circumstances I would have the two speakers and then take it to my vote. If I'm getting leeway in that regard. Councillor Dillon has not spoken to the matter. Councillor Dillon, go ahead.
Right. Speaking to the motion, you know, I can totally understand the frustration of our Caledon representatives. You know, just dealing with them over the past couple of years, they're great representatives of their population. You know, there's a lot of crisscross that goes on, particularly in Ward 9 and 10. There's a lot of interest in some of the ongoings in Caledon and vice versa. And so we've had a good relationship, and I want to commend the professionalism of our Caledon counterparts. But when you take a look at, I can speak for myself, and hopefully I can speak for Councillor Palleschi as well. On paper, we're about 160,000 people, and I bet, you know, $5 that we're much, much more than 160,000 people. And so as regional councillors, we're not really councillors, we're almost, you know, kind of mayors of these large populations where we have to run house to house, you know, particularly in Ward 9 and 10. I'm sure Mayor Brown can attest to this as well, dealing with some of the residents here. They're at your doorstep. You got to make house calls. It's the maintenance level is a little bit different around here. And so dealing with about 160,000 people, about probably 15 to 20 places of worship we have surrounding industrial area as well. Representation does go a long way, and it's different than you know, representing land. You know, we have to deal directly with these people. We're dealing directly with their lives. COVID obviously is going on right now, and so for them to have a voice at the table, I think it's really important. The next point is less government. Though I've been an NDP in my past, I'm a firm believer in less government. And, Niagara has 32 seats, I believe, for like 500,000, and we're at 1.5 million. I think we should remain at 24 seats, and I think better government is always better than more government. And obviously that means representation. Just another point as well, by 2041, Brampton is going to be, if I'm not mistaken, about 900,000 to 1 million on paper. And I always say on paper because you could probably add at least 100,000 more who live in different types of residencies, whether they're basements or whether second units, you want to call them. And so we're going to continue to grow. We're going to actually outpace, if I'm not mistaken, Mississauga in about 20 years. And, we've had this run around, this discussion, and it seems like it's deja vu all over again. Every term of council that, we need more seats, we need more seats. But I think it's, if we don't act soon, speaking in terms of Brampton's perspective, we'll get to 2041. We'll still be at 7 seats with nearly 1 million people. And so I just wanted to add those points in. I think it's fair for the residents of Brampton. I think if you take a look at some of the federal and provincial ridings, or federal in more in particular, you have representation in the prairie provinces more than what they should be allotted in terms of population. And I think it's important to recognize that. And, Mayor Browden mentioned before, if we're actually going by population, Caledon would have 1 seat. For 50,000, I know you guys are growing as well. But to me, that's fair. And so I just want to get those comments out there. And I guess there's another speaker after me, so I'll yield the rest of my time. Thank you.
Councillor Palashi.
Thank you, Mr. Chair. Maybe I've had some technical issues lately. I'm a little bit surprised at what we're talking about. From my understanding, Brampton was going in today looking for all of the reps coming up to the region. I recall there were in-camera discussions at the city, which I can't talk about. We did have a brief conversation in public yesterday, I believe, but we weren't talking about this from my understanding, and so I'm a little bit taken back here. It's like we're dealing for scraps when we've always said, and there was reports that have come before regional council before even my time that said Brampton should have full representation here. Caledon was there for us last term when we wanted our members there, and so that's why I'm a little bit. I understand the frustration, Mayor Thompson. I completely understand what you're saying. It's extremely unfortunate. What's also unfortunate is I can't not support this. I have to. It's for our residents. I wish I could say otherwise, but I can't. I have to support it. I hope you can understand that. But that being said, I agree with Councillor Innes. It is extremely bad timing. I wish there was a different way, and there was more discussions that were happening both at the upper tier and the lower tier. But thank you, Mr. Chair.
Thank you. My last 2 speakers are the last 2 speakers from Caledon. I hope respectfully we can hear from Councillor Groves and Early. Then I will turn it over to the clerk to call the first vote. The first vote acknowledged is the one on deferral, then the main motion if the deferral should fail. Councillor Groves, then Councillor Early. Councillor Groves.
Thank you, Mr. Chair. I've participated in this type of discussion for many, many years, and I think we all know that sooner or later it was going to come down to this. Back in the summer on the patio of Symposium, Councillor Early, myself, Councillor Rosa, and the mayor's EA was sitting out there, and this was a topic of conversation. And I recall Councillor Early saying, really, Caledon doesn't need 5 people at the region. And so, this has been discussed amongst the public, the members of council. And I think we really need to remove our emotions from this. Take our emotions right out of here. It's never a pleasant discussion. I've been through 2 of these already, and it has never been pleasant. It has always been very unpleasant. So if we want to look at it realistically, I can certainly understand where Brampton is coming from, because if I was over there in Brampton and I was representing 97,000 people, and my colleague is representing 15,000 people, it's kind of like, where is the fairness in all of it, right? We talked about fairness and equity. So this is not an easy topic of discussion. This is not an easy decision. But I heard what Councillor Sato said about process and how this all worked. I heard what Councillor Parrish said with respect to the process and how this will all work out. And Mayor Brown wanted to basically wipe us out and just leave one person from Caledon at the region. So this compromise of having giving Brampton 2 and leaving 3 of us at the region, I would rather have 3 of us at the region than 1, and have 3 voices than being wiped out to 1. So I don't see any other way here for Caledon, based on the conversations that I've heard around this table, the procedure, the process. I don't see any other way out for Caledon. So if I had to choose, and this is a choice, I would rather have 3 than have 1 person representing Caledon. So we can debate this, we can defer it, we can come back, but I'm going to tell you, I think when we come back, it's going to be the same discussion. It's going to be the same conversation. And in fairness, Caledon, they walk motions on all the time at Caledon Council. Councillor Rosa and the Bolton community are always totally in the dark. So, let's just remove all of that, remove our emotions, and just let's look at this thing realistically. I am sure we're going to be able to, as Caledon grows, we'll be able to add more councillors to Caledon. So, I don't see any other way out. And I would rather have 3 of us at the table than have 1. Thank you.
Thank you. Councillor Early.
And Chair, if I just make a point of personal privilege, I did not say wipe out Caledon. I said if it was based on representation by population, that would take Caledon down to 1, but that was not the motion we placed on the floor. Thank you.
I
Thank you.
apologize, Mayor Brown. That
Understood.
was me.
Moving on, Councillor Early.
Thank you. Thank you, Chair, for letting me speak. So I'm 2 years into being a councillor, and I sit as the alternate on this region, and I do my job by streaming this region every single time you guys sit. I very rarely miss. And I think perhaps my colleague, her memory is failing, because I certainly don't remember saying that Caledon shouldn't have 5. What I have said to many people is that perhaps this regional council is just a little too fat. That perhaps we need to at least be looking at the fact that maybe we should decrease the numbers as opposed to bringing more in. And yes, we're sitting at 24 by changing to 9 for bringing us down to 3 and having Brampton at 9. And perhaps all of this is a discussion, and perhaps those are the right numbers in the right equation. But really, as a taxpayer and as someone sitting here and as a new politician, the comportment of this council today is disappointing, is what Mayor Thompson used. I'm going to use disgusting. And the smirks around the table, and this should never have been walked on as a last minute motion. It's not right. It's not fair. It's not even democratic. It's awful that we didn't even have conversation at our own council table in Caledon, and that we have none of our own public that's able even to talk about this. So, Chair Inika, thank you very much for letting me speak. I had to do that, or I think I would have, blew a fuse. But really, I've watched some items take 3 hours to go through with you guys, because all of a sudden we're talking. Maybe we got to start talking about decreasing the amount of people on regional council. And we can still do it by population, but the population numbers will be different. So thank you, but this was really, really disappointing to see.
Thank you. And the Mayor of Caledon's come on, and then I see Ron after him, who I hope is going to call the question, but I will allow the Mayor of Thompson one last kick at it. Mayor Thompson.
Thank you, Mr. Chair. All I'm going to say is just give us a little bit of dignity and let us go back and have a conversation with our council next week. That's all I'm asking for. Just
Thank you.
allow us to have the discussion.
Thank you. Councillor Starr, last word to you.
Call the question.
Knew I could count on you. Thank you, Madam Clerk. Over to you for I believe we had the deferral first, then the main motion. It's in your charge. Thank you.
Thank you, Mr. Chair. And this is the motion to defer. The motion as moved by Mayor Brown and seconded by Councillor Parish. And this would move this issue to the December 3rd Regional Council.
No, just for
meeting.
The deferral was from
Councillor Innes, I believe.
Sorry.
The main motion was by them, but the deferral was Innes, and I think it might have been Mayor Thompson who seconded the deferral
That is
request.
correct. It was moved by
Point of
Councillor
order.
Innes. Moved by Councillor Innes and seconded
Point
by
of
Mayor
order.
Thompson. Sorry.
Who has a point of order, please? Go ahead.
It's Councillor Innes can't move a deferral. I believe she moved a referral.
No. Yeah, she'd already spoken to it, so I think
My
it's a deferral.
understanding, Councillor Innes, is that you wanted this to be deferred until the next council meeting. Is that correct?
Yeah, but I spoke to it, so it's a referral. You can't speak to a deferral.
You can.
Well, what actually happened was that the chair relaxed the rules about
Yes.
that and heard a long list of people after that. So
And I just, like,
You actually can.
procedurally, these meetings are starting to drive me crazy.
Yeah.
We're walking on minutes. We're not following the rules. And inch by inch, you're eroding the democratic process around this table.
And I take
You
a great...
need to adhere to the rules. When I called the deferral, it should have just been at that moment.
Yeah,
I'm gonna leave it there.
and I acknowledge that it is entirely the fault of the chair, but on a matter of this magnitude, when several of the Caledon councillors hadn't spoken, including the mayor, I took for an item of this magnitude relative to the history of the
Point of
region
order,
appeal.
Mr. Chair.
There you have it. Yes, next point of order.
I remember Councillor Innes's words. She had asked for a deferral and then corrected herself and asked for a referral. Would that be correct, Councillor?
That's how I recall it as well, too, actually.
Okay, thank you.
And that was the confusion between the clerk and my confusion. Who are you referring it to and for what purpose?
Referring it to the next council meeting.
And that was explained, that's a deferral just for the 1 week to the next council meeting. But be that, I think it's before us as it is, and it achieves all of the above. The motion before us, Madam Clerk, back to you. If you could conduct the vote, please.
All right, thank you. I'll start off, it doesn't require recorded votes. I'll start off by asking if there's any objections. This is for the deferral.
Yes.
So I
You know,
hear-
I tell you what,
hearing that there are objections.
No, if I may, I think we should go one by one in something of this
We
magnitude.
will, but because it's not
Just in
recorded, I start off by
Yeah.
asking if there's any objections, and then I will go through and just confirm the vote, starting with Mayor Brown.
Nope.
Thank you. Councillor Carlson.
No, thank you.
Thank you. Mayor Crombie.
Nope.
Thank you. Councillor Demurla has left the meeting. Councillor Dasco.
No.
Thank you. Councillor Dillon.
No.
Councillor Early.
Yes.
Thank you. Councillor Fonseca.
No.
Councillor Fortini.
No.
Councillor Groves.
No.
Councillor Innes.
Yes.
Councillor Kovac. Councillor Kovac. Councillor Mahoney.
No.
Thank you. Councillor McFadden.
No.
Thank you. Councillor Maderos.
No.
Thank you. Councillor Paleshi.
No.
Thank you. Councillor Parrish.
No.
Councillor Raz.
No.
Councillor Sato.
No.
Councillor Santos.
No.
Thank you. Councillor Sinclair. Councillor Sinclair?
I think he's trying to get on here.
Okay. Come back. Councillor Starr?
No.
Mayor Thompson?
In favor.
Thank you. Councillor Vicente?
No.
Thank you.
Where was my vote? Ian Sinclair,
Councillor Sinclair, what was your vote? Sorry?
in favor.
In favor. Thank you. And the motion is lost.
Very good. On to the main motion.
Okay. And I will read this. I just want to confirm the movers and seconders. I have Mayor Brown as the mover, Councillor Parrish as the seconder. Whereas the Council of the Regional Municipality of Peel, in brackets the Council, has reviewed the number of its members that represent each of its local municipalities pursuant to Section 218(6) of the Municipal Act 2001, which will be referred to as the Act. And whereas Council has formed the intention to pass a bylaw pursuant to Section 218(2)A of the Act to change the number of its members that represent the City of Brampton and the Town of Caledon while maintaining the number of its members that represent the City of Mississauga, thereby maintaining the overall number of members of the Council. Therefore, be it resolved that notice be given pursuant to Section 219(1) of the Act of Council's intention to adopt a bylaw to 1. Change the number of its members that represent the City of Brampton and the Town of Caledon by increasing the number representing Brampton by 2 to 9 members and decreasing the number representing Caledon, thank you, by 2 to 3 members. 2 to 3 members is what I've got written there. To be effective for purposes of the municipal election to be held in October 2022 and for the purposes of the composition of the council for the term of office to result from that election. And 2, to provide that the two additional members representing Brampton be selected by the Brampton City Council from among the city councilors to represent Brampton on council for a full 4-year term. And further, that staff be directed to organize a public meeting to be held to consider the matter of council's intention. We'll now begin the recorded vote. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demurla? Councillor Demurla has left. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Early?
No.
Councillor Early opposed. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Yes.
Councillor Groves in favor. Councillor Innes?
No.
Councillor Innes opposed. Councillor Kovac?
Stop saying.
Councillor Kovac? Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi? Councillor Paleshi? Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
Opposed?
Councillor Sinclair opposed. Councillor Starr?
Yes.
Councillor Starr in favor. Mayor Thompson?
Opposed.
Mayor Thompson opposed. Councillor Vicente?
In favor.
Councillor Vicente in favor. And that motion carries. Thank you.
The motion carries. Moving on, item 21, other business or councillor inquiries. Seeing none, That brings me to notice of motion that was dealt with the bylaws. I have a motion before me, Councillor Sato, seconded by Councillor Vincente, that the bylaws listed on the November 26, 2020 Regional Council agenda, being bylaws 71, 2020 and 72, 2020, be given the required numbers of reading, taken as read, signed by the regional chair and the deputy regional clerk, and the corporate seal be affixed thereto. All those in favor? Do I have any opposed? That is carried. Thank you. We now have to go, motion to defer 24.2, one of the in-camera items, which was an oral update on labor relations. I have a motion before we go in camera that item 24.2, update regarding public health staffing response to COVID, be moved to the December 3rd meeting, just in the interest of time. If someone would move that motion of deferral, if I could get Councillor Dasco, seconded by Councillor Singh, to Councillor Dillon to move that deferral of an in-camera item. All those in favor? Are there any opposed? That is carried. With that, there are still a couple of items that we have to go in camera for, Madam Clerk. So over to you to proper.
Chair Nika, a question. It's Mayor Brown here.
Yes.
We have our Brampton budget city council meeting at 5 o'clock. I wonder, is there any timelines for the matters that are in camera that require us to deal with it today, given the fact it's 4:54? Otherwise, if it's time sensitive, I will ask the clerk to delay the Brampton budget meeting.
Very
if there's
good.
Something that is time sensitive.
Mayor Brown, very good point. With the help of my clerk and my commissioner, we've dealt with 24.2, 24.1 was dealt with. 24.3, Councillor Medeiros, that was a matter you had, advice that is subject to solicitor-client privilege communications.
Yeah, and that's fine for next meeting.
Very good. 24.4 was dealt with. 24.5, the local appeal, Zero Waste Drive, Brampton City.
That was me, Councillor Dillon.
And Councillor Dillon, you were happy to leave that for a week?
I wanted to defer. I was unaware of this. It's my own ward, and I think it's a significant item, and I wanted to defer it to the new year.
Very good. Oh, okay. I'm told that's okay, so we're getting it deferred in any event to the new year, and I'm told that that's, we'll refer to the next meeting and deal with it then. How's that, Councillor and Councillor Dillon, and that'll sort us out for today.
There's a significant amount of reading and information and things I got to look into. I prefer the new year. It's in my ward. Like I said, this is a major development, and so I think we need some more time on it.
Okay, just to be clear to the commissioner, how best to deal with this. He's being helpful to try and get it off the agenda now. Go ahead.
If we can defer it to the next meeting and then we can have the discussion, if you want to defer it further, we'd need some legal input in that. So if we're prepared to defer it for a week, that would be great. And then if you need
So
further
Councillor, we're
time,
going to
we
get
can
you to
deal with
kick
it
the
then.
ball twice, perhaps.
Thank you.
Okay, but your point's understood. Thank you very much for that. The last in-camera item I had, 24.6, Councillor Santos, moving forward with Rapid Housing Initiative. Do you still require that to be dealt with, Councillor Santos? And is there a timing issue on that, Madam Clerk, you're telling me?
It's a timing issue, I think.
And you can deal with it very briefly, I'm hoping?
I'm asking staff if it is a timing issue or if we can defer it till next week.
Staff, can you clarify?
I believe a 1-week deferral, Mr. Chair, is not an issue, so I think we can put this through to December 3rd.
I apologize for interrupting.
Oh, Janice?
Oh, sorry?
Sorry.
We must approve this by tomorrow, the deadline back.
Okay.
Oh, I'm sorry. My apologies.
Is
Okay,
November
understood.
27th.
So thank you, Councillor Santos. It has to be dealt with now, we're being told by the Commissioner. So we have to go in camera to deal with this matter. Before I do, Councillor Fortini, you're on the agenda. Was there something you wanted to speak? You're on my dais. Was there something with regards to some? Go ahead.
Since we're going in camera, we should deal with 24.3 just as legal advice. On Councilor Medeiros, I think I second that motion. Just get advice.
I think Councillor Medeiros said he was happy to leave that for a week, and I'm hoping we can leave that, Pat, for a week.
Okay.
Okay. So now we are going in camera because we must on item 24.6 and only 24.6, with thanks to everyone involved. Madam Clerk, over to you to get us properly constituted in camera.
Thank you, Mr. Chair. Just have a motion moved by Councillor McFadden and seconded by Councillor Groves. The council proceed in camera to consider reports related to the following: moving forward with the Rapid Housing Initiative, a position plan, procedure, criteria, or instruction to be applied between any negotiations or on or to be carried on by or on behalf.
If everybody again can mute, please. Everybody, if everybody can mute accordingly, thank you. Madam Clerk?
Thank you. So we're going to move in camera to deal with the Rapid Housing Initiative matter. And are there any objections?
Seeing none,
That carries.
and we'll tell, or wait for the clerk's staff to tell me when we're back in proper session. Okay. We are back in public open session. Madam Clerk, over you to conduct the appropriate votes.
Thank you. Got a motion moved by Councillor Santos and seconded by Councillor Raz that the recommendation contained within the confidential report listed as item 24.6 on the November 26, 2020 Regional Council agenda be approved and become public upon adoption. And this does require a recorded vote. Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie. Mayor Crombie. Councillor Demurla had to leave the meeting. Councillor Dasco.
Yes.
Councillor Dasco in favor. Councillor Dillon.
Yes.
Councillor Dillon in favor. Councillor Early. Councillor Early. Councillor Fonseca.
Yes.
Councillor Fonseca in favor. Councillor Fortini.
Yes.
Councillor Fortini in favor. Councillor Groves.
Yes.
Councillor Groves in favor. Councillor Innes.
In favor.
Councillor Innes in favor. Councillor Kovac. Councillor Kovac.
Yes.
Councillor Kovac in favor. Councillor Mahoney. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden.
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros.
Yes.
Councillor Medeiros in favor. Councillor Paleshi.
Yes.
Councillor Paleshi in favor. Councillor Parrish. Councillor Parrish in favor. Councillor Raz.
Yes.
Councillor Raz in favor. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair.
In favor?
Councillor Sinclair in favor. Councillor Starr.
In favor.
Councillor Starr in favor. Mayor Thompson.
In favor.
Mayor Thompson in favor. Councillor Vicente.
Yes.
Councillor Vicente in favor, and that carries. Thank you.
Thank you. With that, I now have a motion moved by Councillor Dasco, seconded by Councillor McFadden, that the bylaw to confirm the proceedings of Regional Council at its meeting held on November 26, 2020, and to authorize the execution of documents in accordance with the Region Appeal bylaws relating thereto be given the required number of readings, taken as read, signed by the Regional Chair and the Deputy Regional Clerk, and the corporate seal be affixed thereto. All those in favor? Do I have any opposed? That is carried. And finally, moved by Councillor Kovac, seconded by Mayor Thompson, that the November 26, 2020 Regional Council meeting be adjourned. All those in favor? None opposed. That is carried. Thanks to all and staff for a long day.